So true, funny it seems, always in time, but never in line for dreams. Head over heel, won't do the tell. This is the sound of my soul. This is the sound. I bought a ticket to the world, but now I've come back again. Why do I find it hard to write and explain? Oh, I want the truth to be said. I know this match is true. I know this match is true. With a thrill on my head and the pill on my tongue, deaths of the nerves that have just begun. Listen to Marvin all night long. This is the sound of my soul. This is the sound, always slipping from my hands. Set a time of its own. Take your scissored arms and write an explain. But I want the truth to be known. I know this much is true. I know this much is true. I bought a ticket to the world, but now I've come back again. Why do I find it hard to write and explain? Oh, I want the truth to be said. I know this much is true. I know this much is true. suggestions. He's so nervous, avoiding all her questions. His lips are dry, her heart is.
Good morning, everybody. It's my great pleasure to start the second day of our winter symposium. So today the plan is to look forward, to pave the way forward, to see how science and policy can interact to a more effective climate change policy. Later in the day, we also would like to present our thoughts how a Swiss TPH decarb strategy has to look like, and we will even give you the opportunity to vote on some aspects of these plans that we have to see what is your opinion, how this should be done in a scientific institution in the future. But first of all, I'd like to start with Rainer Sauerborn about his talk, Research Agenda, Method for Studying Climate Change Impact on Health and Adaptation Effectiveness. Rainer Sauerborn is probably very well known here. He's a physician and was head of the Institute of Global Health in Heidelberg between 1979 and 2016. He was also 3 years as a district medical officer in Burkina Faso and is member of the IPCC. Okay, the floor is yours.
Thank you. Well, good morning, and thank you very much to the organizers threefold. First, for inviting me. That's very kind. Second, for a wonderful conference, not only content-wise, but also very nifty organizational things like the app and so forth. So we learn a lot here how to do this in Heidelberg. And third, the very warm and hospitable reception, particularly the dinner yesterday was very nice and very cozy. So now let's start with the presentation. This looks like I give a 2-week seminar on research, and I can't and I don't want to. I just want to highlight some of the specifics. Why is this research different from all the other research that you who have not done this research on climate change and health compared to that? What's different? Those who have already done a lot, please forgive me. I will give one example of work that we currently are doing. We just started a large project in which the Swiss Tropical Institute is also involved. So, our social motivation is, of course, this map. You all know this, these morphed world maps. The first one is the cumulative emissions. The culprit is in the north. The second is the estimated mortality impact. The victim is in the south. And research, we are not performing well. It follows the same inequity, the same divide, the same gap between needs, where most of the impacts are, least research is done. That's a big problem, ethical, but also scientific. The gaping gap, why is that so? Why does health perform much worse than agriculture, forestry, fishery? Health outcome, we did biometric analysis, is twofold less than any other sector in climate change research. The first one is political. Of course, we know, well, resources are inequitably distributed, research capacity is inequitably distributed. But that's not enough. There is still something to work on this. But there are science-specific challenges, and I will go through a list and highlight some of them in my talk. The first excuse that researchers always say, well, the data are so bad. You can have daily mortality data in Göteborg, but not in Ouagadougou. So we can't do really research on health impacts of climate change. Plus, the meteorological data are not so good there, so we have 50 weather stations in Basel and 30 weather stations in Burkina Faso. So how can you do research? So we better concentrate where the light is to find our key. You know this joke, why do you look for your key under the lantern? And he says, because I can see here, not because I lost it there. So different, but there are other reasons that are really specific for climate change that is nobody's fault, or nobody's cannot reproach anybody of this. Different timescales. Climate change, by definition, unfolds over decades. Now, what's the average time of the Swiss National Fund funding period? 2 decades? Oh, it's of course 3 years, like in Germany. And how can you compress research on climate change in such a small time frame? Different spatial scales. Climate change unfolds in large, regional, or so we think, impacts, and health is very small. Larva development, a mosquito, malaria mosquito flies 500 meters if it's very fit. So the health dynamics and the climate dynamics are also spatially different. Then we need to work with models, and we are not used to this. I was accused by my colleagues, some of my colleagues, that this is voodoo science. Where's the p-value? Where's the confidence interval? Where's the hypothesis testing? Where's the RCT? You know, that's our paradigm in public health. Uncertainty is measured very differently. Yesterday we had a glimpse of how climate scientists measure uncertainty. These bands around the projections were not confidence bands, of course, but they have other ways. We have to learn. We have to get in bed with unusually bedfellows. Who has worked with a climate scientist? Who has worked with a meteorologist? We are used to working with anthropologists, economists, and a large range. We are interdisciplinary, yes, but not with these guys. So that's a cultural or a scientific communication problem. And then there are inherent problems in the topic. So we have exposures and we have outcomes. And the exposures from climate change is not only temperature, it's not only rainfall, it's wind, there are 9 meteorological variables, sea level rise, you name it. And each of them have extremes and gradual changes. Very different effects of a heat wave and gradual warming to impede on agricultural productivity in Africa, for example, for farmers. So we have 9 variables, and they are either gradually changing or extremely. They have bouts, and they have different health impacts, as you can imagine. Then we heard yesterday that climate science can be subdivided in mitigation, adaptation, co-benefits, health effects that arise when you mitigate, and impacts. So it's a huge agenda. So how do we focus? Even on the health side, we have some work to do because climate change affects mortality, affects morbidity, affects disability. So if a minister or somebody from the development corporations wants to know how much health burden is additional to the existing burden from climate change, you have to add this up. Can't only do mortality. And the last thing is here, the last but one, there are 100+ climate-sensitive diseases, meaning diseases that react to climate change. And there's no climate change disease proper, which gives you green stripes on your left cheek or so, where you can say you have a climate disease, you have a climate disease. It's the existing diseases that get a little bit worse. And this increment has to be captured. That's our challenge. So let's talk about the data gap. Morbidity and mortality data are, by and large, not very valid and very segmented and very biased because they are generated from health services, the utilization of which is very biased towards the rich and those living nearby. So better not to use them if you want to know something about population health. Diagnostic quality varies, very little lab exams, no autopsy to confirm cause of death. So we need good population-based data, and here I've given you already what I think is a wonderful response to that problem, health and demographic surveillance system. Who knows what this is? Well, not, okay, so I'll show you, I have a graph to show that. That is basically an entire population, it's not a sample, ideally a district, which is then followed through decades. And now it rings a bell, decades, which is corresponding to the length of climate change development. In the same way, households are visited house by house 3 times a year to figure out who died, who was born, who migrated out, and who migrated in. So we have this. And look at this. These are the lifespans of these. Wow, look at this. This is here from 1960. Senegal was the first. 1960 started. So Senegal has already 60 years of observation. Others came on later. This is 2000, 2010, and counting. So that's the length of observation. You see white as interruptions. If something didn't work, they picked up. They died here, this system died. But by and large, they all kept going in very adverse circumstances. Green is Africa, yellow is Asia. These are the main victims, if you like, victim continents of climate change. So you have where the problems are, great data sets. They are quality controlled. There is the same protocol all across. These are good data. Could we make them climate ready? That's the big question. I have worked a lot in Nuna Burkina, both as a health officer in the hospital a while ago, when most of you were not born. And, but now I work there in a research collaboration. And here's this mind-boggling size of this, the richness of this data. You have 61 of these sites. The average population size is roughly 75,000. The average age of, not of the person, but of the system is 20 years. And the total population, if you multiply all this, is 4.5 million. And the person years observed is 91 million. Which epidemiologist among you has seen such a large observed population years number? So it is a great strength. We don't even have that here. Population-based data of such length. So let's see. I come to exposure now. Let's take rainfall. Simple, it seems. You just measure and then you know it. Most studies use cumulative rainfall, also those who are listened to here, but that's typical. Cumulative rainfall is so coarse. Only if you have a real mega drought, it has an impact on harvests and on malnutrition. But what's worse is the distribution within the rainy season. By and large, climate change in West Africa and also in East Africa will increase rainfall. So we could lean back and say, well, everything is fine. That was their problem, wasn't it? No, the rainfall distribution changes. You have mini droughts now. You have torrential rainfalls. And every farmer will tell you that this is bad for their crops. These are the 5 weather stations. Nuna, Cissé, you know. It's also a name there. Koudougou, Sono, and Tony. We have weather stations in that area. 2,500 square kilometers. 150,000 people. So you see, these are the number of rainy days by weather station. How they are different spatially from one village to the next. So this village had cumulative rainfall, had cumulative rainfall roughly the same as this, but it had much fewer rainy days. So those rainy days were very violent, not good for farming. Let's look at the temporal distribution of rainfall. You have 4 years here, this should be, I'm sorry, this should be 2016 here, it's moved up there, and this should be 2017. You see by eyeballing, doesn't take Einstein to see that this is very different. There's a big peak here, probably very bad. There is, and let's look at this here. These farmers started to sow when this peak came in the middle here. Then there was 2.5 weeks of nothing. Everything perished, they had to re-sow. The whole year was 800 millimeters, like Basel. That's the usual average rainfall per year. So we need to look at the distribution, not only in income assets, but also in rainfall, and all the weather variables. And this microvariation gives us a statistical strength to say something even in a shorter time period. Okay, let's continue. Now we come to health. I said there's no climate disease, only climate triggered. There are 100 plus climate diseases. This is a cartoon, of course. Don't argue with me about the length of the bar. It's just for illustrative purposes, presentational purposes. So here you have some infectious diseases. Here you have injuries. Here you have malnutrition, asthma, and so forth. There are 100. And here you have in blue the burden without climate change, and in red the increment. Very different. One have a big one have a very small one. Increment from climate change. Now, every policymaker wants to know what is the sum total of the red bars. That's so difficult. So we must choose the biggest burden with the biggest increment to make an approximation. We can't possibly do all of this, but we need to strive to have comprehensive health metrics. It doesn't help to only talk about number of infected or malaria parasites in the blood, or the number of deaths from it. You have to add morbidity, mortality, and injury or disability. So that's our challenge as health folks. Now, this is a thought experiment, so bear with me, and I hope I can make it clear. This comes from Tony McMichael, my mentor, and, well, of course, the late Tony McMichael. Let's assume here is a disease burden X. This is now, let's assume it starts here, and it would not change over time till 2100. Yeah, you can say it will go down, you can say it will go up. You can change the graph accordingly if you wish, but it doesn't change the message. Enter climate change here. Oops, here. So if nothing happens, if we all sit on our hands, this would lead to X climate impact. Very big, but just presentational. So, but we are not sitting on our hands. The government or the community or the town starts with mitigation and adaptation. What happens? Well, part of the health impact is nibbled away, is prevented because there's less climate change. Thank you. So we take away the part A there. But we don't, yesterday we heard, you have to do adaptation and mitigation at the same time. So we also adapt. That means, with the mitigation come co-benefits. So that nibble into the heart disease and the asthma, which is part of the basic global burden. Now we adapt, and we take another chunk of the climate attributable diseases away. So if you add this all up, the gross impact would be, the net would be X, and the net impact would be X minus the A bit, the B bit, adaptation, and the C bit from the co-benefits. So we would be left with this here minus this. It's a little bit difficult for me to show. It's roughly there. Is it okay? They can bring it across. Okay. Now, how do we put this all together? This is, again, a slide from Tony, and it basically stimulated me to think about the concept of our new research consortium. He said, if you want to do climate research, given that climate change unfolds over decades, funding of research is only 3 years plus, and you need to learn from the past. Use existing long-term data sets as cleverly as possible, in depth. HDSS is the solution. And then observe the present and project to the future. And that's exactly what we are trying to do. And here is maybe the wine yesterday made me so thirsty now. So you see the same, here's a line, present, past, future. And here you have this retrospective, empirical, prospective model projections, okay? So what we need, if we could choose the data at libitum, so we would have disease burden, education, income, agriculture, all the co-determinants of these diseases. We would have then trends in weather, both extremes, and so do we have retrospective weather data? Let's see. Do we have retrospective health and education data? Sort of in the HDSS. It's a skeletal database, but it's better than nothing, and they have death by cause. Of course, when we observe the present and into the future, we need to have a much larger armamentarium of instruments to measure all facets of health and all facets of weather. But here we have skeletal, but long-term. That's a big benefit. And from that we derive health exposure response function, ERF. That's the magic word. If the impact folks, the climate scientists, see that, they really get excited because they can use this as fodder for their projection models. In the simplest case, you say a 1 degree increase in Nuna, in Burkina Faso, of temperature raises, let's say, stroke incidence by 10%. Then you put it in the model has so and so many degrees, and in 2100 we have so many strokes. Very simplistic, but that's how it works basically. Then they do this for us. They downscale the climate models. Climate models have a resolution of 200 by 200 kilometers. That's roughly 2 dots per Burkina Faso, or 3. And they can downscale it at 12 by 12 kilometers. Now we are really in a scale that we know from health research. 12 by 12 kilometers, that's an enormous intellectual effort, but they do it for us, for that population where we have the rich meteorological and the rich health data. And then we can have local impact. We can have at national level whatever you want, but it's downscaled, it's for that population. It's not these global models where you see all the continents and everything is shaded in blue, red. We know this population here in Africa. And then you can talk to policymakers, and that leads to the next talk, and say, look, this is the projected impact under this scenario, under different RCPs, representative concentration pathway. That's the 8.5, 2.6. That's how bad it will get in the absence of climate policy and so forth. Here's the project, and this is from our presentation at the DFG. They had 20 reviewers from all over the world, so it was a tough thing. And these are the bedfellows. I take the word strange away because we have also the Swiss Tropical Institute here. That would be very impolite. So the Swiss Tropical Institute is here. Then here's the Potsdam Institute for Climate Impact Research. Nutrition Research Institute. Charité for heat stress. The KIT for meteorology, Karlsruhe Institute for Technology, and the Humboldt University Berlin. And most important, two African partners. This is Nuna, and this is Kisumu in Kenya. Different ecology, different climate, but similar disease prevalence of malnutrition, malaria, and so forth. So it's an illustrative example. It's not that I say this is the project. And what we do first, we make these HDSS climate ready. So we add things to this HDSS, which is done in 61 countries and 61 settings. We make it climate ready so we can do research. And we have Osman Sanko on board, whose only task is what we do here to make sure that this is extended to every in-depth center who wants to participate. It's not difficult, it's not very expensive, you will see. So here's the idea of an HDSS. For those who have not been familiar with it until now, You have a baseline census because there's no census only every 10 years. And then you follow through visits house by house to update this database through vital events. And this is birth, death, out-migration, in-migration. Okay? And then you add things. You add nifty remote sensing. And let me explain what this is here. You see here, it's not only one village, this is several households, and in green are other fields, and in yellow and red are the fields of, I think, 3 households. And in coloring, from remote sensing, they can tell us how much they harvested there. This is interesting for yesterday's talk on the crop insurance, for example. So without asking farmers, which is always dicey, how much did you harvest on that field, or how much did you harvest in all, we can measure this now validly from remote sensing. We can also get other information, vegetation index and so forth. We have weather stations, 5. You don't have to do this, that's expensive. For our research project, we were given these. You can also use NASA data. I did an exercise with students. Go to the NASA website and look at the weather at the time and place of your birth. They went back. They were all pretty young. So from 84 onwards, you have daily weather data from NASA. You can put them to the coordinates of your center or your research population, and there you are. You have the health data, you have the weather data by the day. So all the extremes, all the variations you have. Then we add sensors, for example, for cardiac stress. And most importantly, we add mobility data. You remember the DALI business? Comprehensive indicator. And everything is done by tablet and sent to the server by SIM card, so by mobile. So there's a very short delay between data gathering and data availability and analysis. That's also something that decision makers want to have very fast. Okay, this is now the concept. We have 3 main diseases, which we arguably think are the largest burden: undernutrition, heat stress, and malaria. And then we have a policy package. We have every of these diseases we do. How much of it, and how can it be prevented? Is there a new intervention that we could measure in classical terms for adaptation? And here we have our HDSS population cohorts. Community RCTs. For the adaptation, we have RCTs, because that's the effectiveness of an intervention can be measured in 3 years. And then we put the effectiveness of the intervention and the effectiveness of the intervention, the adaptation, and the impact in the absence of an intervention in the projection models, and we can project to 2100. This is only, now we focus only on malnutrition. This is a little bit busy, maybe I just focus on this one here. It's the range of, this is the causal change from weather variability to child nutrition. You have weather variability here, rainfall indexes, not total, food harvest as measured from remote sensing, household consumption, household survey, food intake, food frequency questionnaires, nutritional status, anthropometry. And that gives us one exposure response function from weather to nutritional stunting, and one from harvest to nutritional stunting. Once we have these exposure response function, remember, we give them to our climate folks, and they take it away in different climate models. This is the work we did. This is the food availability index as it refers to weather. If it's 100%, it's a perfect distribution of rainfall, and you see how much it varies. 100% is good, and 90% is not so good, and 65% is really very bad. These were really mega droughts. But even those who are only below 90% cause death from undernutrition increase in the retrospective data set. Study the past. So we did, from 1984 to 2012, we saw that whenever there was a dip in agricultural productivity from weather, there was an increase in, this is cumulative mortality, cumulative. There was a steeper curve of the mortality. And this part is the mortality from weather, and this part is the mortality from agricultural practices, change in other things. So it is based on, this is the first study that I was involved in that led to a publication where I really went the whole way from empirical data to climate projections in health. I won't get into this. This is the complexity of the agriculture and the health model, and you see that we projected. We projected here that how often it dips below 90, and it increases, you can do this statistically, by 2100. So the agricultural people know that climate change will have a very bad impact on agricultural harvest, and we know that it will lead to a doubling of climate-related child deaths from undernutrition in Nuna under the 1.5 consistent climate model. And that's the, and I saw you already standing up, so thank you very much for your attention.
Okay, thank you very much. Very interesting case study on how to do that. We are in a changing world, so we change a little bit the format and have decided today that we will take questions directly after each presentation, because this works better for remote presentation and also if you have different subject. So the floor is open. Is there any kind of question to Rainer?
Can't be, come on.
Yeah, here is one. The micro is coming.
There was a gentleman here also. Yeah.
Okay.
Eric Lenné from Lausanne. In your last presentation, last slide, did you vary with the temperature increase? Because you showed the increased mortality with 1.5, but up to now, the predictions for 2100 are much more, up to even more than 4 degrees. Recent data from...
Absolutely right. This was an existing model, which wasn't even properly downscaled, which was fixed for 1.5 degree, and we did not do the necessary, but it takes a year to downscale these models first and then use different climate assumptions. You're absolutely right, 1.5 is, the horse has left the stable, unfortunately. So we need to have different scenarios, also the more realistic one to which you refer. Absolutely.
Okay, there was a question. Maybe.
Thank you. Thank you for a very good presentation. Wine may have made you thirsty, but it didn't stop you from a very quick reflex in catching that pointer.
Thank you.
I have a small foundation at the border between India and Myanmar, where for the last 2 years we've been training farmers, but at the same time we've been looking after their health. So we conduct health assessments. We have about 1,500 farmers on our database now. Mm-hmm. One of the things that I found especially interesting in your presentation was the combination, how one links to the other, and this, I believe, has always been the case in most rural parts of the world. It's just that it's only in the last few years that people have started looking at the combination of ag and health. The question and the work that we're doing is more preventative. We're trying to understand the situation and then say, what measures do we need to take in order to stop farmers from falling sick? You know, overuse or misuse of hazardous chemicals, for example, is one. Not using PPE when they're out in the fields, you know, potential snake bites and all kinds of things. We're trying to prevent that by training them at the same time. And to do that, we go with the impact on health. And we say, look, if you don't do this, this is what you get, and so on. I just wondered whether, as a result, as a consequence of the work that you've done in Burkina Faso and Kenya, you've come up with some, training modules that would take, this information, this correlation back to the farmers to re-educate them.
Well, you hit a really soft spot in me. I like books, massive open online courses, and we've done 3 on climate change. And there is one project which does nothing but distilling the lessons, putting it available, making it available to everybody through a MOOC, which is one way of online course. So hopefully there's something useful for you. Maybe we should exchange our coordinates. That is the idea, that this is not some research that remains focused there and then we fold up afterwards, but that we inspire others. Particularly, there's an in-depth site near you. But that's not only for the in-depth sites. You have a great access to agricultural training, farmers training, and you could add the climate component. That's development as always is comprehensive. Please, I'm here.
Okay. I think this question brings us perfectly to the next talk, which is about how to get from research to policy, which is given by Janine Kuriger. Janine Kuriger is head of the division of the Global Program Climate Change and Environment at the Swiss Agency for Development and Cooperation. She has a long-standing experience and tradition in development cooperation and was also head of the SDC office in India. And the floor is yours.
Okay, thank you very much for this invitation to this very interesting conference. For me, it's really a pleasure to be here and to share with you some of the experiences and some of the work we do within development cooperation in the interface between climate change and also health. Actually, this conference is very much at the heart of discussions that are ongoing right now, also within SDC. Climate change has been there as a topic for quite some time. Our program has been existed for 10 years now, but it's only recently, and I think with all the global awareness that has increased, that it has also taken more importance within the work that we are doing within SDC. So in spring, actually, our directorate decided to mainstream climate change in all of our activities, meaning in all the different sectors and in all the programs we are working. And that's right now where we do a lot of awareness work and a lot of capacity building also within our own institution in order to really make people aware that climate change is an important topic when we talk about development cooperation. I think there was a really nice map at the beginning of the presentation of the previous presenter when he really showed that people who are most affected by climate change are those who are most vulnerable in any case. And especially the poorest within the developing countries are those who suffer the most from climate change. Adverse climate change impacts do affect every basis of life. So what we do see is impact on water availability, which has an important impact then also on the food system, food production, but which can also trigger a number of disasters. So if we look at water, it becomes clear that changing rainfall patterns can either cause droughts or can increase to flooding, which both is very difficult to handle. When we look at the food production with increasing droughts or also with changing variability of rainfall, it becomes more difficult to do the farming, and it can have important impacts on yields, but also on nutrition of the food that is being produced. And we see increase also in natural disasters because extreme events are increasing with climate change, and this brings about losses in lives, but also in infrastructure. And last but not least, the topic of this conference also in health. We have seen, I think, very nicely in the previous presentation how climate change impacts on health. So what we expect actually is if we don't take the necessary measures and if we don't work on both on the mitigation and adaptation side, poverty is likely to increase. And there are estimations that poverty could increase in the coming years to, and push 100 million people more into poverty. It is also a threat to existing development gains, so it could destroy achievements that have been made in the past. And finally, all this actually makes it very difficult to reach the Sustainable Development Goals. So from SDC side, we do work both on the mitigation and on the adaptation side. Our mission actually is to contribute to low-emission, climate-resilient development, promoting sustainable access to energy on the one side, and also invest in sustainable management of natural resources. Our references are at the international level, the Climate Convention, the UNFCCC, but also the Agenda 2030 on Sustainable Development. Within Switzerland, we are part of the Ministry of Foreign Affairs, and we do have a federal law on development cooperation, and every 4 years the Parliament approves a dispatch which will provide us with the necessary resources for the next 4 years to work on. Right now we have a new dispatch under development, and we are about to define the orientation of this new dispatch for the next 4 years. So how do we work within SDC, and in particular within the global programs of SDC? We do work at the local level. For us, it's very important that we can gain experience and in specific and concrete projects on the ground. So we do invest and support projects that have new or test new and innovative approaches to face climate change, both from a mitigation and from an adaptation perspective. The evidence that we have gained through these experiences on the ground, we bring them to the attention of the governments. So we do inform the governments by the project that we have realized about possible measures that have to be taken in order to adjust the policy frameworks, in order to define policies, and in order also to implement those. The aim being at the end that we can bring about a systemic change that is necessary actually if you want to reach the development goals and if you want to really contain climate change in the future. In all of this, science and knowledge plays a very important part. So we've heard it, I think, in the previous presentation that knowledge gap is a big issue in the global south. And that's why for us also we do invest quite a bit in trying on supporting to bridge this gap in the project that we work on. If I can give you a few examples, what we do on the one hand is that we do support research partnerships between Swiss scientists and scientists in the south on specific topics in order to generate data and also to disseminate these data. Then we do also invest in the capacity building of researchers in the south in order that they be able to do their own research work in the future. And we do finally also make sure that the information that is generated and the knowledge that is created, it is brought to the attention of different stakeholders. It is used on the one side to create wider awareness about the impacts of climate change and necessary measures that have to be taken among the population. But then especially also we use this data and information in order to inform the policymakers so that they take the necessary steps for the policies and also for implementing concrete actions. If I can give you some concrete examples, for example, in Peru, and yesterday we had a very nicely presentation about climate services in the Peruvian Altiplano. That's also a field we have been working on in the past, and the researcher yesterday, he mentioned that one big problem was the supply of adequate data in order to really being able to provide climate services. So what we have done in a collaboration with the WMO, the Meteo Schweiz, and also the Meteorological Service of Peru, CENAMI, we have worked on making the data more robust and creating as such a better basis for providing climate services, particularly for the agriculture sector. And I think that's something that really needs to be enhanced in the future so that farmers can get access to reliable data and take corresponding measures then when they have to decide about what they want to plant, when they want to plant it. Another example I can give you is also from Peru, where we have worked on glacier retreat. Glacier retreat is a problem in a lot of the mountainous region in the world, not only in Switzerland, but especially also in the Himalayan region and in the Andean region. Glaciers are important water reservoirs. If they retreat, it has impacts on the water availability of the future. And on the other hand, also, it can trigger important risks. So in the Peruvian Andes, we have studied several glacier lakes that have been formed with the retreat by glaciers. And we have calculated or conducted study to see what is the impact on the water availability and what does this mean for economic activities but also for the energy production. On the other side, we have also looked at potential risks that emanate from those glacier lakes. Glacier lakes can burst, and if they burst, they can trigger floods and bring devastation to people living downstream of those rivers. And so what we have done is to study what is the likeliness of lakes to burst and what would be the measures that have to be taken to install an early warning system. So all this research has been done in collaboration between Swiss scientists and Peruvian scientists, and the results have been shared with the Peruvian government at the regional level, and it has led to important investments by the government in, for example, an early warning system for glacial lake outburst floods. Being a global program, actually, we are not satisfied with just making a difference on the ground. I've talked about that we're looking into systemic change, that we look for solutions that can be spread and disseminated beyond just the project we are working on. And we call it the elevator approach, meaning that we bring the experiences that we made in concrete projects on the ground to different levels. First, at the regional level, where we see, can it be upscaled, the experiences that we have made in a single project, but then also at the global level in order to influence also global decision and policy making. The elevator functions in the two ways, meaning also for us, as I've mentioned at the beginning, the Convention on Climate Change is a reference, and within the Convention and the Paris Agreement in particular, countries have committed to reduce their emissions. And so we do support countries in the implementation on the commitments they have taken. And so from an international and global decision, we do try to find adequate solution in order to address the global challenge of climate change. We don't do that alone. Actually, we depend very much on partners, and we do work in partnership, multi-stakeholder partnerships. So for us, academia, I have mentioned, for really providing the data and the knowledge that is necessary to understand climate change impacts for the future. But we also do work a lot with NGOs and the private sector when it comes to the implementation of concrete actions on the ground, on really identifying new solution, innovative solution, and in also sharing expertise that already exists. And we also do work a lot with the other offices of the federal administration. Being development cooperation, we're not the experts in a specific topic. I mean, we have experts when it comes to environment. We very much rely on our colleagues from the Ministry of Environment. On health, we collaborate very closely with the Ministry of Health. So we do try to get together the best available expertise and knowledge when we implement our projects. On the global level, we are engaged as Switzerland, as I mentioned, in the convention itself, so we are part to the negotiations, but we also support a number of global platform and initiatives that also tackle the issue of climate change. So now I would like to provide you with two concrete examples where we can see a clear link between climate change and health issues. And I would like to start with the topic on air pollution. I think we've already heard a lot about air pollution, but it's really something I think that is becoming more and more important and where we have clear impacts on both sides of climate change and on health. So I think also Nino Künzli mentioned it yesterday in his presentation, that if we are ambitious on the mitigation side, we can and reduce CO2 emissions. At the same time, we can also address harmful pollutants, like, for example, black carbon. Through targeted measures on short-lived climate pollution, we can have both benefits from the climate and from the public health side. And so if we do work, for instance, on reducing emissions from fossil fuels, which are, or diesel, for example, which have a high content of black carbon, we can at the same time also tackle health benefits. So I think showcasing, it is important that we can showcase that mitigation can benefit also health, and that it is also worthwhile to invest in it. Because according to the estimation of the WHO, about 7 million premature deaths are estimated to happen because of air pollution. Air pollution has a real cost for the societies and the economies, and therefore it's worthwhile really to invest in it. It is estimated that premature deaths due to ambient air pollutant amounts to about $5.7 trillion in welfare losses, or which are about 4.4% of the global GDP in 2016. So this is an estimation of the WHO. We do support different projects in different regions of the world on air pollution. It's actually a topic in which SDC has been involved for quite some time. I remember the first projects around the year 2000 that we have in Latin America, and at that time nobody really talked about the link between air pollution and climate change. But still, it was already a topic at that point in time. So nowadays, actually, we do work on this topic, and we have different focuses. On the one hand, we do create knowledge and disseminate knowledge about different sources of air pollution. Then we do also support the development and promotion of clean technologies in order to reduce the pollutants. And finally, we do also work together with the government in order to improve their legislation and to take the necessary action and measures to reduce air pollution. Right now in Latin America, we have a program running in different cities, in Santiago de Chile, in Lima, in Bogota, and in New Mexico. And the aim of this project is to reduce air pollution from buses in particular by promoting black carbon-free buses or which do fulfill the Euro 6 standard or which are on an electric basis. We have another program in China. In China, we have worked for quite some time on air pollution. In a first program that we had in the year between 2011 and 2013, we basically worked on reducing black carbon emissions from mobile sources. We have supported in that instance the Chinese government in establishing a national inventory on black carbon. Then we have also worked on retrofitting construction machinery with particular filters, because actually this is one of a major source, and in countries like China where a lot of construction is happening, actually it's really an important source of pollution. And then we have also supported China in the revision of their air prevention and control law. And this has been done with our colleagues from the Federal Office of the Environment, because the Chinese have learned about our clean air policy within Switzerland, and they were very much interested in order to get the expertise and get the information on how the law has been developed and implemented. So right now, this year we have started a new program with China, also on air pollution, and this time we are focusing on developing new methodologies to identify sources of air pollution using real-time source apportionment. And this work is being done with different research institutes in Switzerland, with the Paul Scherrer Institute, with EMPA, and also with the ETHZ. and on the Chinese side, we do have the Chinese Academy of Science. And the aim is, if we have a better information still on and real-time information on sources of air pollution, we can further improve actually the policies around it. And last but not least, we also work in India on air pollution. India has been in the news, or is frequently in the news about the high level of air pollution that they have. I think according to WHO, 7 of the 10 most polluted cities are in India. And having lived in India, I know what it really means, having high air pollution. So India has taken now strong measures also to really tackle the problem, and they have issued this year a program on air, on clean air, and we have decided to support the implementation to this program through working with some select cities in India. I showed you the elevator, so these experiences that we do on the ground and in specific places, we want to bring them to attention at a larger scale. And one of the vehicles we do that is through the Climate and Clean Air Coalition. Nino Künzli mentioned it yesterday. It is a coalition of 140 members, non-state and state members, who have come together in order to really address the issue of short-lived climate pollutants. As Switzerland, we have right now the co-chair together with the Philippines, and we really see it as an interesting platform to, on the one hand, increase and still raise the awareness about air pollution, but on the other hand, also as a platform where we can enhance also ambitions of the different government members in order to really tackle the issue. There is the science panel, which is linked to the Clean Air and Climate Coalition, which we found it's very important because it provides us with the necessary information and up-to-date scientific research on short-lived climate pollutants. And we're really happy that Nino Künzli will be a representative for the next 2 years. I would now switch to another very important topic, and I think which has also been already touched upon yesterday, which I call the cooling challenge. We've seen with increasing temperature, cooling will become a more important topic because increasing temperature and heat waves will more and more affect our health in the future. And it's interesting because also from the presentations of yesterday, it does not only affect the global south, but it also affects actually the northern parts. And I think the climate scenarios of Switzerland, they also show the quite scaring image, what we can expect in the future with regards to heat waves. So the Energy for All has estimated that over 1 billion people are without access to cooling and face therefore increasing risk to their health and their productivity because they cannot properly store fresh food, they cannot receive safe vaccine, and they cannot find shelter in a heat wave. And that's actually a little bit where we come in and what we take as a reference for the work we intend to do in the future on the cooling side. Cooling, I think, also brings about an important or a considerable risk of a trade-off with mitigation efforts. Because it's clear if we have to cool more in the future, we would need more energy, especially if we use air conditioning devices. And now, calling it a trade-off because on the one hand we have to protect ourselves against increasing heat, but on the other hand we also would like to reduce the emissions that are being caused. And so how can we do that? I think we can do that through actually using efficient and up-to-date devices on the one side, but then also on really working towards avoiding these high potential HFC gases, which are much more actually much more harmful to climate than CO2. I would like to give you an example of the building sector, because that's a sector where we already worked on the topic of cooling for quite some time now. We have an important program running in India where we work on energy efficient buildings. And the way we have approached this was really to see how can we improve from the very start, or how can we conceive from the very start a building that uses less energy than a conventional building. And also using different methods, such as also passive cooling, in order to really bring down the temperature within the building itself. And building is a very important sector because it contributes 40% of the CO2 emissions globally. And with the increased needs for cooling, it is estimated that the energy consumption would increase by another 35%. So you can imagine, if we do the construction right, there is a huge potential really to reduce emissions that come from the building sector. So based on the work that we have done in this building program in India, we were approached by the government and we supported them in the development of an energy conservation building code for residential buildings. And this building code really much focuses on different measures that can be taken in order to reduce energy consumption in a building from the very start. So it sets minimum building envelope performance standards, which aim at limit the heat gains or losses, because we're looking at different climatic zones. So we would like to, on the one hand, in the hot zones, heat not to enter the building, and in cold zones, or warm ambient in the building not to be lost. On the other side, we're also looking at adequate natural ventilation potential. So how can we already build the building in a way that we don't really need to use air conditioning for bringing down the temperature. Obviously, in very hot climates, you will never be in a position just through passive cooling to bring down the temperature completely, but at least you can already have a good baseline when you do build your building in an adequate manner and build it in a way that the thermal comfort is being improved. And then there is also an issue about adequate daylight potential, which will actually also help to reduce energy consumption. So actually what we have been able to show, and also through this building code, there is now a big potential to reduce CO2 emissions that come from the building sector, and the potential estimated for India, if the code is being implemented, is 100 million tons of CO2 equivalent abatement by 2030. But the other aspect, which we always stress very much, is also we also improve the thermal comfort of the building itself, so which makes it more comfortable for the residents who are using these buildings, and which has a positive impact on their health and productivity. So this is my last slide. We just joined two initiatives who are working on cooling. One is the cooling secretariat under the Energy for All initiative. And here we do basically focus on the policy level. And on the one hand, on creating awareness, still more awareness about the gap that exists in cooling worldwide. They produce on a yearly basis the Chilling Prospects report, and the last one just came out recently, which really shows where are the biggest gap in cooling for the future. And then they also support governments in taking measures to develop and implement cooling plans. So they play an important awareness raising, communication, and also advocacy role. On the other hand, we also intend to do a collaboration with the Kigali Cooling Efficiency Program. This is actually an initiative under the Montreal Protocol, which aims at phasing out the HFCs. And here, through this initiative, we will be working more on concrete actions on the ground. So there will be technical assistance provided to help development countries to improve their climate-friendly cooling policies, standards, and program. But we would also work on innovative technologies and ways in order to really tackle the cooling issue in particular in the food value chains, on vaccines, and also in the building sector. So I would like to finish just by saying all this, what we're doing is really contribute to the implementation of the Paris Agreement on the one side, different SDGs, I've mentioned here SDG 7 in particular when it comes to energy questions, but then also other international agreements such as the Kigali mention of the Montreal Protocol. So thank you very much for your attention.
Thank you very much. We are a bit behind schedule, but I think we have time for one question. Yeah, in the very back.
Hi, Rebecca Lays Kushner. You said you were invited by the government of India to help with reducing pollution in cities. Are there other situations where you have to push to get your agenda accepted so that you're getting pushed back from governmental players on, you know, this really isn't important, or we don't have money for it, or other issues?
The way we work from ASCC side is really we work based on needs that are being addressed. So in all our programs, actually, we have a very close exchange with the governments, and we do define with them the priority areas on which they would like to work with us.
There was one question. Let's take this as well. Just behind the...
Hello, I'm Aditi Bunker from the University of Heidelberg. Thank you for your interesting presentation. I have a question. I noticed that the building intervention that you mentioned was mostly related to new buildings. What about solutions for the massive number of existing building stock?
Yeah, you're right. I mean, retrofitting is also a big topic. We have decided to start actually with the new buildings because if you take India itself, there is a number that between now and I think 2030 or 35, 70% of new buildings are still to be built. So actually we saw there is a huge potential if we can really influence the way new buildings are being built with regards to CO2 emissions. But you're right, retrofitting is also an important topic, and we are about to start also a collaboration with China where, for instance, also this retrofitting is specifically targeted.
Okay, thank you very much for your contribution. And we go now directly to the next session. So we have parallel sessions now. Here is the session Prediction and Monitoring for Impact, and in the other room, Adaptation Plans. So all the best.
Reach out and touch me. Come on, honey, tell me so, baby. Now he's acting shy, looking for an answer. Come on, honey, let's spend the night together. Now, hold on a minute, before we go much farther. Give me a dime, so I can phone my mother. They catch a cab to this high-rise apartment. At last he can tell her exactly what his heart meant. If you want my body and you think I'm sexy, come on, sugar, let me know. If you really need me, just reach out and touch me. Come on, honey, tell me so. Oh, no. His heart's beating like a drum, 'cause at last he's got his girl home. Come on, relax, baby, and now we are alone. Oh, yeah. Day
Hello, thank you. Thank you, everyone. We'll start. If you could please sit down. Sorry, if I can get your attention, please. We're sorry for running a bit late, but we'll start now. We've changed the way we're doing it a bit. So instead of having all the questions at the end, we'll have them at the end of every session. Please feel free to ask your questions in person. If you would rather, you can also put them on the app. And if we don't have enough questions in person, we'll then move on to the app. So we have 20 minutes per talk and then 5 minutes for questions. So to begin with, I'm very pleased to introduce Ana Vicedo, who's an epidemiologist from the Institute of Social and Preventive Medicine in Bern, who'll talk about predicting mortality due to heat. So please.
Works? Yeah, perfect. Good morning, everyone. And first of all, I would like to thank the organizer for giving me the opportunity to give this talk today. For me, it's a pleasure being here, back in Basel, in what I consider my second Swiss home, to present basically what has been our work within the MCCO, the Multi-City, Multi-Country Collaborative Research Network. I will explain in a second what is this. In relation to the prediction of heat-related mortality, let's say on current and future periods, at a global scale. So let's move first to give a brief background of that. We know that climate change is a global public health issue, and actually what we know is that in fact it's affecting every single element in this world, every single population, but let's say in a different way, in a different level. Basically because if we think in a schematic way, we know that the health impacts that we observe might depend, of course, first on the hazard. We know that in some places, people might be exposed to a higher, let's say, frequency of heat waves compared to others. At the same time, we know that the exposure, the level of exposure might depend as well on how prepared are, let's say, the populations, if they have specific plans let's say, to protect from heat waves, etc. And finally, of course, vulnerability, because in a way, as individuals, we know that we are more or less capable to cope heat or to cope any other environmental hazard. So in some ways, let's say that this is what this translates is in a lot of different challenges for us as climate change epidemiologists, because when we want to assess what is the effect of the impact of climate change, or more specifically temperature or heat on health, we cannot just say that the effect that we observed here in Switzerland is the same that we might expect to see in Spain or in other places. Or even within Switzerland, the effect that we find here in Basel, of course, cannot be compared to the one that we can see in Bern. Eventually, the thing is that we have to think about in a broader point of view and address what is called this global epidemiological approach, that in a way allow us for first to get a comprehensive picture of the impacts of health in different areas, in different regions. At the same time, this geographical heterogeneity that we actually found already would give us some hints about vulnerability, what are the main factors that can be associated with more or less vulnerable populations, and at the same time can help clarifying what are these complex adaptation processes that are behind all these associations. And in a more, let's say, methodological way, we know that having this broader perspective, this global perspective, we can overcome this potential, let's say, limited comparability that we have seen in previous studies when we try to compare findings from different location-specific or regional studies. And finally, of course, by having, let's say, more data covering different areas, etc., we can efficiently address the complexity of the association that we know in the case of temperature and mortality. And at the same time, we are able to address these complex research questions. So this idea of this global epidemiological approach is something that a group of researchers came came across with this idea. Actually, 4 years ago, exactly in this venue, it was the 2014 conference of the International Society of Environmental Epidemiology, and basically a group of, I think it was around 10 researchers from 6 different countries in the world said, well, maybe we can join together, and instead of running separate analysis in each of our countries, we can put all this data together and maybe address these questions and even more complex one, is how this MCC in a way started. And the good thing is that we, this started in a more, let's say, as I said, in a very very informal way between some researchers led by it was Antonio Gasparini and Ben Arson from the London School of Hygiene and Tropical Medicine. And nowadays, this constitutes, after 4 years, the biggest consortia on weather and health currently working right now. You see here our website where you can find all this information, but let's say in a brief way, I can just tell you that this is an international collaboration aiming at producing epidemiological evidence on associations between weather and health. Based first on this global perspective, in a way we collected information from different locations across several countries, continents, heterogeneous populations, not only on demographic structure, socioeconomic status, etc., but also various climatic conditions. Of course, this allows us to apply a common methodological approach that for us epidemiologists is very important, because this allows us to, let's say, to compare estimates more efficiently between locations. And finally, this allows as well a clearly collaborative research setting that helps, let's say, boosting networking and collaboration between different researchers with common interest, research interests. So nowadays, this has increased in the last years, and it's let's say that we have today up to 41 countries in 638 locations in the world. And this is the map of the different locations that are spread around. And in this dataset, we included daily time series on mortality counts, weather variables, and air pollution. And on the other side, we collected information on location-specific meta-variables, that is, on climatological, geographical, infrastructural, demographic, and socioeconomic characteristics. And in this case, as you could see, Switzerland, maybe you don't see it, is also included. Myself and also Martina Raglete, we are the Swiss partners in this consortium. So now I'm going to guide you through what have been like a summary of the main findings that we obtained during the last, let's say, since the MCC started 4 years ago. Just to start with, this is the second study that was published, but this is the most important one so far, which has been highly cited and has constituted one of the, let's say, the reference studies on the field of temperature and mortality. This was published in 2015 by Antonio Gasparini in The Lancet, and the main findings here you can see let's see if this works exactly. Here you have what they estimated the attributable fraction, or let's say the excess death, attributed to different ranges of temperature, not only heat but also cold, and different ranges between moderate and extreme. And the main findings were that actually 7.7% of mortality can be actually attributed to non-optimal temperatures that we call, in a way, that is all temperatures that is not the temperature of minimum mortality. And what was somehow a bit of conflicting, let's say, finding is that actually most of the mortality that we observed was mostly attributed to cold instead of heat. Yeah, this was taken by some politicians actually, saying that maybe in the future climate change is going to be good for us, because in a way, given that the temperature is going to increase, cold-related mortality is going to decrease, and in a way we will be happy in the future. But no, this is not the case. And actually, if you have a look to the article, it's really clearly explained that this is basically based on the definition how we let's say, stratified heat and cold. Because in a way, the cold-related part is the days defined as cold are higher the frequency is higher within a year compared to cold, because the temperature of minimum mortality, that is the way how we define the two branches of heat and cold, is closer to warmer ranges, say between 16th and the 60th and the 90th percentile. So eventually they have, when we translate the risks for cold, although the relative risk is lower compared to heat, given the fact that there are more days within the cold range, this translates in a higher impact. So if we move forward, something that we as well, why is not, no. On the other side, we try also to focus on only on heat waves. In this study led by our colleague Yuming Guo, they found that actually there was a high risk associated to heat waves, high risk of mortality, that was clearly increasing when the threshold defined, let's say how the warmer is the heat wave, the higher is the risk. But something that was quite a striking result is that the number of days in a row contributing to this heat wave doesn't add, let's say, to the overall effect. Eventually, you see that the effect was relatively similar depending on 2, 3, or 4 days in a row. On the other side, given that we had enough data, let's say temporally spread in time, we were able to see the temporal trends. And this allowed us to understand a little bit more about the adaptation mechanism. And in this case, what we found is that, although I didn't show it here, and you can see it in the paper, while for cold we didn't find any clear pattern, temporal pattern, in heat we found that actually there was a decrease in heat-related mortality that in a way told us a bit that it seems that the population is, we are getting somehow adapt to heat, although today still constitutes an important environmental hazard. Then on the other side, given that we have this spread of locations around the world, this allows us as well to understand what are the main drivers for this heterogeneous association. And again, what we found is that while for cold, we didn't find a clear pattern between different, let's say, indicators, area-level indicators, that is socioeconomic indicators, and even, for example, we included as well air pollution levels and green area, etc. For heat, was clear that there was a quite consistent pattern with higher heat-related deaths in areas that are more urbanized, and as well with more inequalities, as you could see here with the Gini index. But this was just, let's say, one bunch of the studies that we have done, and let's say motivated a bit about this idea of cold-related mortality, heat-related mortality that we found in the first article that I just showed it to you. We try to, let's say, go a little bit step forward and say, okay, let's gonna estimate what it will be, the impact in the future if population today, we are exposed to warmer climates consistent with these climate change scenarios that are derived based on different emission pathways. So in this study here, what we found is that actually, as expected, the heat-related mortality, this here you can see in red, increases in time, and it's more steep in where the, let's say, when the emission, let's say you consider warmer, let's say, scenarios consistent with, for example, RCP 8.5, that is the extreme warm, let's say, extreme emission scenario. And at the same time, as expected, cold-related mortality decreases at the same time. But again, the question, what happens if we sum both contribution, this decrease and this increase? What we saw actually, I'm sorry, it's just because sorry, can I come back? Because I don't know how I can come back. The problem is that this presentation is the old version. I uploaded one this morning, so in any case, that's why I was a little bit confused. Could you please come back to the former, yeah, this one. What we did actually in the previous study is try to sum up. What we see is that the net effect was actually positive in most of the locations. And this was something that we actually found as well in this study. Instead of just showing the temporal trends, what we try to estimate only is what is the, let's say, the benefits of, let's say, sticking to the 1.5 degree. I mean, let's say if we are exposed today to a warmer climate of 1.5, what would be the benefits if we were exposed to like warmer climates like 2 or 3 degrees. And actually what we found is that this 0.5 degree of difference really matter in a terms that, for example, in South Europe, you see that in this result here that actually there was a net positive benefit. But this benefit, this net effect that you see here in black was actually higher when you compare this to warmer climates as expected. So just to give an example of something that we are right now, I mean, as additional findings that we are obtaining, not only because most of the findings that we have published so far are based on all-cause mortality. In here, for example, we take the opportunity that for some locations we had information cost-specific. And our partners in Japan, they undertook this study, a very nice study that has been recently published. And what they found is that clearly there was an association between temperature and suicide rates. That you see here that it's basically linear, but although this association seems to be relatively heterogeneous across the different locations that you could see here. And there's now going on another investigation where they want to see why, let's say, would they find these heterogeneous findings in terms of potential area level indicators that can clarify a little bit why some locations this association is stronger compared to other. And finally, I just want to highlight that within this MCC, in this consortia, we also try to open a little bit, let's say, to other, let's say, research lines, not only temperature-related mortality. And in this case, taking the opportunity that we had air pollution data, we undertook a couple of studies that currently this one has just been published in New England Journal of Medicine, in which what we tried to assess again, using this global perspective, it's to assess the association between, in this case, PM2.5 and PM10 and all-cause mortality, showing that actually the burden was quite quantitatively high above the levels established by the different institutions like OMS, etc., WHO, etc. So, and I just want to show you in a final step what we are currently personally I'm working on, that it's about I mean, these are, let's say, the final findings. And this is a study, attribution study, in which basically we wanted to, let's say, to assess how much of the observed heat-related mortality can be actually attributed to climate change. So to do this, what we did is to, let's say, define 2 different scenarios, let's say, of current warming and warming without, let's say, the contribution of anthropogenic forcing, let's say the no warming scenario. We quantify the heat-related mortality under these 2 scenarios that you can see here, 5.2 for the warming scenario and 3.6 for the non-warming scenario under the current, let's say, during 1990 to 2019. And actually what we observed is that as difference, we obtained that the difference, let's say, between the 2 scenarios was 1.5% of excess mortality. But this percentage was highly variable depending on the location. And actually something that was very, very interesting is that we found a clear dose-response relationship between this difference and a kind of gradient between north and south. But this relates, let's say, to an absolute difference between the 2 scenarios, but actually what is the proportion of this difference over the observed warming scenario? So in here what we did, I don't know why this figure doesn't show the plot, but what we observed is that 28% of the overall proportion was actually attributed to climate change. Sorry that I don't know why the bars doesn't show here. Anyways, let's move forward. So in terms of future directions, what we are working within the MCC is trying to tackle specific, let's say, elements or limitations that we have observed so far. Of course, when I started my presentation, I talked about global scale of global perspective. But if you see here in the map, the problem is that actually we cannot say that it's actually it's truly global. Because here you see that there are some locations in Africa, some locations, let's say most of the continent that is not covered, some locations in Asia as well. So in a way, we know that our estimates cannot be representative of global, let's say, global estimations. And it's something that, of course, we always acknowledge in our studies. And at the same time, something that we have to take into account is that all the data that we have in this dataset corresponds to urban locations, not rural. So still, we know that we are just, although most of the population in the future will live in the cities, we know that in a way we are not capturing the, let's say, a more representative sample of the population in the world. So in the future, the plan is trying to tackle this limitation, but if we think about our main source is the data. And although for climate data, we know that we have wonderful weather data, like the reanalysis data, etc., that still needs to be validated, but it's something is going on. The fact is that we don't have, let's say, daily mortality counts for every location in the world. Although we are trying to make some efforts to really engage with potential partners that would like to contribute from other locations, we know that actually we can benefit from, let's say, ongoing developments on statistical modeling and also advanced epidemiological designs to maximize, let's say, the available data that we have for health, but as well some information on potential variables that, let's say, characteristics that can, let's say, explain our association and would allow us eventually to potentially predict this association in locations where we don't have mortality data. And on the other side, something that of course, I had another slide, but it's not in this version, is the fact that when we estimated these projections, we assumed that in a way the population today will be exposed to warmer climates, and this is the impact that we estimate. The problem is that we know that population today is not going to be by far the population that is going to be in Basel at the end of the century. So in a way, it's something that we are working, trying to understand how we can incorporate both the demographic changes in the population through these so-called shared socioeconomic pathways, but at the same time trying to know how we can model adaptation, because we know that population, given that we have been partially adapt to, we have seen that we have partially adapt to changes in climate, we don't know what is going to be actually the risk in the future. So as I said, it's something that we are working on, and hopefully we will, and I will come in another occasion to show you some additional results. And yeah, thank you very much for your attention.
We have time for a few questions. Is there no? Do we have questions with the app? If there are no people with questions here? No? No questions at all? Is that? There
was one question in the app. I mean, in the app is a question for the mortality risk attributed to non-optimal temperature, break at 7.7% cold or heat. Which diseases were considered? As I said, in these studies, we are mostly using all-cause mortality. For some locations, we exclude non-external, but usually, let's say, it's all-cause mortality. But it's true that now a colleague in Emory is going to publish, well, hopefully soon, a study on cause-specific mortality that will as well tell us a little bit more about what are the potential mechanisms that can explain the association between temperature and mortality.
If there are no questions on the floor, I have a question myself. So when you account for mortality, do you also account for the age of the person and the expected years of life lived? So if it's an old person that dies because of heat compared to maybe more younger people that die because of a cold, it might not necessarily be the same?
Yeah, it's a good question. Actually, as I said in this study, we are just, I mean, in most of our studies, we are using the full, let's say, full all age pool of cases. But in the same study of all-cause mortality, they are exploring potential, let's say, patterns in, patterns of risk depending on the age of the population. It's true that usually heat, it's heat-related mortality is mostly attributed to elderly. And it's something that, as I said, is something that we want to take into account as well in the projections, because it's true that we expect that the population we are getting, let's say the pool of the population, we are getting older. So eventually what it means is that there will be more vulnerable population in the future. So it's something that as well, taking into account these different changes, let's say in the exposure response, in the association, we can as well, let's say, project these impacts in the future, taking into account as well these changes in the demographic structure.
Here, thank you. If then,
Christine Thayer, public health consultant. I was interested that you were making a point about the link between temperature and suicide. Could you just say a little bit more about that, what your findings were?
Yeah, I mean, I must say that I'm not an expert on this specific outcome, but we know that, I mean, in a previous session yesterday, there's evidence linking weather and mental health. And one of the main outcomes that has been explored so far is suicide. Actually, all this investigation came because our partners in Japan, they did some exploratory analysis of what they found, that there was a clear seasonal pattern in the suicide rates. So eventually what gave us a little bit of a hint that there might be some association with temperature. So they went a little bit further, and what we found is that actually there was a clear association. In terms of mechanism, I cannot tell you very much because honestly, as I said, it's not my level, my expertise in a way, but I know that, for example, it has been associated to mood, to specific patterns in the population with some potential mental disorders or something that eventually a change in the temperature might trigger, let's say, their attempt to commit a suicide.
Thank you for that. I'm sorry we won't have time for this because we have to move on to the next presentation. So I'm pleased to welcome Guo Jing from the Swiss Tropical and Public Health Institute. We'll talk about modeling the impact of climate change on schistosomiasis.
Good morning, everyone. It's really honored to be invited to give a talk. And the talk of mine today is the potential impact of the climate change on the schistosomiasis, global assessment attempt, plus adaptive case study in China. It's the combination of the work we just finished last year and some of the work I was done during my PhD study, traced back to more than 10 years ago. And also, I'm very glad to see like some of the slides actually was cited by yesterday's talk presented by Professor Peng Bi from the Adelaide University. So my talk will have 5 parts: slides background, review what is climate change and what is schistosomiasis, and some hypotheses and the objectives of the studies, and method of the results, and one case adaptation or mitigation studies in China on schistosomiasis control, and some implications. Let's recall back again the climate change. So based on a sample of the global circulation models and also 4 representative concentration pathways, here is indicating the different concentration of the CO2 in the atmosphere, and also the couple of the ongoing and planned CMIP projects. And IPCC predicts that in the near future, the global temperature will increase by at least 1.5 centigrade degree and more by end of this century if the greenhouse gas emission situation is not generally tempered. And this slide listed the 10 tropical diseases, the likelihood of the outer distributions due to the climate change. From here, we can see the schistosomiasis was listed right after the malaria. It shows very likely change the distribution area due to the climate change. So let's record a little bit what is schistosomiasis. Not everyone knows this kind of disease, so I think it's necessary to talk a little bit about it. Schistosomiasis is one of the neglected tropical diseases. It's endemic in 78. It's reported in 78 countries, and more than 800 million people in Africa, Latin America, the Middle East, and South Asians are exposed to the risk. And I estimated that up to 250 million people actually infected with this disease. In 2002, WHO expert committee, they estimate that the burden of this disease is about 4.5 million DALI, and then it's updated in 2010 that the DALI of this, the burden of the disease is 3.3 million. And the latest study said there's a sharp lower estimation of the burden of this disease, but still some study host the belief that the true impact of this disease is actually several-fold higher than the current estimations. So the life cycle of this disease has two main parts. This is the sexual stage part. It happens within the human definitive host or some other live or domestic or wild animals. And the life site is a sexual stage. Is mainly developed in the intermediate host snail. And there are 6 human schistosomiasis in the world, and each disease is corresponding to different species of the intermediate host snails. And the intermediate host snails is the area, distribution area of the snail govern the distribution, the transmission area of the disease. And the temperature is one of the important factors which determine the survival and the development of this vector host. So the hypothesis and the objectives is listed here. Is the global change or the climate change warming, and how the temperature directly impact and indirectly impact through the rainfall, flooding patterns, and to 3 this kind of pattern, the snail intermediate host, parasite itself, and the definitive host. For instance, it can change the snail distribution areas because of the temperature change, the thresholds change, and also can change the snail developing speed and the reproduction rates as well, and also can change the snail density, and also can change for the parasites, it can change the developing speed and the secure sheddings. For the human side, the flooding and can change the human behaviors, more water contact, and also bovine and some other host behaviors as well. There's one indicator I would like to highlight it here because we are going to using that for our future analysis. It's called growing degree day. As you know, an organism or invertebrate animal, so for instance, our snails, or the parasites, when they finish one life cycle, they need certain amount of the heat to keep it and then finish it. So, and also it has to be like this thermal amount of the certain amount of heat is need to be above and lower this minimum and maximum developing temperatures. And also we have another indicator, it's called the annual growing degree day. It's yearly accumulated heat above a given base temperature per day. So it's the base temperature here, not only the lowest, it's also the lowest and the maximum base temperature here. If it's higher or lower than these base temperatures, we consider the parasite or the organism of the vectors, they stop developing. The hypothesis is with the climate change or global warming temperature increase, the annual growing day in certain areas will increase as well, which also will enhance the transmission intensity of the snail host and the parasites as well. The objectives of the study is we are going to combine these meteorological models and also with our biological counterpart models to predict the global pictures of a potential long-term 2-time periods, 2021 to 2050, and 2071 to 2100. The transmission alterations due to the climate change of 3 main schistosome species: Schistosoma japonicum, Mansonite, and Hamatobio. And Japonicum is mainly distributed in China and the Philippines, and some very focal areas in Indonesia. Mansonite and Hamatobio are mainly distributed in African and Middle East region, and Mansonite also distributes some region in South America. And since IPCC focused a lot on the temperatures predictions, and this variable has a strong influence on the snail survival and parasite development, therefore we're using this thermal unit as a key parameter to evaluate the potential future transmission risk of the disease. Our models based on the CMIP5 is the most recently complete phases of the projects, and with the RCP 4.5, representing the median greenhouse gas emission increases. The temperature prediction data used is derived from the GCM models in the grid format 0.5 times 0.5 lat long by 5 well-known research centers. And the 30 years of average monthly temperature, T mean, T maximum, and T minimum, spanned 2 time frames were extracted. The baseline temperature is based on 1961 to 1990, because also in the future, in the next previous step, we're also using this baseline. That's why we're keeping this 30 years as the baseline for the study, and also the digital map of the world. And this slide shows the biological determinants of the parasites and the intermediate host snails of the 3 species, diseases. For the parasites, this is the left side shows for the parasites, the efficient, lowest, and the highest developing temperature, and to finish 1 life cycle required growing degree day. And on the right side, it indicates the intermediate host snails, different species we can see of different diseases, and what is the efficient, lowest and the highest developing temperature. And for Schistosoma japonicum, we're only using the minimum, the lower temperature criteria, and we don't have the highest upper boundary of this efficient temperatures. And as we mentioned, how we calculate the annual growing degree day, since we only have the monthly data, because it's the best is to have the daily data, but here we only have the monthly data, so we multiply it by day of the month, and then to get the yearly annual growing degree day. And for each pixel, we calculate this annual growing degree day, and also we divided by the growing degree day, that means the finished 1 life cycle required the thermal accumulations. We can calculate the potential transmission index, which corresponding to how many generation of the parasite to develop in that specific regions. If the PTI, the potential transmission index, higher than 1, we considered is the potential transmission areas. Of course, we also need to combine the snail, the vector region, the distribution region on top of this. So this slide shows the prediction of the potential risk area for the Japonicum versus the baseline 1961 to 1990. The base slide shows the PTI is from the baseline, and the pink color we show from here. The pink color indicates the new potential emerging area of the disease, and the gray area, for instance here, indicates the potential shrinking area due to the climate change. So it's interesting, we can see in Sichuan, the current endemic area of Schistosoma japonicum shrinking is shows like not suitable for disease transmission in the near future. And also interesting, the downstream between the Sichuan province and the Hunan Hubei province used to not suitable for disease, for this disease transmission, and now it's becoming suitable. And also that's the region corresponding to the Three Gorges Dam, and there's no distribution of the snails and no disease endemic in that regions, but because of the temperature increase and this Three Gorges Dam in that region, we suspect this disease could be introduced in that region. So we have to be alert of this and to give early warning to the governments. We have to set up the surveillance system in that specific regions. And also we see there's no surprise, the potential transmission area has been enlarged northwards. This slide shows the potential transmission area of the schistosoma mansoni versus the baseline, and we can see due to the climate change, the temperature increase, a lot of the region and current endemic region of the mansoni has retreated from Sahara regions. But in meantime, the marginal areas in north and south is expanded shows to be the new emerging area for this disease, and have the similar patterns for the hematobius in Africa. And we also find it out that in the high altitude region, for instance, in the Ethiopia, the highlands, because of the temperature change, there could be the new potential emerging areas. And also interesting there, I would like to highlight that there was an outbreak report in 3 years ago in Corsica. There's an outbreak of this hematobio. So which means we have give us alert that the warning this due to the climate change, this disease can be introduced in Europe, South Europe. So we also did some validation because we only have the data from the Japonicum in China, so we compared with the ground truth data from China. We found the predictions by pixel level, but the total prediction match rate is around 0.88. And here we classified this is a map from Professor Zhou we have done many years ago. We classified it into 3 regions to set up the adaptive countermeasures. For instance, in this blue region, potential endemic regions, we set up a surveillance, and in this sensitive zone, we carry out the projects to prevent snail from the south to north distributions. And this slide has been shown by Peng Bi yesterday. It's like we already find the evidence, the 0 to 1 thermal isobird has been shifted northward about 26 minutes. And in that region, we have seen this kind of 2 lakes exist there, the new emerging areas. And also this red line indicate the south-north water transfer projects to transfer the water from the Yangtze River, the current snail distribution areas to the north part of the China. So with the climate change and these south-north water transfer projects, the snail can be re-emerged in that Gaoyu lakes and emerge in these 2 lakes. And this is based on the prediction based on this remote sensing image analysis. And we have did some surveillance study in these emerging areas. We do the health educations, and we collect the floating vis to check if there's any snail spreading through this construction of the water resource project. And we also will collaborate with engineering to set up these snail retention tanks and the environment modification to concrete all the banks. And here are some implications. From government levels, all levels, they have to support the further researchers, and education campaign has to, especially in these new emerging areas, has to be carried out. And policy considering future climate change, it has been done in this. Through our study, we have warned the government and the Schistosoma committee, expert committee. They integrate our suggestion, and they set up 2 surveillance sites in these new emerging areas, and also the intersectoral actions, collaborations, international collaborations. And community side is very important to communicate from the local levels with the government, the higher level. as a public health workers, and we need to monitor and provide rapid response accordingly, and also to generate a better warning systems. And from individual side, we have to self-access up-to-date information, self-protections, and most importantly, we have to reduce the greenhouse gas emission. And this work, the global assessment work, I work together with Robert Berquist, the editor-chief of the Global Health, Geospatial Health, and my PhD study is work with Jörg Macetana Panlope from the Swiss Tropical Institute and Professor Xiaonong Zhou from National Institute of China, and also my previous colleagues from the Department of Schist Control in Jiangsu provinces, and also the members from in infectious disease unit. They give a lot of comments on this slide. Thank you very much.
Thank you very much. We have time for some questions.
Thank you. It's really an informative talk. I have this concern, in my opinion, when it comes to parasitic diseases, usually the life cycle makes it a little bit difficult to, control the disease. So now talking about schistosomiasis, I'm just curious, with respect to the life cycle, have you got any hypothesis as to where you can interfere with the transmission of the disease?
I'm not sure I understand the question. It's through the life cycle.
The life cycle, like, we have the vectors and the eggs and all of that. Like, do you have any hypothesis as to where you can break through or interfere with the transmission of disease?
You mean due to the climate change?
Yes.
That's intervention. We do this routine. I don't really understand your questions. It's due to the climate change how we can make any mitigation to interrupt the transmission of the disease at different stages.
Exactly.
Like in the case in China for the schistosomiasis, we know because of the flooding, we have a summertime flooding reasons. That's why we have to warning the recent regions not to go to the riversides. So to reduce the contact with the infested, the water contact, reduce the water contact. And the health education is also to try to warning the people, especially in these new emerging areas, they have no knowledge about this disease, try not to approach to these water bodies, these new infested areas. But for the mollusciciding is the only way we have been used to reduce the snail density, the vector densities. But since we already find it's really costly of these interventions, and we try to using the environment modification to reduce for instance, the concrete. It's costly in one time, but it can be sustainable for a long time. Is that the question I answered? Sorry.
Great. Thank you. Are there any other questions from the floor? If not, we can see if you have any questions on the app. Do we have any questions on the app or no? No, in that case, we'll move on to the next speaker. Thank you very much, Guojing. And I'm pleased to introduce P. Müller. He's a medical entomologist from the Swiss Tropical and Public Health Institute who's done a lot of work on malaria, but is now also looking at invasive mosquitoes in Switzerland, which he'll talk about today.
Okay, thank you, Nicole, for the introduction, and to the organizer that I have the possibility to present on the latest status of the Asian tiger mosquito in Switzerland. I have to disappoint you. I will mention climate change only twice. I've already mentioned it once now, and I will mention it another time later on. Now, we talk about this beautiful animal, at least to a medical entomologist, and it's kind of something we're not really familiar with here in Switzerland, because this is an urban mosquito that likes to live in urban environment, and it is diurnal, and therefore it's a real pain if it's around. And in addition to this, it can transmit diseases, viruses such as chikungunya, dengue, and Zika. And indeed, there are several occurrences in Europe in the past with outbreaks of diseases transmitted by this species, namely chikungunya, and also dengue in several instances, and very recently also Zika. So this demonstrates that this mosquito indeed can transmit diseases in Europe. However, as you see from the names, from the places, this is rather in the south. But recently there has been done an interesting lab study where they have infected mosquitoes collected in Germany with a virus from France and reared them under sort of moderate climate conditions that occur also in this area during summer. And they could show that actually 50% of the mosquitoes in the lab experiments transmitted or were able to sort of transmit the virus. Now, in Switzerland, we have about 35 indigenous species and 3 alien, so-called invasive Aedes species. And the first one here, so this is Aedes albopictus, or the Asian tiger mosquito. It originates from Southeast Asia, and it was found the first time 2003 in Ticino, just at the border to Italy. And another one, which is often confused with this tiger mosquito, is the Japanese bush mosquito, or in Latin, Aedes japonicus. Again, it's from the east, from China, Japan. It's been found the first time 2008 in the canton of Aargau. However, in terms of disease transmission, it's assumed to be less important for public health. It does transmit Staphylococcus, so the heartworm, which is important primarily for dogs, but otherwise, in terms of disease transmission to human, it's less clear. Now, you might have spotted the differences between the two species, I don't know, but I'll just try to turn you into experts in identifying these species. So when you look a bit closer, you see that in Aedes albopictus, you've got 5 white bands on the hind leg, and the last one is also white, so the last bit here is white. Whereas in the Japanese bush mosquito, you have only 3 of those bands, and the hind leg, the last tarsus, is not white. Another feature is on the thorax, so in Aedes albopictus here, you have a white, thick band, whereas in Aedes japonicus, you have 5 sort of thinner stripes. And the third sort of characteristic is the tip of the palps are white in Aedes albopictus, and in Aedes japonicus, they're black. Now, in addition to these 2 invasive species, we have a third one, Aedes coraicus, or the Korean bush mosquito, and of this we know even less, and it's been found 2013 by a former PhD student in my group in Ticino as well. Now, where does it come from? So we had probably the first introduction in 1979. It was found in Albania, but we assumed that from there it didn't spread throughout Europe. At that time, Albania was politically and commercially quite isolated from the rest of Europe. However, the mosquitoes that we have today probably came via the USA to Italy in the early 90s, and from there they spread north. So this here you see the picture from 1995, and in the next slide you see the most recent picture, and you see quite a large area in Europe is already infested by the Asian tiger mosquito. Now, how does it spread? So Laura Vavasori, a PhD student in my group, she took on the task to actually measure how far they fly. Now, how can you do this? So in biology, we do these so-called mark, release, recapture experiments. So you mark mosquitoes, and then you release them, and then you recapture them at different distances from your release point, and that gives you an idea of how far they actually fly on their own. Now, she used a very clever system because usually researchers just reared mosquitoes in the lab and then shook them in a bag with fluorescent dust and then released them, and they were probably in panic and just went to the next place. And she tried to do this a bit more naturally, so she collected mosquitoes as larvae in a field and then put them in a tray underneath this box. Oops. So underneath this black box here, and when they hatch, they have to sort of crawl and fly along a cheesecloth, which is covered with dust, and picked up the dust particles, and so then sort of flew away. And the neat thing with this system is also you can use different colors on different days, and that gives you also an estimation of how old your mosquitoes are in a population. And then the mosquitoes were trapped with this species sentinel trap. So they have an odor that stinks like a smelly sock that attracts the mosquitoes, and when they're close, they're sucked in with a fan. And so she did this experiment in two places, in Coltreri and Lugano, in Ticino, and found that the sort of average flight distance is around 600, 700 meters. So not very far, but for us, this was still quite far because until now, it's kind of assumed they do fly only like 100, 200 meters, and that's where you do the control. So in terms of vector control, that's quite significant. But the main way how they disperse is passive, and one reason is they produce eggs that are resistant to desiccation. So originally this was a mosquito living in the forests, breeding in tree holes, and what they do is the females lay their eggs just above the water level. They glue it to the side of the tree hole or in the dish in your garden. And also in these tires that are sort of stored in outdoors, they are perfect breeding sites for these mosquitoes. So the mosquitoes lay their eggs there, and then these tires are shipped across the whole world, and there's a big used tire trade. And that's how they were spread globally, also through sort of ornamental plants and other means. So that's how they could spread from Asia across the whole world. And more regionally, they're very successful hitchhikers, so they tend to follow you into the car, and then they're trapped in a car, and you drive, for instance, from Italy, from a nice beach holiday to Basel, and then the mosquito escape, and that's how it gets here. There's a couple of factors that favor this distribution. So I've already mentioned the desiccation-resistant eggs, and that they are so-called container breeders. So they breed in small breeding sites, small accumulation of water. So that could be a rain barrel or a flower pot, you name it. And here comes the climate change. So they are to some extent adapted to colder temperatures. So when they lay eggs around September, they go into a diapause and overwinter and can sort of withstand a certain level of coldness. But we are really sort of at the fringe when it comes to the temperature. And there I see, with increasing temperatures, this bottleneck might be widened up, and so larger areas can be infested by this mosquito. So here you see, for instance, a an outcome of a model that used temperature as a cutoff for habitat suitability for overwintering eggs. And you see this sort of, some areas are reddish in Switzerland, but still a large part seems to be white, where according to these thresholds, it would not be possible for the mosquito to overwinter. However, recent data also showed that the microclimate might still be suitable, so it could still be quite warm in some places for it to survive. Now, in 2013, we set out to see, is this mosquito introduced also north of the Alps? At that time, it was present in Ticino. And then we went and set up traps at major traffic routes, at the motorways, at the harbors in Basel, and at the international airports in Switzerland. So this is a collaboration with our partners from the SUPS in Ticino. And we use this so-called ovi traps. So this is, as you see, just a flower pot with about 1 liter of water. And in there we have a wooden paddle that is there for the female to lay its eggs on the paddle. And you see also some granules in there. So this is a larvicide, that's BTI. It's a natural larvicide because we don't want to produce breeding sites in addition to the existing ones. And so we set these traps up at about 40 sites across Switzerland where we think the mosquito could be introduced, or where people stop to have a snack at the motorway service stations. We also had another trap, the BG Central trap, that you've already seen from Laura's experiments, but I'm not showing the data of the BG traps. I stick to the ovi traps here. Now, they were set up at motorway stations, as you can see here, for instance. And when you get the paddles back, in many cases they are just empty, but sometimes you see these eggs and they're sort of neatly glued above the water level on this paddle, and then these paddles are analyzed in the lab under a stereo microscope. And you see nicely on the screen the magnified eggs. However, these eggs are quite difficult to differentiate from other eggs of other mosquito species, and so we use a technique called MALDI-TOF MS. So this is a mass spectrometry method in which we can measure a spectrum by crushing these eggs in an acid and then measure it with a mass spectrometry. And that gives us, like a fingerprint, a specific pattern that we can then compare against the database and identify the mosquito species. And here are the results from the first survey we did in 2013 on the left-hand side, and on the right-hand side you see newer data. And what comes clearly out here is that we see sort of a trend of introduction from south to north. So this kind of confirms what we generally see in Europe. And we can assume that these mosquitoes are introduced along the major traffic routes by cars and lorries. When we compare this to another invasive mosquito species, the Japanese bush mosquito, the green dots at the bottom, you see this mosquito seems to, or that's sort of kind of our interpretation, is probably migrating much more actively than Aedes albopictus, as these green dots seem to sort of grow towards the outer edges of Switzerland. Now, because you cannot put traps everywhere, so we are quite grateful for people that alert us of findings. So we have sort of a network where you can submit mosquitoes where you feel there could be tiger mosquitoes. And this data, together with the data from our national surveillance program and local surveillance program, are sort of kind of combined here. And you see the dots, so these are the results from the national surveillance programs. And again, so this is over the last 6 years, and you see again, sort of the dots show this sort of south-northern trend, and also in several cantons we already had multiple findings in the same spot that sort of suggests that we do have indeed local mosquito populations also north of the Alps. And also, when you look at the molecular makeup of mosquitoes that you find across Switzerland, it sort of suggests that there's a lot of sort of connectivity between the places, and that we probably have multiple introduction events, mainly from Italy, and but it clearly shows that there's this connectivity, and this is work that is still in progress. But I think one point that's quite striking for me is that it seems the mosquitoes that we find in Basel are probably rather from South Italy, and the mosquitoes in Ticino are rather from northern Italy. We also do surveillance in Basel, and we had this year actually quite a lot of findings, and we find that we have 3 populations. I should mention sort of so each dot is either a data point from a trap or from larval sampling. So when we get calls from people and there are sort of confirmed mosquitoes, we go there and do further investigations. And so the light blue dots are from traps and larval sampling, and the dark blue dots are from people that sent in specimens. So one population, so for those who are from Basel, is probably in Neubad, and we are still doing, we have to do more investigations next year. Another big one is between Germany and Switzerland in Kleinhünigen, and the third one in the area of St. Jakob, Saint-Louis. And this is quite a typical one, because when you here zoom in, you see this area, so that's the customs where the lorries have to stop to clear the paperwork, and possible hypothesis could be that the mosquitoes escape when they do their paperwork. Now in Basel, they use BTI, that's a larvicide, a natural larvicide, to treat water bodies that cannot be removed, and there is also the public is informed and encouraged to sort of remove potential breeding sites to keep the populations as small as possible, to avoid nuisance, but also to minimize the risk of disease transmission. And we also have a network, an Interreg project together with our colleagues in France and Germany to harmonize protocols, to exchange data, also for public relations. So we have a school kit to teach children. We have like panels that you can borrow for a local market, etc. So that's, and I encourage you to go to the website and look it up for more information. So the take-home message that I would like to give you is, the expansion of Aedes albopictus is mainly due to global trade rather than climate change. But climate change is a potential additional driving factor. The introduction into Switzerland is mainly from Italy, and we already have several Aedes albopictus population established, also here in Basel, and therefore I think it's imperative that we conduct surveillance and control to mitigate both the nuisance but also the likelihood of disease transmission. And with this, I would like all the people who are in the background to generate all this data, and also our funders. And I would like to thank you, and be cautious if you see these gigantic tiger mosquitoes in front of your door. Thank you.
Thank you very much, Pete. We have time for some questions. Do we have any questions from the floor first? Please.
Well, thanks a lot for a nice presentation. I just want being curious if you plan to like model in the future based on different climate change scenarios, although you say that it's not the main driver, but given that we have data on temperature in the future based on emission scenarios, if you have planned to try to model if in the future other areas in Switzerland might be suitable for the spread of the mosquitoes, and as well if there's some possibility of even having cases, a spread of cases by the end of the century.
So our plan is actually to combine it, so to combine the temperature, but also the sort of introduction, so that we can use the data from traffic, etc., and then combine these two data. And I hope Nicole can support us in this effort.
Of course. Do we have more questions from the floor? Please.
Thank you so much. I was just curious if you have any explanations as to why are they moving from south to north and not east to west, you know? Does this have to do with the wind or with what? What is your theory there?
I think it's pretty much linked to how traffic goes, and I think it just happens that there's this main connection between Italy and the Netherlands, and that's probably where the highest number of cars and lorries go through. But it's also sort of from Italy, it also went westward, so it's not exclusively south-north. Or maybe, or did you mean why is it not coming from France into Switzerland?
No,
Is
I
that
was
the
just
question?
thinking, you know, if they're, I mean, I don't know, I was just thinking on the mosquitoes itself and the data that you showed that rather than moving 100 meters, they're moving 600 meters. These 600 meters could be to the east or to the west. I don't think, unless there is a force that encourage going south for the, going north for the mosquitoes, I couldn't see the relationship. Why? How would you explain, you know, that this trend going north?
Yeah. Yeah, so I think this is simply linked to traffic going south-north.
I guess we could take a question from the app. So I guess if I read it out, Fabian, where is the origin of the viruses, like dengue, chikungunya, Zika, and West Nile, introduced to Europe?
So there are different sources, but usually it's people going to a disease-endemic country and then are bitten by an infectious mosquito, and then they come back into an area where you have Aedes albopictus established, and the disease has been spread that way.
Great, thank you. Do we have any more? And how long can Aedes albopictus eggs survive, even in the winter?
So they can survive, they can survive the whole winter, and also when they don't go into the diapause, they can even survive several months.
So we're almost running out of time. Before we end, I would like to ask the audience a couple of questions too. So how many people here knew about schistosomiasis before today? If you could please raise your hands. It's actually excellent. I think it's most people. Maybe for the tiger mosquito, I'll ask it the other way around. How many people didn't know about the tiger mosquito until today? So we're all aware your propaganda campaigns are working very well. So we can thank the speakers. Oh, sorry, there is a last question. Sorry. So if we kill our mosquitoes at home, how can we bring them to you, P?
So first of all, please do not smash it, so gently kill it or trap it. And then you can take either a photograph and send that to, we have it's called Tiger Mücke at Swiss TPH, so you can send it there, or you can send it in by post or bring it and pass by, and we'll identify it for you.
Great. Thank you very much. And if you could thank our speakers again, and enjoy your 1-minute coffee break before we start again.
when she's gone. Yeah. Ain't the sunshine when she's gone. Only darkness every day. Ain't the sunshine when she's gone. And this house just ain't home. Anytime she goes away. Ain't the sunshine when she's gone. Only darkness every day. Ain't the sunshine when she's gone. And this house just ain't no home. Anytime she goes away. Anytime she goes away. Anytime. Anytime she goes away. Anytime she goes away. Anytime she goes away. Anytime she goes away. Anytime she goes away.
Her hair is hollow gold, her lips sweet surprise. Her hands are never cold. She's got Bette Davis eyes to turn her music on. You won't have to think twice. She's pure as New York snow. She's got Bette Davis eyes. And she teases you, she unease you, all the better just to please you. She's precautious, and she knows just what it takes to make her problems. She got Greta Garbo, stand up side. She's got Bette Davis eyes. She let you take her home. It was her appetite. She'll lay you on her throne. She got Bette Davis eyes. She take her tumble on you. Roll you like two dice until you come out blue. She's got Bette Davis eyes. She'll expose you when she knows you off your feet with a crumb. She throws you. She's ferocious, and she knows just what it takes to make her problems. All the boys think she's a spy. She's got Bette Davis and she'll tease you, she'll unease you, all the better just to please you. She's precautious, and she knows just what it takes to make her proud blush. All the boys think she's a spy, she's got Bette Davis eyes. She'll tease you, she'll unease you, just to please you. She's got Bette Davis eyes.
Calling on the world of the Holy Spirit. Have mercy on my soul, for I feel there's a million ways to die, I've been walking them all. But something kept me going every time I wanted to fall. Now I'm stranded here with a ton of debris, with a million pieces of what I thought could be. I spent a lifetime of failure escaping home. It got bigger and bigger like a malicious wound. I fed it hate, fed it all my love. It kept screaming for more, never had enough. Swallowed my hope, drank all my dreams, devoured my world, and all that remains is a mountain of guilt, the shipload of shame, and the bitter recognition I am to blame. Mercy on my soul, for I feel I'm losing. So much time wasted together, but play games with love. So many tears we cry, so much pain inside. Baby, it ain't over till it's over. So many years we try to keep our love alive. Baby, it ain't over till it's over. How many times did we give up, but we always work things out. All my doubts and fears keep me wondering, yeah, if I always be in love. So many tears we cry, so much pain inside. Baby, it ain't over till it's over. So many years we try, keep our love alive. Baby, it ain't over till it's over. So many tears we cry, so much pain inside. But baby, it ain't over till it's over. So many tears we cry, to keep our love alive. But baby, it ain't over till it's over. So many tears we cry, so much pain inside. Baby, it ain't over till it's over. So many years we try, keep our love alive. Baby, it ain't over till it's You and me, we used to be together, every day together, always. I really feel I'm losing my best friend. I can't believe this could be the end. It looks as though you're letting go, and if it's real, well, I don't want to know. Don't speak, I know just what you're saying, so please stop explaining. Don't tell me 'cause it hurts. Don't speak, I know just what you're thinking, and I don't need your reasons. Don't tell me 'cause it hurts. Our memories, they can be inviting, but some are altogether mine.
frightening, and as we die, both you and I, with my head in my hands and sit and cry. Don't speak, I know just what you're saying, so please stop explaining. Don't tell me 'cause it hurts. Don't speak, I know just what you're thinking, and I don't need your reasons. Don't tell me 'cause it hurts. It's all ending, I gotta stop pretending who we are, who we you.
Good morning. Good morning. Welcome back from the break. I think we are a little bit behind schedule, so we should make a start. We are having a little bit of a special session in the sense that although we are all together here and a few other people also online, most of our speakers are actually somewhere else in the world. I think this is the brave new world, and we better get used to that. I very much hope that this will all work technically in a way it should work, and that we're going to have a good session. For those who are not yet familiar, you can ask questions at the end of the session, either live here or by sending your questions to the app, and we will project them and then ask the speakers to answer. My name is Christian Lengeler. I'm a malaria epidemiologist at the Swiss Tropical and Public Health Institute, and I very much would like to welcome you to this session. Our first speaker is based in Los Angeles. Is she online? Maria Cristina Tirado? Can you hear me?
Yes.
Okay, welcome. It's kind of late morning here. I guess it must be something like midnight in Los Angeles?
No, I am in Madrid.
Ah, wonderful. Okay, so straight from the COP25 in Madrid, Cristina Tirado von der Palen, you're welcome. The floor is yours.
Thank you. So, thank you so much for the invitation. And I think that this initiative of having the online presentations is great, considering that we are in a climate change conference. So, greetings from Madrid, from the COP25. And I will now focus on my presentation, which is looking into risk reduction and risk management for food security and nutrition. So we have some data from a very thorough study that Sophie prepared with FAO, the World Bank, and UNICEF, looking into climate streams or climate shocks and the impacts that they have in food security and nutrition security. So we have seen in the last years that there has been an increased exposure to more frequent and different types, multiple types of climate streams in both low and middle income countries. And as a consequence, and we are seeing that, for example, if you see all the data from the CREF and MDAT database, we will thought or assume that most of the events and extreme weather events that affect health are storms or floods. This is the typical graph that we are seeing. And you can see that the droughts are low, they are lower in proportion than the storms and floods. However, for the purpose of food security and nutrition security, those are the ones that more that affect the more the production of food. So in the when we are talking about climate shocks, it could be, you know, it could be a very hot day, higher than usual dry season, or just 1 week. Sometimes it's just one heat wave in 1 day. So as an example, I want to show the consequences of El Niño in 2017. It started in 2015 and 16, and by 2017, we saw some of the largest impacts in Africa, particularly in Africa. So the El Niño-driven drought conditions, together with other climatic shocks, they had a huge impact in the agricultural livelihoods and in food security, food prices. And we were seeing that almost 25 million of people were food insecure in the so-called phase 3+, which requires humanitarian assistance. That was in Ethiopia, Malawi, Zimbabwe, Haiti, and Mozambique. And everything was independent, totally independent of the factors that are damaging food security, which usually are political and warfare and just food prices. So this was something totally different to the rest of the periods and years. And when I was mentioning about the climate shocks, you can see that we are referring to droughts, but they could be dry spells or low rainfall or seasonal variability, if it is a late onset of the rainy season, or if they are erratic rainfalls or late onset of the floods, or for example, droughts that are combined with other climatic shocks. Bottom line, we are seeing this more and more frequently, and the regions where we have seen this more intense has been in these countries in Africa, in Asia, and in Latin America and the Caribbean, particularly in the dry corridor. So these are the areas where in 2017 we were addressing emergencies of IPC phase 3. And this was a crisis or even higher. There are, if you can see the dark brown in those countries, they were more than 2 million of people that were insecure. So that they required all of them humanitarian assistance. And what I was mentioning before, that controlling for everything, we can always see a higher prevalence and number of undernourished people or people with low calories in countries that have high exposure to climate extremes. Usually, what is being used for preventing is using the famine early warning system network, which is an early warning system that started in USA, and it was adopted by the World Food Programme. This system advances what is going to happen, for example, if you can see here in January 2020. But sometimes you can advance more than 3 months. We are looking into advancing into even 6 months soon. But the famine early warning system network, it's basically giving evidence-based analysis of 28 critical countries And this system comes with the support of NASA, NOAA, USDA, the USGS, and others. And usually this and vulnerability assessments is what are being providing the classification of the food insecurity experience. So the food insecurity has the determination and definition has changed recently. And right now, we are using the integrated food security phase classification. And as you can see, when the phase 1, 2, or 3, 1 and 2, that is minimal or stress, the action for disaster risk reduction or the action is for livelihoods protection. But beyond phase 3, in which we find that households have food consumption gaps with high or above usual acute malnutrition or a different accelerated depletion of livelihoods and assets, because they sell the assets to cover the lack of food and money. This will slip into food consumption gaps. So beyond phase 3, phase 4, and phase 5, is urgent assistance is required. And there is, there is a corresponding acute malnutrition technical descriptions that are in relation to the same phases, the 1, 2, 3, 4, 5. And it's looking into, for example, in let's say serious critical phase 3, in which from 10 to 14% of the children are acutely malnourished. And then there is a scaling up of the treatment and prevention of the populations. So beyond that, everything is really serious. And we have many countries in 2017 that were in between phase 3 critical and extremely critical, in which there is acute malnutrition, and this is epidemics and very high mortality as well. So one of the programs that have been more successful, combining all these tools, have been the Food Secure. The Food Secure has been combining these tools, and what has been more effective was to focus on nutrition-sensitive community risk reduction. So the Food Secure system was helping to move from what it will be a response to the risk to risk management. And if you can see here, the system was working with first with anticipatory action and preparedness, and then the communities can build resilience, and they have the information because they are provided with the climate forecast, with early warning, and all the data that are received, and there is a point of triggering resilience and insurance coverage. So once that the emergency is declared, they are complementing existing responses, and this is the early response. And now there are longer periods of work because the recovery and resilience building, they go through the next year and then the following years. So they are building long-term climate resilience. And basically, this is those are the windows that are working with the Food Secure, which is providing all the financial and programmatic support to prevent before, during, and after the disasters. So the window 1 will be the anticipatory action based on the climate forecasts, and it's using meteorological thresholds and early warning signals. And the window 2 will be the shock responsive safety nets. And this is determining that in countries that have government-led emergency response, they put in March the mechanism like safety nets, but climate-focused safety nets. and all the risk financing and the transfer instruments have been working very well. Like, for example, the African risk capacity, which is enabling millions of Africans to benefit from the climate risk insurance, but they have early payouts that are all of them based on climate indexes. And finally, what I was mentioning, the window 3, is based in the community-based disaster risk reduction and resilience building, but this has a predictable multi-year funding after a specific climate disaster, and is increasing the resilience and of the exposed and the hazard-prone food systems, whatever they are. And combined with this, another tool that has been working very well, and particularly in Ethiopia, this is really effective in Ethiopia. It has been the combination of 4 risk management strategies. There was a combination of insurance protection to help to become more resilient and more food secure, but long term. So it's risk management for finance and insurance, and is focusing on improving resource management with assets, the creation of assets and risk reduction. Then it's focusing on risk transfer through insurance, risk reserves through savings, promoting savings, and promoting livelihoods diversification. So this was in relation to being prudent risk-taking. In general, the social protection and safety nets, the conditional cash transfers programs have been very effective in Central America and Latin America, and definitely when they were transferred to Africa, they were showing similar or better results. But we have seen that with these conditional cash transfers, that were have the condition that children have to go to school, they receive vaccinations, they receive the nutrition supplements, all the pregnant women, and they have to go to prenatal care, they have to go to learn to breastfeed, with all this combination of conditions for the cash transfers. The stunting in the communities that implemented can decrease from 5 to 10%. So this has been one of the most successful approaches. This has been combined with school feeding programs, and with school feeding programs, the idea is that in order to have at least 50% of enrollment of girls, because that has been always a challenge. The school feeding programs have been a tool to increase that they go through higher grades. Like, for example, when we were having school feedings, the girls' enrollments in primary school could increase up to 28%. But if in the same schools, the regular meals were combined with a ration that was being taken by the kids to their families, the girls' enrollment was the highest in primary grade, and it was, it was increased by 46% or more. So that has been a huge success. And has decreased also the fertility rates in the areas that has been implemented. This was again very successful in Latin America and Central America, and now school feeding programs are being tested in North Africa. We don't have the results yet, but we are working with Tunisia, Morocco, and Tunisia, Morocco for the moment. So, in relation to
Dr. Tirado, excuse me, can you slowly come to a conclusion? I think we are past the 15 minutes. Thanks.
Sure. So, Other aspects that are critical to help to reduce the risk. It could be to promote gender equality in order to have access to resources and extension services, or to focus on nutrition-sensitive disaster risk reduction that could be combining mangrove repopulation with aqua and silviculture and other ways of protecting the coastal areas and having a food income. So just to mention that there is a large funding and a global call for climate resilience that could be focusing in these specific aspects, like strengthening early warning systems, or making the infrastructure more resilient, or improving dryland agriculture and crop production. So I have a much longer presentation, sorry, but just to mention that still, there are some data that have been just launched here at COP25 with the number of countries that have emergency preparedness and planning. Still, if you can see, for droughts, only 38 countries from 97 responses have these plans. And I could share that presentation with you, but multi-sectoral collaboration with agriculture, only 31 countries are looking into that, and look into social services, because we are talking about safety nets. Those are not health systems per se, are the social services who are providing all these safety nets that I have mentioned before. Still, in the NAPAs, with all the needs that we have in these countries, only few countries, 29% of them, have included nutrition in these NAPAs. And same thing, similarly for the ENDCs or NDCs, only 29% of the parties that have NDCs have identified nutrition as a priority. So this is a gap to address. And with the UN Standing Committee of Nutrition, we have prepared a discussion paper on sustainable diets for healthy people and a healthy planet, which address nutrition-sensitive disaster risk reduction, among other aspects, or sustainable foods, food systems and diets. And finally, just to mention that this is, when we are talking about the SDGs, we should include also, SDG 2 and 3 as critical and in the center of environmental sustainability for health and nutrition. So thank you very much, and all the best for the conference. Thank you.
Okay, thanks very much. I think I've just been told by the organizers that we will take questions after each talk rather than at the end. So I invite questions on the presentation we just heard. So, Christina, for your information, we have about, 100 people in the room here. They are all looking at your presentation. Any question or comment? There is one question also that arrived via O3, via the app. Can you please project them? So the first one is, interestingly, a very naive question. In one of your first graphs, we see that earthquakes are more frequent in recent years. Are earthquakes influenced by climate change?
So far, we don't have that information. We don't have data about that, so it's not related.
Okay, the answer is safely no, I think, on this one. The second one, how can we get health NAPs to actually get implemented?
So could you repeat the question?
How could we get health NAPs to actually get implemented?
Peace.
NAPs, I'm not even sure what it stands for.
I mean, do you mean...
National Action Plans.
Like SDG 16?
I'm asking for advice from the room?
Sorry, I don't understand the second word, peace. Peace, like the SDG 16, like war and conflict, if they are major underlying drivers of nutrition insecurity?
No, let me repeat the question. How can we get health national action plans to actually get implemented?
Oh, okay. Yeah, sorry, I did not understand the question. Well, that's a complex question. The national action plans, most of the countries, the least developed countries, have not developed an app. They have not even developed a national adaptation plan. The least developed countries, which have funding from the GEF to prepare NAPs, they still have the NAPAs. And even the NAPAs have not been properly implemented. So I think that this is there is a huge debate here at COP25 that this is a question of really lack of funding for implementation and should be addressed but by the different mechanisms. So it's just, they really need much more support.
Okay, thanks very much. I think we have time for one more. Can you maybe project it? The third and last question is, how do you choose what foods to include in the programs, e.g. the school feeding program? How you discern what is a healthy, nutritious food and what is not? What is your criteria framework? It's very specific.
Yeah, that's a very good question. Everything is basically local or national. Just to give an example, the school feeding programs in Brazil, they have been combined with the food procurement that is bringing about 75% of the food from local farmers into the schools. And in Brazil, it's very interesting because in all the schools, they have a nutritionist. And they make sure that every kid has their particular needs. So, I live in Brazil for some years, so I know this. I know that it sounds very, surprising that they have a nutritionist, but this is an amazing way to make sure that every kid has the different requirements, because they have different physiology and they have different situations. Some of them they are sick, some of them it's like fitting a diet for them. Now this is the reality in Brazil. In other places, the foods have to be chosen locally according to dietary guidelines, food-based dietary guidelines, but the foods are always what is available, what is locally produced.
Yeah. Okay, I think we probably have to interrupt you. I'm very sorry, but we are really running behind. So thanks very much and a good conference in Madrid.
Okay, thank you. Bye-bye.
Yeah.
Same thing, likewise there. Enjoy the conference.
Okay, the next presenter is in the room. It's a pleasure to welcome Dipali Patel, talking about how vaccines contribute to health resilience. Welcome.
Let's find out. Yeah, great. Okay. Thank you, everyone. And the lights are very bright, sorry. I appreciate that you've given me some time here to talk about this. I work at an organization called Gavi. I'm going to assume that maybe one person in the room knows what Gavi is, only because she used to work there. But, a few other people, good, okay. Indulge me a little bit. I've got a couple slides just to give a very high-level overview of Gavi in here as well. So just a couple of things, a few things that I wanted to raise in this presentation. First of all, why does Gavi care about climate change? What is the aspect of this that we're really interested in and where we think we can contribute? And then finally, how do we build resilience? So who is Gavi? and our new strategy. So we are an alliance, which is comprised of a number of technical and normative bodies, such as the UNICEF, WHO, et cetera, implementing countries. So every country has a national immunization program. We exist basically to make sure that countries can get vaccines to their populations. And these would be low-income, middle-income countries. Also, we have a number of donors. We pool the funding from the donors, which is a lot more efficient and has been quite a successful model for us. And this is what we do. We basically get immunization coverage up in all the countries in the world. And so since we started, which was in 2000, 700 million children have been vaccinated, 10 million lives saved. So why does Gavi care about climate change? You know, we were asked this question, actually. We were asked for our environmental position a few years ago, and we said, we don't have one, we're an immunization organization. If you're gonna pick an SDG, you know, it would be the health SDG. But it is increasingly becoming clear, I think, to all of us in the room and all of us that climate change requires the whole of society approach, and we have something to contribute to this as well. And so basically on this slide, just to say that if we're going to achieve our SDGs, we need to bring them together and we need to think about how these things link. And I'm sure some of you have seen this version of the SDGs. I think it's called the layer cake or something like that. But, you know, if you don't achieve the ones at the bottom, you're gonna have a really hard time achieving the ones as you build the layers up. And all of this is based on, you know, focusing on, you know, really making sure we have a good planet to build off of. So we have a new strategy. This is for our new strategic period, which will start in 2021. You'll see I just circled that Sustainable Development Goals becomes an increasingly important piece of this for us. You don't have to read the slide. It's got a bunch of stuff, but really just wanted to highlight that for the first time, we have included, you know, helping countries address the impacts of climate change, specifically in our strategy. And so we are mainstreaming this, and it's becoming a very important issue for us, in large part because if you think about who doesn't get immunized and why an organization like us would exist, it's children, it's women, it's the most vulnerable people in the world, the marginalized people living in temporary shelters and refugee camps, victims of conflict, and et cetera. And so this is very important for us. So just a couple of points. We've been talking about this already for 2 days. Most of you in the rooms would be familiar with what are the sort of issues out there. So I'm going to fly through this piece a little bit. But essentially, you know, these numbers, they're very alarming. For us, this is particularly important because most of the countries that we work in are in sub-Saharan Africa. And so this is where we see population booms. We'll be seeing a population boom. This is where sanitation needs are lacking and water and diarrheal diseases will be an issue. The increasing urbanization, the increasing number of deaths coming from things like malaria, diarrhea, heat stress, and malnutrition. One thing I wanted to flag, because I haven't heard people talking about this so much, is antimicrobial resistance has a strong climate change component as well. Vaccines can be an intervention against that. So it's something that's of interest to us as well. And then there's the displacement, the population displacement. So displaced people tend to be harder to reach with health services. And those health services are going to be critical for making sure that people are protected against what will be the impacts of climate change, or that we're already feeling already. So this is probably a slightly complicated model, I think, to express what is probably very obvious and probably simple concept, but you know, this is a cycle. All of these pieces fit together. We are particularly interested in the vaccine-preventable diseases, that's the VPDs, but there are a lot of things happening in the environment and the climate that will get us to this issue of increased vaccine-preventable diseases. And so we might be coming at this from a very small piece of the overall picture, but the overall picture is important to us. And one of the things we have learned in the 20 years that we've been operating is that it's not enough to just, I'm going to oversimplify, but you know, ship a bunch of vaccines to a country and then just assume everyone's going to get vaccinated. If you don't have a health system in place and the service delivery behind it, if you can't reach the people, if they can't reach the health facilities,
for whatever the reason, whether it's physical, logistics, cultural, et cetera, you're not going to get people vaccinated. And so we care about all of these things, even if as an organization we're only going to be able to sort of address the one piece of it. So, no surprise to anyone in the room, we're going to see and are already starting to see an increase in vaccine-preventable vector-borne diseases. All of these diseases have vaccines against them. Not all of them are great vaccines. My organization, Gavi, supports vaccines for Japanese encephalitis and yellow fever. We support a pilot project for malaria vaccine, which is ongoing right now, implemented by WHO. And there is a dengue vaccine out there. Has had a few issues. But these are vaccines that will become even more critical as we see vector spread around the world. Climate change will increase waterborne diseases as well. All three of these are also vaccine-preventable diseases. Cholera vaccine, also, this is a recurring trend maybe, but not the best vaccine. It has a very limited duration of protection, so you have to keep vaccinating people unless you can build a really strong WASH infrastructure and system, and then you will see reduced incidence of cholera. Rotavirus, not as strong of a link with WASH. You can have good WASH and still see a lot of rotavirus. If anyone here is from the US, we vaccinate for rotavirus, and we've seen significant decrease in incidence. But rotavirus can also be impacted by climate change, and it's also a vaccine that Gavi supports. And then finally, typhoid fever. And here we see another link, again, back to the AMR question. We are seeing drug-resistant typhoid in countries like Pakistan, Zimbabwe, et cetera. And so it's increasingly important to get vaccines to those countries. And then finally, I think a lot of people don't necessarily think about this, but in terms of what is the link between something like immunization and the the air quality or air issues related to climate change, but actually pneumonia and meningitis are both vaccine-preventable diseases, at least pneumonia caused by pneumococcal and meningitis caused by meningococcal diseases. And so the changes in El Nino patterns, in seasonal variability, et cetera, will also see an increase in these diseases. And so it's also of importance to us that people get vaccinated and protected against this. And then the third sort of area, or fourth sort of area, is the emerging infections. So I don't know, maybe there's an ongoing outbreak of Ebola happening in DRC. There, 4 or 5 years ago, there was one in West Africa as well. Ebola is one of those diseases where the human-environment interface, as you see more deforestation and people encroach on forests, you see these diseases coming out of these areas and into human populations. And so I'm not sure how well you can see this, but there are a number of these things. Nipah virus is one that's becoming increasingly of concern. And I think one thing here that is particularly maybe scary, we can say, is that we don't know what that next big emerging infection is going to be. It is the big unknown for us, and we will not have a vaccine against it. So we can accelerate vaccine production and try and get vaccines, but if we don't know what we need to vaccinate against, this is, there's only so much you can do. And so this is going to become increasingly an issue in this space as well. So what are we going to do about it? Why does Gavi care, and what do we think we can contribute to this? So immunization has been highlighted as a key preventive tool by the IPCC. It is something that needs to be in every country's health system. Primary health care is how we get preventive interventions out to people to protect them, not just against climate change related issues, but obviously the broader health area, and then a little bit about what Gavi's doing and then what we would like to be doing as well. So we have a strengthened commitment. I mentioned it's now in our strategy. These are sort of 3 areas where we think we can contribute. The first is obviously increasing access to immunization. It's something we do already, but maybe now with more of a focus on climate-sensitive diseases particularly. Supporting investments for stockpiles, because increasingly we will see outbreaks, especially as we see more disasters related to climate change. And so the faster you can get a vaccine out when there's an outbreak, the sooner you can respond and reduce the impact of the outbreak. And then the third part for us, I know the healthcare-related footprint may not be so big in some of these countries, but we ship about, or let's say we finance about 700 million syringes a year in Gavi countries. It's about 70-some countries. It's a lot of waste that's getting produced in countries that don't necessarily have very good waste management programs. And so we are starting to think about what is our contribution and what is our obligation to countries to help reduce that piece of it. And I will say, recently we did an analysis on this, and so far what we've done is help countries buy incinerators, which is not the best way to reduce waste, particularly because in order to incinerate healthcare waste, it needs to be at a pretty high temperature, and these are pretty small incinerators, so they won't reach that temperature. But another big problem with it is that it's, you need to plug an incinerator in, or it needs to be on, have an electrical source. And in countries where healthcare facilities are not on the grid, then the incinerator goes unused. So we think we can do better, and we're looking to see ways that we can do this. And this even starts all the way upstream with the procurement. So what is getting shipped with those syringes, all of the packaging, all of the extra safety boxes, et cetera, how can we reduce that piece as well? Just so we reduce the burden, even just showing up at the port of a country. Primary health care, as I said, this is how we reach people with preventive interventions. Immunization, this has been something we're quite proud of, that since our existence we've helped get immunization coverage up. Immunization is the highest, has the highest coverage of key interventions that sit within primary health care. And we think as we increasingly focus on the unreached, the people who are not getting immunized, this is an opportunity for the entire health system to come with us and to reach them with all of these other interventions. So we just listed a few here on this slide, but you can imagine some of what we've been talking about already, and even go beyond the healthcare system to other essential interventions such as nutrition, would also be important to add to this. I think we've seen this graph already a few times now, but WHO has identified these core components for health systems resiliency. And among those are, so component 6 would be climate resilient and sustainable technologies and infrastructure. So vaccines obviously are health technologies, so that's one area that we are contributing to. And these are the vaccines we support that are against climate sensitive diseases. And you'll see over time how we've increased adding them into our portfolio. But the other piece of a strong and resilient health system is the actual infrastructure. And one of the things that we have noticed in the past few years is that countries don't have good cold chain equipment. They tend to have refrigerators that burn kerosene. So again, we're contributing to countries' environmental footprints, burning kerosene and the emissions. And so what we have started to do is support countries to upgrade that equipment to solar direct drive refrigeration, which is solar powered, or ice line refrigeration, which if you have an electrical grid, you can plug the fridge into it, and it's a lot more energy efficient. And since we started this program, we've actually increased the number of pieces of equipment, or the types of equipment that countries can access. So in 2015, when we started this program, we had 10 types of solar direct drive and ice line refrigeration. Ice line refrigerators that countries could access. We now have 74. So we've really actually influenced the market in a very strong way for countries to be able to do this. This is where we started in 2015. So we started with 10%. And I don't have a slide that shows where we are now. And I don't have the number in case anybody's putting that into the app to ask me that question. But I think it's hovering somewhere around 50%, and it's going to increase in the next few years. And then I'm just going to close by saying the next step for us, because solar direct drive refrigeration has actually been a pretty successful program for us, we are now piloting a healthcare facility solarization project. If, for example, it costs $12,000 to install a solar refrigerator, you're putting a panel on the health facility solely for a refrigerator. Imagine if you could just solarize the facility, plug in a regular refrigerator, but also use that facility to power other things. And so what that means then for us is the extra, $4,000 or something to solarize the whole facility will have much better and bigger knock-on benefits. So maybe the next time this group comes together to talk about this, I will have some kind of readout from that pilot, but we're going to probably solarize a whole district in a country and see what the impact is on that. So I'm going to end there because I see my time is out, but I'm happy to answer further questions on this. Thank you.
Great, many thanks. Very nice overview, dead on time. Any questions in the audience? So far we have no question on the app. Yes, please, can you just wait for the mic?
Hello, thank you for the nice presentation. I was wondering about the antimicrobial resistance and how could you explain a bit more on that? And then also on the vaccines against dengue and malaria, what are the near future projections about getting a better vaccine, and how do you deal with the, it's a big question, with the anti-vaccine lobby trying to promote such an important but not perfect vaccines yet?
Sure. So on the AMR piece, so antimicrobial resistance is caused by a number of factors, not all of which is human health related. And I think actually probably the biggest contributor is animal health related. The use of antibiotics and subtherapeutic use of antibiotics and vaccines in animal populations is increasingly becoming a problem. There's not very good regulation in animal agriculture in many countries, and so you get a lot of runoff off of the farms from excrement and things like that, and so all these antibiotics end up in the environment. And so when you have that circulating antibiotics in the environment meeting with the diseases in the environment, you're starting to see this kind of evolutionary pressure for bacteria to evolve and become resistant to antibiotics. So that's one way. There's also the production of antibiotics in certain countries, which is also not well regulated. And again, you have this sort of spillover into the environment and from the waste produced and the improper disposal of expired antibiotics, et cetera. So it's a big area to address, but it's increasingly becoming an issue for certain diseases like pneumococcal disease, for example, where the resistant strains, and typhoid I mentioned as well, the resistant strains are increasing and then spreading from one country into the next. And currently our pneumococcal vaccines address a certain number of strains of pneumococcal bacteria, but Streptococcus pneumoniae bacteria, but not all of them. And so we start to see strain replacement and things like that. So, so that's the AMR piece. To note that vaccines don't cause AMR, and so they're actually quite a good intervention against it. We don't see viruses evolving in response to vaccines. We see things like strain and serotype replacement. To your second question, there are dengue vaccines in development that are better than the one that is currently licensed out there. The one that's currently licensed is not a bad vaccine. The problem is if you have never had dengue vaccine before and you get vaccinated, you're actually at risk of a worse dengue infection. And so it's a perfectly fine vaccine to use in people where you know they've had dengue before and it prevents a second infection. But that requires actually going around and taking blood samples and that sort of thing, which is not really something that you can do in countries that have low resources. There are other dengue vaccines in development, may or may not have the same issues. We're not sure. Malaria pipeline is depressing. Maybe I won't get into it, but there's not really anything on the horizon beyond what's currently in pilots, and it has its issues as well. So anti-vaccine movement is a whole nother issue. It's growing. I don't think the internet helps in this area. But I would say, I think there was an earlier talk about how do you get better lobbyists for climate change, and should we look at the enemy and sort of learn lessons from them? I think the anti-vaccine movement has done that. They have looked at, what has worked in getting, other sort of success in various things, and they have learned, and it is something we need to do better as well. So.
Okay, thanks very much. Maybe we can use the climate emergency to promote vaccines again. I think that would be a very good way of doing things. I see one second. I think we still have one more question. Let me just call it up. Given the strong links of climate risks and natural disasters with forced migration, what is Gavi doing to provide financial and technical support to humanitarian response programs?
Good question. So most of our funding goes directly to countries, and this is in response to countries requesting funding. So the bulk of our funding is literally to buy vaccines for countries' immunization programs. Then we have the health system strengthening component of our funding, which goes to countries to implement certain activities to strengthen their health system. We do fund the stockpiles for malaria, for yellow fever, meningitis, and cholera. And so anytime there's an outbreak of any of those three diseases, and it's multiple serotypes of meningitis, anytime there's an outbreak for any of those three diseases, any country can access the global stockpile, get those doses out, and address the outbreak. We also are now funding the Ebola stockpile as well. I believe that decision was just taken yesterday by our board. So we do that. In the countries we work in that have disasters or are in conflict, like, for example, Syria is a good example right now, Yemen, parts of DRC and other countries. Depending on what is the situation in the country and who is responding and where the issue is, we might provide the funding directly to whoever's coordinating the response. And this is to make sure that basic vaccines are, we continue to keep the coverage up, people continue to reach those vaccines. So when you have those amnesty days or those days where the ceasefire days in countries, for example, vaccinators get out, polio is a really good example of being able to do this, where in the middle of a conflict, polio vaccination maintains a pretty high rate, which is pretty amazing if you consider people are literally killing each other, but then they will stop so you can vaccinate all the kids with polio. I guess vaccines are pretty apolitical, so probably that's why it works. And then we also provide funding where UNICEF, UNHCR, WHO, whoever is doing the response, it's usually in a coordinated way, additional funding as they request as well. Thank you.
Thanks very much. And yes, Gavi is such a wonderful organization. Congratulations. So, thank you. Yeah. Okay, from the global stage, we move to Florida now. We have Professor Song Liang at the University of Florida. He should be online. Professor Liang, can you hear me?
Yes.
Okay, welcome. You have about 100 people in a room facing you. It's Basel, Switzerland. It's freezing outside. I guess you have a little bit less that issue in Florida. The floor is yours, Professor Liang.
All right, thank you very much. Good morning. I first want to just thank the Professor Gladio Sisi invite me to participate in this symposium. And the second, I want to disclose that this talk is not based on my research work, and most of my research work has been based on the neck tropical diseases, both in China and East Africa. But this talk is based on review work I was involved in a couple of years ago, and for the Florida Climate Institute in response to the impact assessment of a climate-sensitive hazard in Florida and the public health impact. So I'm glad you invited me to kind of, just give our brief introduction and on the health impact associated with climate sensitive hazard in Florida. So can I move my slide? Okay, all right, I'm gonna just briefly give some background information and introducing the climate sensitive hazard we're facing, health impact, and the public health system and the responses. So some background information about the Florida. Here's the Florida, as you can see on the circle right here, and it's the southernmost in the continental USA. And Florida has a long coastal line and up to almost 2,200 kilometers. And the state has a very typical tropical weather in the south region and a humid subtropical climate in the north region. And the state is very flat. Much of the state is at the near sea level. And because of its unique geography, the state is highly vulnerable to climate variability and climate change. Florida is the third biggest state in the US in terms of the population. About 90% of the stated population living in approximately 30 major urbanized area, and more than 60% along the coast area. And as I'm showing here in this map here, you see those are the red color means the higher population density, and most of those people, more than 60% people actually are living along the coastal area. There's also Central Florida here, Orlando area. And so based on the 2010 census, and in Florida, there's more than 21 million population, and the projection is showing the continued increase, and those figures here shows the population growth in Florida over the past 180 years. As you can see, it shows exponential growth, and the projection shows that it's going to continue to increase in the years to come. Also, one thing I want to mention that it's based on the census, 90% of a Floridian and people living in Florida over 65 years old, in comparison with the 15% for the US population. And this trend is going to continue to increase. Florida is also one of the United States economic powerhouse, and it has the fourth biggest economy in the US. And Florida's GDP reached $1 trillion in 2018. And the top two drivers are tourism and agriculture. And here, this figure shows that the tourists, they visiting Florida over the, almost like 80, 90 years. And you're gonna see again, the exponential growth, and the projection is that the tourists is going to continue to increase. So as introduced earlier, Florida is highly vulnerable to climate change variability, extreme weather events, and Florida faces quite a few climate sensitive hazards. Among them, the top 7 are showing here: hurricane winds, storm surge, flash flooding, sea level rise, extreme heat, drought, and wildland fires. And in the review we did for Florida Climate Institute, we focused on these 5 major climate sensitive hazards. So Florida has experienced a greater number of the hurricane landfall than any other states in the US, and the more intense hurricanes are expected. And this map shows the historical distribution of a hurricane landfall and the average return time. And those dots here shows the average return time, and from 5 to 7 years, 8 to 11, 12 to 16 years. So as we can see that in southern Florida, and the return time is, there's going to be hurricane landfall every 5 to 7 years. And based on the historical statistic, more than 70 known hurricanes occurred over the past century. and 46% chance one hurricane can hit each year in the future. And also I want to mention that the intensity of this hurricane expect to increase as well. So in Florida, every coastal county is a potential target for hurricane storm surge, but some have a higher risk than others do. And these 4 figures shows that the risk distribution of a tropical storm wind, hurricane wind, storm surge, and the sea level rise. And this one is tropical storm force wind. As you can see that the darker the color, the greener the color, it means the higher the risk. And for the tropical storm force wind, you're going to see that this part of the state is highly vulnerable on the higher risk. And for hurricane force wind, and the southern Florida and the Panhandle area in Tallahassee area is a higher risk. And for storm surge, and based on the specific the hurricane category from 1 to 5, and you're going to see that the impact could be up to inland Florida up to 50 miles. So this color right here shows that when the hurricane category 5 and hit Florida, and the impact, the storm surge could be impacted up to those areas. And for sea level rise risk, and you're going to see that here, southern Florida is at the higher risk. And based on the projection within 80 years, and the city of Miami, part of the Miami, going to be under the water. So Florida has a warm subtropical and tropical climate, and due to continuous summer heat and extreme weather events, temperature around the states can reach level potentially harmful for human health. And through the analysis of historical data, the average summer temperature has been showing overall increasing trend, particularly after 1980s. And it shows a greater upward trend, and the map shows the annual mean number of days with maximum temperature greater than equal to this 95 Fahrenheit. It's equal to 35 degrees Celsius. As the hottest daytime temperature occurred in the northern region and this part of the states, and also its interior portion of the states. And for this map, you can see that there is a substantial spatial heterogeneity in this impact. So for the likely impact pathway by which such climate-sensitive hazard affect the human health in Florida, and here we use a classical way to group them, direct, indirect, and through socio-economic disruption. For direct exposure, here's some direct impact could be from the flooding, storm damage, heat stress, lightning strike. Indirect exposure included disease vector, water and air pollution. And for socio-economic disruption could be from the mental health impact, the community health impact. Those are some of the direct impact associated with the climate-sensitive hazard in Florida. Not surprisingly, injury and death is among the top. And Florida has experienced the largest number of deaths due to extreme weather events and the lightning strike in the US. And using the historical data we have gathered from the Florida Department of Health, and we look at the data span from 2005 to 2005 and to 2012, and we identified there's a significant higher injury-related ED visits and the hospitalization rate and CO poisoning related ED visit during the tropical cyclone landfall. One of the things I also want to mention that the property damage is one of those biggest direct impact to Floridians, and Florida is one of those world's largest insured catastrophic markets. So major health effects observed in the states associated with heat in Florida, including stroke and heart attack, asthma, based on the available data from 2005 to 2012. And again, there's a significant positive relationship between heat index and the stroke, heart attack at the regional scale, and a higher number of ED visits for asthma associated with a higher temperature. For in Florida, some of those food and waterborne diseases are among those in direct exposure or impact the pathway here. And in the review, we look at both water foodborne disease and vector-borne diseases. More than 20 major water and foodborne pathogen and toxin producers are reported in Florida. And those are included from family of protozoa, virus, bacterial agent, and also other, for example, the algal bloom. And Florida has the highest, the foodborne incidence or outbreak in the US, and in particular related Campylobacter, those are the actually continue to show increasing trend. And some other also noteworthy is that the algal bloom, and it's also one of those big issue in Florida as well. And but there's a limited epidemiological evidence, and 4 diseases were studied and based on the available data. And we are only able to see that the cryptosporidiasis and the semolizid were significantly associated with the tropical cyclone, and no other study on other pathogen and diseases. More than 10 vector-borne diseases we report in the US. Those are the list of the vector-borne disease reported in the state of Florida. And one of those major concern, disease of the major concern is dengue. As you probably are aware, dengue's transmission, local transmission was established first quite a few years ago in Miami area. Now the local transmission and the locally acquired infection are reported in more than 6 counties. And this number looks like the continuing increase, and we have no clue and what kind of impact and for example, including the human movement, climate change, what kind of impact on the spread of dengue in Florida. So indirect impact the pathway primarily included the mental health and including stress and distress, anxiety, and PTSD, and suicide, and community health. Primarily include interpersonal aggression, violence, crime, and also social instability. And there's some study reported the relationship between different the mental health and the community health issue related to these climate sensitive hazard, in particular related to hurricane and the tropical storm. And most of the study were conducted in the southern Florida, Miami area. Again, the population of the children among the most studied, and largely because they're particularly vulnerable to those impacts. So in response to those climate sensitive hazards and protect the public health, and the Florida Department of Health, together with the health department at the county level, play a central role in the state's public health system. So the systematic surveillance of the health population in the states is primarily coordinated, guided by Florida Department of Health, and together with county level Department of Health. So in 2012, and US CDC launched a program called the Building Resilience Against the Climate Effect BRACE framework. And this is a part of the CDC's initiative, and the Florida was selected to be one of the states to receive funding and the guidance from the CDC. And there's 5 steps involved in the BRACE program. The first is the forecasting climate impact and assessing vulnerability. And the second is that the projecting the disease burden. Third, assessing public health intervention. Fourth, developing and implementing climate and health adaptation plan. And five is evaluating impact and improving quality activity. And currently, there's 8 counties in Florida were selected to pilot test the BRIEF programs. One of those major purpose at this county level BRIEF program is to build awareness in county health department at the community level on health-related risk of the climate change, and to support county health department in designing, implementing, and evaluating health intervention to address climate risk. So among those 8 counties, and it divided into the East Central Florida, Southern Florida, and the Southwest of Florida, and the focus of the implementation are different. And for East Central Florida, primary focus on implementing and evaluating extreme heat education campaign. And for Southern
Dr.
Florida,
Liang, can I ask you slowly to come to a conclusion? We are running out of time. Thank you.
So this is the primary of the program at the county level. So some of the major challenges include there are still lots of unknown, and both of the future warming trend and the health or the hazard on the spread of transmission of vector-borne disease, and the impact of, in particular, increased elderly population in the states, and also the tourist impact. We have no idea. So there's a lot of future research, and the public health surveillance, it's much needed. So I want to kind of acknowledge the Florida BRIEF program, and also colleagues from the Florida Department of Health and the University of Tennessee, and also my university. Thank you.
Okay, thanks very much, Dr. Liang, for this really very good and very concrete overview of the situation in Florida. I'm now inviting questions from the floor. I have a sign from the back that we don't have yet questions. No, we have one, but is there a question from the floor? I don't see anybody. Then let's take a question from the app. Can you project it? Thanks very much. Dr. Liang, the question is the following. How can authorities in Florida share their lessons learned till date in managing health systems in the face of climate challenges with state and local authorities in less developed countries, including small island developing states? Did you hear the question?
Yeah, I just actually just switched it to your screen. I can't hear the question. I think this is a very good question, and one of the things, and here at the Florida Climate Institute, and we've been working very closely with the Florida Department of Health, is trying to summarize the lesson and the Florida has learned and also experience we have had. But I want to tell you that this process has been very slow, and for lots of different, largely from political reasons. So, but as a researcher, we've been working very, very closely, trying to kind of, really to summarize some of those important lessons we have had here in Florida.
Okay, thanks very much. Yes, please, can we just wait for the mic? We have another question coming, but 1 second.
Yeah, a bit adding on the former question, you know how your neighbors, Cuba, are doing with their research and their implementation of climate and health?
Unfortunately, I don't have any information. I know that both Cuba and Florida share lots of similarity in terms of the fishing our tropical paradise, as well as those kind of the climate-related hazards. we share lots of similarity, but in terms of how we actually coordinated the effort in terms of the adaptation work towards the mitigating the impact, I really don't have any information on that.
Okay, thanks very much. I cannot see any other hand, and there don't seem to be any more questions from the app. So thanks very much, Dr. Liang, and have a good day in Florida.
Okay, thank you very much.
Okay, the last speaker is actually my neighbor in the office, but it seems he's somewhere in Asia now. So is Jakob Zinstag online?
Yes, can you hear me?
Yes, hello, Jakob. Where are you exactly?
I'm in Tokyo.
Ah, wonderful. So it's sometime quite late for you now?
Yes, it's 9:15.
In the evening, okay. Very, very good. So, well, you'll be pleased to know that your office, everything is okay.
Good. Can you see the background?
Yes, we see you kind of floating over pagoda. So
Yeah,
not quite sure what
remove
you're
it
doing to
again.
yourself. Okay, Jakob, the floor is yours. Huh?
Okay, I just need to find out how to share the screen. I probably get out of the settings. Yes. Okay. And I go to full screen for the, yeah.
It should be on.
Can you see this, the screen?
Jakob?
Yes.
Yep, we see your screen. All good.
Okay. I go in full screen. Can you see the screen?
Yes, we see.
Okay. So, ladies and gentlemen, it's a great pleasure to talk to you about health systems, One Health and climate change. You can still hear me? You can still hear me, I trust. Okay, so I would like to talk to you about 5 points. The first is environmental concerns are not new. There have been long-standing political and religious precedents in the 20th century. And then I would like to talk to you about the keynote that I gave 10 years ago at the International Society of Veterinary Epidemiology and Economics in Durban in 2009. Then I would like to refer to the countdown on health and climate change and a paper that we published on One Health and climate change. And I would like to give you an outlook on a green digitalization for health. You can still hear me? Good. So I just would like to make a historical glimpse on environment and health. I would like to refer to The Limits of Growth by Donella and Dennis Meadows, 1972. They already addressed that our resources are limited in actually at a symposium in St. Gallen in Switzerland. And I would also like to refer to the conciliatory process of the Christian churches that started in Vancouver in 1983 and to a significant meeting in Basel in 1989 about peace, justice, and the preservation of creation. This was actually rooted in an earlier process in 1934 that was launched by Dietrich Bonhoeffer. These movements have pointed out to the inextricable linkages of social justice, peace, and the preservation of creation. All this has led to the World Commission on Environment and Development, which was led by Gro Harlem Brundtland, entitled Our Common Future, which is a famous report and which was the first time that health and environment was firmly addressed. This has led to the conferences in Rio de Janeiro in 1992 with Agenda 21, to the conference of Rio +5 in 1997, and the conference on sustainable development in Johannesburg 2012. Myself, I gave a keynote in 2009 in Durban, also in South Africa, on ecosystem approaches to health, and where I addressed the inextricable linkages between ecosystems, society, and health for humans and animals. And I argued also that the contemporary complex health problems cannot be solved by reductionist approaches and require ecological and social systems thinking. You see the paper that we published from that keynote below. From one medicine to one health and systemic approaches to health and well-being. You see also the old Swiss TPH PowerPoint frame. I copied it actually expressly to show you that this is nothing new. So I argued also towards a modern theory of medicine, because the accelerated fragmentation of medical and veterinary science are not conducive for complex problem solving. We must recognize the complex interdependence of humans, animals, and the environment. So the question was how we can move towards a modern theory of health of animals and humans, which has the power to deal with these new complex challenges. I refer to Elinor Ostrom, Nobel Prize in Economics 2009, and actually I was then on sabbatical in Canada, and I called Elinor Ostrom and asked her if health was an outcome of social ecological systems, and she told me she never thought about that. We propose actually a concept of health in social ecological systems that is complex, multivariable, non-linear, across scales, and changing. Unfortunately, we could not continue our collaboration with Elinor Ostrom because she shortly after died. That is very sad. But we have proposed this concept of health in social ecological systems that became also a key area of activity. It is still alive in the strategic objective number 4, which is now called again Health and Environment, and in Swiss TPH. And I'm proud that this strategic objective of Swiss TPH proposes a plan to decarb Swiss TPH. I think also about that health, freedom of illness and disease could be considered as part of common property and would then be possible to be linked to Elinor Ostrom's common property economics. Already then I emphasized, and you see the green arrows, the importance of addressing climate change and resource depletion. I refer to the first commotions of the energy crisis, and also how to provide health to a 2000-watt society. Let us go back to the present time. So we make a jump of 10 years. Now we are today, and one of the most recent publications is the Countdown on Health and Climate Change in Lancet by Watts and collaborators, which has entirely a public health focus and does not relate to animal health. And we argue that addressing the effects of climate change and climate variability on health is very complicated because it is entangled with many other phenomena. Other important phenomena are the demographic change, the social and economic and environmental and landscape changes, which can often not be separated easily. We still advocate for ecosystemic approaches and actually this health in social ecological systems in a paper we published in 2018 on climate change and One Health. I will not rehearse this paper to you, you can read it, but I will just address a few features from that paper. One is food security and food safety. In semi-arid and highland areas, livestock are critical for food security and livelihoods of people. Droughts often kill significantly more livestock than humans, with catastrophic consequences for food security and also the lack of purchase power for people for cereals. Obviously, we advocate a reduced cattle meat consumption in high-income countries because that also contributes to reduce greenhouse effects and improves health of people. An important point is integrated human, animal and environmental disease surveillance response systems. The World Bank has already addressed this in 2012. We show here a graphic that has been initially designed by the World Bank, and that shows that the longer you wait to detect a vector-borne zoonotic disease, the higher are the cumulative cost. So if you find mosquitoes infected, for example, with West Nile virus already at an early stage, the costs are very low. That's the schematic on the left side. If you wait until you find West Nile virus in humans, you have a high cumulative cost. This has actually been measured in Emilia-Romagna in Italy. We discussed last year about this example already. This is the economics of integrated mosquito, animal, human surveillance of West Nile virus in northern Italy, and clearly shows that there are already savings by sharing information between animal health, entomology, and public health. This is surely applicable to a range of vector-borne zoonotic diseases that are upcoming. I think about Rift Valley fever, I think about MERS, and other emerging vector-borne diseases. To end my talk, I would like to give you an outlook to a new project that just starts, which is actually about digitalization. We want to test the coverage of post-exposure prophylaxis to achieve zero human rabies death in 2 countries of West Africa, in Côte d'Ivoire and in Mali. There is, of course, criticism against the use of blockchain in healthcare because of the high energy consumption. So we have the ambition to make this approach as green as possible. The original motivation is the annoying fact that still people die from rabies in these countries because post-exposure prophylaxis is not available. So through a blockchain system, we would connect the veterinary and public health sector, as you see here, as example of the veterinary and public health authorities of the region of Sikasso, which started to communicate when we started an earlier project for the first time. Here you see the flow chart, how the blockchain would be organized. If you start on top left, human patients who would be rabies exposed, they come to the health center and would start an electronic health record. The health record will be shared through the whole health system, through the vaccine supply chain that you see on the right side, down even to Gavi. And on the left side, it will be shared with the veterinary system to secure that the biting animal is diagnosed properly. All these arrows will be secured with blockchain, that they cannot be altered. The problem is that if this is not blockchain secured, vaccine can be just sold, and we cannot stop a corrupted health system. So the advantage of using blockchain is really that you can avoid corruption in the provision of vaccines. So this is just to give you a flavor of what is coming and which has a tremendous potential for health services through electronic patient record. Showing this with rabies has advantages because the case numbers are low and the system is relatively simple. But the ambition is clearly to start using blockchain for overall health records, but still with the ambition of keeping it as green as possible. The point is that if we can keep out speculation and data mining out of health-related blockchains, then I believe that we can keep the energy consumption very low. So with this outlook, I thank you very much for your attention, and I'm happy to answer your questions. Thank you very much.
Okay, thanks very much, Jakob. Just to reassure you, finally, we heard you loud and clear, so I think we're all good on this side. I invite comments or questions from the floor. Yes, please. We are, Jakob, we're waiting for the microphone, and then Blaise Janton is ready to challenge you.
Yeah.
Hello, Jacob. It's Blaise. I know that you are veterinarian, so you love animals. But as you know that cows are one of the major drivers of methane production, it seems reasonable to reduce the number of cows on the planet. Do you agree with that? And how do you see this happening, and if it can happen?
Thank you for that point. My position is very clear on that. Yes, we have to reduce our red meat consumption in the industrialized countries. We should reduce the number of cows. But where I am against it is in those areas where people cannot survive without animals. So in all mountain areas or in semi-arid areas, if you take away the cows, people cannot survive any longer. So I recommend that we concentrate cattle production in those areas where no other production is possible.
Okay, thanks very much. Another question coming?
Tobias Schuster from Freiburg in Germany. You described the concept of One Health. Next to it, there are concepts such as GeoHealth, planetary health, and others that are from different disciplines. There are various concepts of an integrated health between the planet and the individual and the people. How would you say it's all just one, all the same? So planetary health, One Health, GeoHealth, EcoHealth, or is it relevant to have these different disciplines?
I'm sorry, I kicked out a slide that would be a Boolean explanation of the relationship of these concepts. One Health is clearly defined as incremental benefit of doctors working with veterinarians. And we can prove such incremental benefits. And eco-health or planetary health are just extensions that extend it also to the environment. And I would say any concept that can show incremental benefits of working together of different disciplines is valid. But if you cannot prove it, then it is hard to justify it. So I would argue, let us be open and let us not be dogmatic, but let us prove that working together is beneficial. If we can prove that, then I think we are on a good track.
Okay, very much. Any other question? No, and I see there is no question asked via the app. So I think this concludes our session. Thanks very much, Jacob. I guess it's time for your last sushi before you go to bed.
Yeah.
Vegetarian fish sushi, if possible.
Not sushi, sake.
Oh, sake. Okay, very good. Then yeah, have a good one on us, and a good evening to you. Huh?
Thank you very much. Thank you for joining me. Yeah. Bye-bye.
Ladies and gentlemen, this concludes our session. I mean, unlike traditional sessions, I cannot say just go and talk to the speakers if you have additional questions, but you can probably reach them by email, certainly, if you want to do so. Otherwise, I wish you a good lunch. Bye-bye.
Stop explaining, don't tell me 'cause it hurts. Don't speak, I know just what you're thinking, and I don't need your reasons. Don't tell me 'cause it hurts. Don't speak. Roxanne, you don't have to put on the red light. Those days are over. You don't have to sell your body to the night. Roxanne, you don't have to wear that dress tonight. Walk the street for money. You don't care if it's wrong or if it's right. Put on the red light. 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 Roxanne. I know this in New York. I haven't talked down to you. I had to tell you just how I feel. I will share you with another boy. I know my mind is made up, so put away your makeup. Told you once, I won't tell you again. It's a bad way. Put on the red light. 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 Little darling, it's been a long, cold, lonely winter. Little darling, it feels like years and it's been here. Here comes the sun. Here comes the sun, and I say it's alright.
Little darling, the smiles return into the faces. Little darling, it seems like years since it's been clear. Here comes the sun, here comes the sun, and I say it's alright. Sun, 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 here it comes. Sun, 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 here it comes. Sun, 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 here it comes. Little darling, I feel that ice is slowly melting. Little darling, it seems like years and it's been clear. Here comes the sun, here comes the sun, and I say it's alright. Here comes the sun, here comes the sun, and I say it's alright.
Just a man tipping on a wire, tightrope walking fool, balanced on desire. I cannot control these ever-changing ways, so how can I be sure the feeling will remain? It'll always change, but everything I am is yours. Everything I am is yours. Find it hard to say what's going on inside. Got these little walls, I couldn't break them if I tried, but I promise I'll be true, and I promise I'll be right. Sickness and in hell, in the darkness and the light, I give you every side, 'cause everything I am is yours. Everything I am is yours. Left my demons at the door, so what you opening it for?
Every breath you take, every move you make, every bound you break, every step you take, I'll be watching you. Every single day, every word you say, every game you play, every night you stay, I'll be watching you. Oh, can you see you belong to me? How my poor heart aches with every step you take, every move you make, every bow you break, every smile you fake, every claim you stake, I've been watching you. Since you've gone, I've been lost without a trace. I dream at night, I can only see your face. I look around, but it's you I can't replace. I feel so cold and I long for your embrace. I keep crying, baby, baby, please. Oh, can't you see you belong to me? How my poor heart aches with every step you take, every move you make, every bow you break, every smile you fake, every claim you stake, I've been watching you. Every smile you fake, every claim you stake, I've been watching you. Every smile you fake, every claim you stake, I've been watching you. Every smile you fake, every claim you stake, I've been watching you. Every smile you fake, every claim you stake, I've been watching you.
Everything is good and brown. Oh, I'm here again with the sunshine smiling upon my face. My friends are close at hand, and all my inhibitions have disappeared without a trace. I'm glad, oh, that I found somebody who I can rely on. This is the return of the space cowboy interplanetary good but soon say at the speed of cheaper. Oh, you and I go deeper. Maybe I have to get high to get by. Everything is good, and green. Said I'm red again, and I don't suppose I'm coming down. I can see clearly, so high in sky. A man with psychedelic picture frames of happiness to shade his eyes. He's glad, oh, that I found somebody who he can rely on. This is the return of the space cowboy interplanetary good but soon set at the speed of cheaper. Oh, you and I go deeper. Maybe I have to get high to get by. This is the return of the space cowboy, and the planet's every good person. Stay at the speed of Chiba, or you and I go deeper, or get high to get by. You and I go deeper. Space cowboy. This is the return. Steer it up, little darling. Steer it up, come on, baby. Come on and steer it up, little darling. Steer it up. Oh. It's been a long, long time since I got you on my mind. Now you are here, I said it's so clear. So much we could do, baby. Just me and you, come on and steer it up. Little darling, steer it up. Come on, baby. Come on and steer it up. Little darling, steer it up. When I blaze your fire, then I satisfy your heart's desire. Said I steer it every minute. All you have to do, baby, is keep it. Come on and steer it up. Little darling, steer it up. Come on and steer it up. Little darling, steer it up. Today is gonna be the day that they're gonna throw it back to you. By now you should have somehow realized what you gotta do. I don't believe that anybody feels the way I do about you now. Back then the word is on the street that the fire in your heart is out. I'm sure you had it all before, but you never really had a doubt. I don't believe that anybody feels the way I do about you now. And all the roads we had to walk are winding, and all the lights that lead us, they're are blinding. There are many things that I would like to say to you, but I don't know how. 'Cause maybe you're gonna be the one that saves me. And after all, you're my wonderwall. And all the roads that lead us, they're are blinding. And all the lights that light the way are blinding. There are many things that I would like to say to you, but I don't know how. 'Cause maybe you're gonna be the one that saves me. And after all, you're my wonderwall. I want to run, I want to hide, I want to tear down the walls that hold me inside. I want to reach out and touch the flame where the streets have no name. I want to feel sunlight on my face. I see the dust part disappear without a trace. I want to take shelter from the poison rain where the streets have no name. Where the streets have no name. Where the streets have no name. We're still building them, burning down love. Burning down love. And when I go there with you. I'll show you a place high on a desert plain where the streets have no name. And all love turns to rest. We're beaten and blown by the wind, blown by the wind. Oh, I see light. See our love turns to rest. We're beaten and blown by the wind, blown by the wind. Oh, and I go there. I go there with you. It's all I can do. It was 929 Max Street, big city. The sun was going down, there was music all around, it felt so right. It was one of those nights when you feel the world step turning. You were standing there, there was music in the air. I should have been away, but I knew I had to say, let's run to London, just heading out. Let's run to London, just leaving town. But I really want tonight to last forever. I really want to be with you. Let the music play on down the line tonight. It was one of those nights when you feel the fires burning. Everybody was there, everybody to share. It felt so right. There you were on your own, looking like you were the only one around. I had to be with you, nothing else that I could do. I should have been away, but I knew I had to say, let's run to London, just heading out. Let's run to London, just leaving town. But I really want tonight to last forever. I really want to be with you. Let the music play on down the line tonight. Underneath the starry sky, time was still, but ours must really have rushed by. I didn't realize, but love was in your eyes. I really should have gone, but love went on and on. Let's run to London, just heading out. Let's run to London, just leaving town. But I really want tonight to last forever. I really want to be with you. Step off the train, walking down your street again, past your door, but you don't live there anymore. It's years since you've been there. Now you disappeared somewhere, like out of space. You found some better place, and I miss you. Like the deserts miss the rain, and I miss you. And I miss you. Like the deserts miss the rain. Could you be that? You always were 2 steps ahead of everyone. We'd walk behind while you run. I look up at your house, and I can almost hear you shout down to me, where I always used to be. And I miss you. Like the deserts miss the rain, and I miss you. And I miss you. Like the deserts miss the rain. Back on the train, I ask myself, why did I come again? Can I confess? I've been hanging around your old address. The years have proved to offer nothing since you moved. You're long gone, but I can move on, and I miss you. Like the deserts miss the rain, and I miss you. And I miss you. Like the deserts miss the rain. And I miss you. And I'm missing you. I miss you. Oh, I miss
So true, funny it seems, always in time, but never in line for dreams. Head over heel, won't toe to toe. This is the sound of my soul. This is the sound. I bought a ticket to the world, but now I'll come back again. Why do I find it hard to write and explain? Oh, I want the truth to be said. I know this match is true. I know this match is true. deaths of the nerves that have just begun. Listen to Marvin all night long. This is the sound of my soul. This is the sound. Always slipping from my hands. Set a time of its own. Take your scissored arms and write an exclaim. But I want the truth to be known. And know this much is true. And know this much is true. I bought a ticket to the world, but now I've come back again. Why do I find it hard to write an exclaim? But I want the truth to be said. I know this much is true. And know this much is true.
She sits alone, waiting for suggestions. He's so nervous, avoiding all her questions. His lips are dry, her heart is gently pounding. Don't you just know exactly what they're thinking? If you want my body and you think I'm sexy, come on, sugar, let me know. If you really need me, just reach out and touch me. Come on, honey, tell me so, baby. Now he's acting shy, looking for an answer. Come on, honey, let's spend the night together. Now, hold on a minute. Before we go much further, give me a dime so I can phone my mother. They catch a cab to this high-rise apartment. At last he can tell her exactly what his heart meant. If you want my body and you think I'm sexy, come on, sugar, let me know. If you really need me, just reach out and touch me. Come on, honey, tell me so. Oh, no. His heart's beating like a drum, 'cause at last he's got his girl home. Come on, relax, baby, and now we are alone. Oh. They wake up down, 'cause all the birds are singing. Two total strangers, but that ain't what they're thinking. Outside it's cold, misty, and it's raining. They got each other, need son's complaining. He says, I'm sorry, but amount of milk and coffee. Never mind sugar, we can watch the early movie. If you want my body and you think I'm sexy, come on sugar, let me know. If you really need me, just reach out and touch me. Come on honey, tell me so. Oh,
Ain't the sunshine when she's gone. It's not warm when she's away. Ain't the sunshine when she's gone, and she's always gone too long. Anytime she goes away, wonder this time where she's gone. Wonder if she's gonna stay. Ain't the sunshine when she's gone, and this house just ain't no home. Anytime she goes away. And I know, 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 I know. Yeah, you leave the young thing alone, but ain't no sunshine when she's gone. Ain't the sunshine when she's gone. Only darkness every day. Ain't the sunshine when she's gone, and this house just ain't no home. Anytime she goes away. Ain't the sunshine when she's gone. Only darkness every day. Ain't the sunshine when she's gone, and this house just ain't no home. Anytime she goes away. Anytime she goes away. Anytime. Anytime she goes away. Anytime she goes away. Anytime she goes away. Anytime she goes away. Anytime she goes away.
Her hair is hollow gold, her lips sweet surprise. Her hands are never cold. She's got Bette Davis eyes to turn her music on. You won't have to think twice. She's pure as New York snow. She's got Bette Davis eyes. And she'll tease you, she'll unease you, all the better just to please you. She's precautious, and she knows just what it takes to make her blush. She got Greta Garbo stand up side. She's got Bette Davis eyes. She'll let you take her home. It whets her appetite. She'll lay you on her throne. She got Bette Davis eyes. She'll take her tumble on you. Roll you like to her dice until you come out blue. She's got Bette Davis eyes. She'll expose you when she knows you off your feet with a crumb. She throws you. She's ferocious, and she knows just what it takes to make her blush. All the boys think she's a spy. She's got Bette Davis eyes. And she'll tease you, she'll unease you, all the better just to please you. She's precautious, and she knows just what it takes to make her blush. All the boys think she's a spy. She's got Bette Davis eyes. She'll tease you,
Hey.
she'll unease you, just to please you. She's got Bette Davis eyes.
Calling on the world, the Holy Spirit. Have mercy on my soul, for I feel I'm losing. There's a million ways to die, and I've been walking them all. But something kept me going every time I wanted to fall. Now I'm stranded here with a ton of debris, with a million pieces of what I thought could be. spent a lifetime to feel escaping home. It got bigger and bigger like a malicious wound. I fed it hate, fed it all my love. It kept screaming for more, never had enough. Swallowed my hope, drank all my dreams, devoured my world, and all that remains is a mountain of guilt, a shipload of shame, and the bitter recognition I am to blame. Calling on the world and the Holy Spirit. Have mercy on my soul, for I feel I might lose it. There's a million ways to die, and I've been walking them all. Now I'm too tired to keep standing tall. I'm stranded here with a ton of debris, with a million pieces of what I thought could be me, and this infinite sadness that keeps pouring like rain, and a bitter recognition that I am to blame.
Never know how much I love you. Never know how much I care. When you put your arms around me, I get a fever that's so hard to bear. You give me fever.
Good afternoon, dear colleagues. For this last session of what I understand was a really great and stimulating meeting. It's my pleasure to moderate this session, From Research to Policy to Change. Before I do that, it's just to remind you that you can pose questions for the discussion section over the app, which I think by now you all know. Please also make sure that when you post a question, you also add who you want to answer to the question. Maybe it can sometimes be 2 people. We'll also include the presentation by Martin Rösli and Mirko Winkler in the discussion section. You also have these little pieces of paper in front of you tagged to the different chairs. Don't stop listening to the speakers, but maybe you are able to do 2 things at a time. Try to already go to this link so that then you can actually participate in the polls later in the afternoon. And with that, it's actually my very great pleasure to introduce Dr. Roland Hohmann, who is an environmental scientist from ETH with a PhD from ERWAG. He's heading climate reporting and adaptation section in the Federal Office for the Environment, and is therefore importantly responsible for the implementation of the Federal Council Strategy Adaptation for Climate Change in Switzerland. And we're really looking forward to your presentation. I should also say that Professor Andreas Fischli is unfortunately unable to give the presentation. I think he fell ill. It gives us, that's unfortunate. There is always a good side. You have a little bit more time in case you run into time pressure issues.
Very good. Thank you very much for the kind introduction. Ladies and gentlemen, good afternoon. It's always a difficult task to be the first speaker after lunch break, and it's even more difficult to be a speaker who didn't know what the previous speakers told you, because I was unfortunately unable to be here. Andreas Fischlin used to be a professor of mine, and he always gave me a strange look when I said, I couldn't do this work because I was ill. But now it's vice versa. So as Mrs. Probst already said, my name is Roland Hohmann. I work for the Federal Office for the Environment, where I'm heading the section Climate Reporting and Adaptation. I myself, I'm concerned with adaptation. My colleague Regina Rötlisberg is doing the reporting part. I will talk about Switzerland assessing climate change risks and opportunities. I must say I will talk more about risks, not about opportunities, but anyway. From the last assessment report of the IPCC, there came 2 storylines which are very important for climate policy. On the left, you see, I call it the Accord de Paris world. It shows you how the global temperature would evolve if we reach the objectives of the Paris Agreement. And this, of course, is a very important storyline for mitigation. All the policymakers now gather these days in Madrid, trying to come up with a rule book to implement the Paris Agreement, the Accord de Paris. To the right, you see what I call the business as usual world. It's the so-called RCP 8.5 climate scenario, emission scenario. It shows you how temperatures on the globe would evolve if the emissions keep on rising as they do right now. So this is an important guideline for adaptation policymaking, of course. And to make it short, right now we are more on the trajectory of the RCP 8.5 than of the Accord de Paris world. Meteor Swiss downscaled these scenarios I just showed you on the global scale to Switzerland. And I think Erich Fischl from Meteor Swiss showed you the Swiss climate change scenarios yesterday as one of the introductory talks. But anyway, for repetition, you see here the green lines show you the RCP 2.6 or the Accord de Paris world. It simply shows you that, let's see how this works. It does, yeah. It shows you that If we reach the 2-degree global objective target, then Switzerland will experience an additional 1 to 2 degree of warming. We already have 2 degrees since pre-industrial period. If we keep on evolving on the RCP 8.5 trajectory, temperatures will increase by 2060 by about 2.5 degrees in Switzerland. That's an average over all Switzerland, and by the end of the century, we will have an additional 5 degrees compared to the period 1980-2010. The average temperature for most of you, that's a value we cannot cope with, but we can cope with or we can imagine what it means in terms of heat, of hot days. And I show you here 2 maps. They show you the number of dog days we experience in Switzerland to the left in the nowadays period, and to the right in the period around 2060. Dog days are days where the maximum temperature is above 30 degrees. These are days which we experience as very hot. We feel uncomfortable, we are stressed, etc., etc. So if you look at Lucerne nowadays experiences about 6 dog days per year on average, and by 2060, if we keep on the RCP 8.5 track, it will this number will increase between 17 and 38 dog days. So that's multiplied by, what is it, 3 to 6 times more dog days than nowadays. The situation is even worse in the southern part, in Magadino, or also in Geneva, where we will have a tremendous increase in these days. Not only the number of hot days will increase, also the temperature of hot days will increase more than the average temperature. I'll show you here a weekly forecast during the summer 2015 heat wave for Zurich. For Zurich, the forecast said that temperatures will rise up to 35, 36 degrees. And by 2060, these numbers, the forecast may look like this, that the maximum temperatures will go above 40 degrees, and then it is really then we feel really uncomfortable, I guess. Why do I show this to you? And I imagine you have seen this curve during this conference already several times, but I show it to you anyway. It shows the excess mortality during heat waves 2003, 2015, and 2018. This is work, by the way, from the Swiss TPH. They did this for the Federal Office for Public Health and for us as well. So it simply shows you how during the heat wave, let's see, hoopla. We experienced these peaks of excess mortality, which the federal government, of course, is very concerned about. So, what is the response on the federal level? When I show this picture, I usually say we have a meeting and have a debate. But of course, we have more than that. In Switzerland has a climate change a law. We have the CO2 Act. The CO2 Act includes, as the most important part, it includes a mitigation target. By 2020, we try to reduce our emissions in Switzerland by 20% compared to 1990. And the proposal of the Federal Council to Parliament for the revision of the CO2 Act includes a goal of reducing the emissions by 50% by the year of 2030. Well, Swiss people who read the papers know that we are having difficulties with getting this revised CO2 Act passing the Parliament. The debate is going on, and by now we are still uncertain whether or not we will be able to have the law in time to continue climate policy after the recent law is finishing. For adaptation, this law contains an important article, Article 8. It's on adaptation. It simply says that the federal government is supposed to coordinate measures for adaptation and also to provide the knowledge base in order to do adaptation. Next to the law, we also have a mandate by the Federal Council. We got this mandate in 2009. The Federal Council mandated us to develop an adaptation strategy. We were to assess climate change risks. We were to define strategic goals, and we were to develop and coordinate adaptation measures on the federal level. And let me briefly go into this adaptation of climate change risks. We did, in a 6-year study, we did 8 case studies in 8 cantons where we assessed climate change risks and opportunities using the same methodology for all the regions and the same methodologies for all the sectors involved. The case studies were done in Graubünden and Uri, which is representative for the Alpine region. There was a case study in Ticino, representing the southern part of Switzerland. There was one case study in Fribourg, representing the foothills of the Alps. Canton Aargau is representative for the Mittelland region, the plateau. Jura, it goes without saying, is representative for the Jura Mountains, and Geneva and Basel-Stadt were representative for this virtual region urban environment. All the results of these 8 case studies we summarized in an assessment, in a synthesis report, where we tried to draw the map of the risk map, the climate change risk map for the entire country. So for this report, we summarized 200 risks, and we assessed them. First of all, we assessed them with respect to how much does the climate change risks change, how much does the risk change with climate change until 2060. And then we used other criteria to assess the risks. We looked at whether the risk is aggravated by socioeconomic development. We looked at if there are irreversible damages involved. We looked at if there is critical infrastructures involved. Are there conflict of interests? And how is the adaptive capacity of the specific impact area? Based on this assessment, we were able to identify 30 priority risks. And these priority risks we assigned to 12 cross-sectoral challenges. This sounds very complicated. It is not complicated at all. The cross-sectoral challenges are things like increase in heat stress, or increase in mass movements, or harmful species and diseases. And there are several challenges which are important for the health sector, of course, such as the heat stress, floods, mass movements, deterioration of water, soil, and air quality, as well as the harmful species and diseases. And I will briefly go into the heat stress challenge. For the heat stress challenge, we identified a total of 9 risks. You can read them here. And based on the assessment of the risks, we identified 4 priority risks, which is the harming of human health by heat stress, the decrease in work performance, the increasing demand of cooling, and the harming of biodiversity. These risks were assessed as prior. Let's look at the harming of human health. How did this assessment look like? The harming of human health, we assessed as with climate change, there will be a significant increase in these risks in the southern part of Switzerland, as well as in the Mittelland region and in the cities and urban areas. While in the other regions, there will be a moderate increase of this risk. But since there's human life involved, and since this is an irreversible impact, we prioritize the risk for the entire country. So that is one of the results of this climate change risks and opportunity assessment. For the decrease in work performance, we did the same assessment. Of course, the same picture. the increase of the risk due to climate change is significant in southern Switzerland, in the Mittelland region, and in cities and urban areas, and moderate in the remaining part of Switzerland. But since there's not an irreversible impact involved, we prioritized it for Mittelland, Südschweiz, southern Switzerland, and cities and urban areas. Now we have the basis to come up with a strategy. Now, first of all, if you're interested in the study, it's available on our net, and I put the URL on the presentation. I'm sure the presentation will be available after the conference, I guess. It's available in German, French, and Italian. So this is the basis for our adaptation strategy for the federal level. The adaptation strategy consists of two parts. In the first part, which was adopted in 2012, we have objectives, cross-sectoral challenges, and fields of action. And in the second part, adopted in 2014, that's the action plan. So let's have a look at that. The first part, goals, challenges, and fields of action for a total of 9 sectors. We have 9 sectoral strategies. And we describe it for 8 cross-sectoral challenges, which are identical with the cross-sectoral challenges I talked about before. The second part, the action plan, it contains 63 measures on the federal level addressing these fields of actions identified in the first part. It's an action plan lasting for the period of 2014 to 2019. It contains, as I said, 63 measures, 54 of which are sectoral activities, and 9 are cross-sectoral activities to improve the knowledge base and also to improve coordination of adaptation. I said that the action plan lasts until the end of 2019, and we are right now working on a second action plan for the period of 2020 till 2025. And I'll briefly show you how we do this, our methodology. So in this picture, you see the 9 risks I showed to you before, which were identified in the climate change risk analysis. On top, you see the priority risks we identified. And so this was the basis, the knowledge base. We approached our colleagues from different federal offices, and we asked them to assess their need for action with respect to those risks. And for instance, for the risks I showed to you before, the harming of human health and the loss of work performance, the need for action was identified as moderate by the federal offices. Harming of human health by the Federal Office for Public Health, loss in work performance by the State Secretariat for Economy. Now, based on this need for action, we asked them in a second step to come up with measures, and I just show you some to give you an idea how these measures look like. Let's say the public health for a federal office said, okay, we have to provide information, recommendations for the protection of human health during heat waves. We have to provide this information to cantons and also to cities and agglomerations. They did that before, and that's why they assessed their need for action only as moderate and not as high. The Spatial Development Office said, okay, we need to provide planners with information how they can deal with the increasing heat stress in cities and fight urban heat islands. The energy sector said, okay, we need to find ways to reduce the increase in energy demand. This is the building sector. The building sector just basically they will start to continue research on the context of building and heat stress. So they took it up in their research program. And finally, the economy sector says, okay, we have to assess our existing rules, how to protect working people during heat waves and see whether or not we have to make adjustments. So this is just to give you an idea on which high level those measures are. Now, beside that work on the adaptation strategy, of course, we have additional activities. And I just want to go into these reports. We do a lot of monitoring to get a grip on what are the impacts of the increasing heat stress with climate change. And I would like to point out these two reports to you. One of them is the assessment of heat and drought in summer of 2015, by the way, with a picture of Basel, at the Rhine border of Basel. And the second one, we had the last heat wave was in 2018, which we assessed in the second report. The impacts were assessed all over the overall sectors. But by the way, in the 2018 report, this picture, this assessment was included, done, as I said before, by the Swiss TPH. I will end up with the pilot program adaptation to climate change. The pilot program is a small funding program by the federal offices with which we try to trigger the implementation of the federal office's adaptation strategy on a cantonal and on a regional and on a municipality level. In the first phase, we had, which lasted from 2014 to 2016, we had a total of 31 projects. And this is the picture of the second phase, which is going on right now and lasting until 2021. We have a total of 50 projects. These projects are also geared to address the cross-sectoral challenges. And that just give you an idea of what kind of projects these are. These are two projects funded by the Federal Office for Public Health, and it's the Swiss TPH doing the work in this project. The first project is heat stress and mortality. That was a project which looked at the interlink between heat and mortality. The Swiss TPH also looked at measures in place in the different cantons, evaluated them, and came up with the heat wave toolbox, which is just a support to cantons to give them some ideas what they could do to better cope with heat waves and to protect people from damage. And I will end up with this project. It's acclimatation. Before I said that we also have projects looking at spatial development. I think on the short run, it's very important to have a climate heat wave toolbox, as shown before. But on the long run, we have to start to design our cities that they provide comfort in hot areas, even if there is more. Even if the temperatures are rising. So I show you the project Acclimatation. It's a project where the city of Sion started to design the public space in order to provide comfort even during heat waves. The picture shows you the Espace des Remparts, where they opened up the ground, installed a water fountain and started to plant trees. Before there was a parking lot. So I think this is a very nice example of how cities can start to rethink their design to provide comfort. And the second project is climate-proof settlement development in Aargau, in Canton Aargau. This is an ongoing project where these ideas are try to bring it into smaller villages in the agglomeration. The findings of these projects we also gathered and came up with another guidebook for cantons, for planners on a cantonal and on a municipality level. It's called Heat Stress in Cities. It provides a knowledge base for climate-proof settlement development. With this, I'm come to an end. I show you this picture again. This is again Espace des Remparts during spring when the heat is not so high yet, but the cherry trees are blossoming. Thank you very much.
Hi, Chris Murray. If there is one clarification question, in principle, I think we'll have the discussion at the end of the afternoon. One comment maybe from my side. I hope that in Zurich, at the Europa Allee, where I heard they're now planting ginkgo trees, not exactly the way to give shade. I hope there is an intervention from your office. But I guess
Europa Allee is always a good example of how it should not be.
Good. Very glad to hear that. Okay, thank you very much. It was very interesting. How does it work now I think we are ready. Can I talk to Chris Murray? Or you are? I thought you're presenting from online. Oh, I'm very sorry. So that I just heard. Okay, that even more happy to present Dr. Chris Murray, a wildlife disease ecologist with a PhD from Queensland in Australia, a true One Health researcher. You really look at the interrelation between environment, human, and animal health, which is a very important topic close to the heart of our institute also. And you're heading an ecologic health research group at Imperial College in London with a focus really on the path from climate change, particularly to infectious diseases. And you have various editorial roles with regard to planetary health, one of which you're also presenting. So we're really looking forward to your presentation.
Thank you very much. So we can imagine this is the future of remote meetings. I appear in hologram, three-dimensional hologram form from London. Yeah, so I want to first just say thanks to the organisers of the meeting. It's been a fantastically interesting meeting to attend, and I was very glad that Gladio extended me an invitation to come down here in person, which I've done with both a climate change conscience, combining with my family connections in Basel. My wife is from Basel and my kids are Swiss, and so I had the double excuse to come down in person. Okay, so I'm going to be talking today about this program called the Lancet Countdown on Health and Climate Change. Many of the talks that I've sat through over the last 2 days have mentioned this rather large scientific effort. And so I thought it would be quite useful just to give you an overview, the background, and where we're kind of heading with this program. So let me just get this. Which way am I pointing here? Okay, here we go. So for anyone that's in this space that's reading articles coming out of the Lancet, you've probably seen quite a few of the Lancet Commission or Lancet Countdown reports over the years. The Lancet's had a long interest in climate change impacts on health, and they sponsored or commissioned an original Lancet Commission on Climate and Health in 2009. And the conclusion of that report was that climate change represented possibly the greatest health threat of the 21st century, a very bold claim coming out of a scientific evidence synthesis, predominantly from health researchers. A few years elapsed, and in 2015, I think the idea was to refresh the evidence base, see what had changed, see what progress had been made. And you'll notice, if you look into the report, that the narrative, the take-home message really changed from one about threat to one about opportunity. So the conclusion was, well, it still represents a major threat, but really it also represents a major health opportunity for the 21st century. Since 2015, the Commission report has kind of shifted gears and has turned into this project called the Lancet Countdown on Health and Climate Change. It's a Lancet Countdown to 2030, and the idea is to track what is happening in that climate change and health space as we shift from that narrative of being a health threat to a health opportunity. So looking for evidence of impact, looking for evidence of greater quantification and evidence base around health impacts, but how that is feeding into, for example, policy and economics, decision making, and ultimately getting to some point where we're neutralising and reversing that threat. So we're now in 2019. 2018, the 2019 report was based on data that's up until 2018. It came out just a few weeks ago. The timing is such that we try to make it coincide with the COP meetings, which is being held currently in Spain. And the idea is to provide this sort of this platform for health to be at the table of these big climate change negotiations and all of the other activities that are going on around the world at that time. The structure of the Lancet Countdown is this sort of five working group structure, the heart of which is in the centre there, the purple. Well, I like to think of it as the heart, since that's the working group that I'm involved in. It's the working group that's focusing on trying to quantify the impacts of climate change on health. And then around that, we have four other working groups. We can read them on the board there. We've got the health benefits of mitigation. We have health adaptation indicators, and then kind of around everything, we have these economic and political context indicators, which I'll just sort of show you roughly what each of these are. So if I spent a couple of minutes on every indicator in this program, it would be a pretty dull Friday evening for you. So I'm not going to go into the indicators themselves in any detail, other than to give you a little bit of a feeling for what's in there. So here are the first 20 indicators. You can sort of run your eyes down there and sort of see that this is the first two working groups, the impacts exposure working group 1 and the adaptation working group 2. And you can see that it covers pretty much the full diversity of issues around health and climate change that have been covered in the talks throughout the conference. Second page of indicators. I'll give you a second to absorb all of those. It is actually quite difficult to represent the Lancet Countdown as an individual author. I'm involved in just a few of these indicators, and so when we go out and talk about the Lancet Countdown program, it's quite difficult to have all of the methodology, all of the results and everything of all 40 indicators in my brain. So do forgive me if I'm a little bit unpolished on some of the results of these indicators, but you can go to the report and you can look up all of the results and all of the details in your own time. I just wanted to give you a sort of an entry into the key message for the 2019 report. As was emphasised by Chris Eby yesterday when she was talking remotely from Washington, the climate change impacts on health very much relate to the health of children and the future of children, and that's the theme of the report for this year, with the main thing that the life of every child born today will be profoundly affected by climate change. The second key message from this report is that despite this shared experience of climate change as a threat or a risk multiplier, there is a second path that we can choose. And somebody yesterday, I think it was Jeremy, was talking about this kind of multi-pathway future, where what we choose to do at any decision point can change the trajectory of our future and where we end up in terms of being a climate resilient culture. And so that second path, which limits the global average temperature rise to well below 2 degrees, according to the Paris Agreement, and that it's possible, and that would transform the health of a child born today for the better all the way through their lifetime. And the third key message is that as we've seen, is just a monumental challenge, and I don't want to sort of underestimate. Yes, there's been a lot of great science. Yes, there's been a lot of great progress, but we really, really need to get moving on so many areas, all of the areas of confronting this challenge, and it's going to take action from pretty much everyone on the planet to really pull this monumental transformation off. Okay, so a couple of examples of the indicators. Like I said, nowhere near enough time to go through all 40. I'm just going to talk about 3, I think. All of them are going to be drawn from this working group 1, the impacts working group. You can see here a sort of a causal diagram, which I find to be not particularly useful. All causal or conceptual diagrams of climate change impacts on health tend to be overwhelming and very difficult to look at. This is no exception, other than to say that the causal pathways are extremely complex and very varied. So we have 5 groups of indicators in this working group. You can see them there written on the right-hand side. We've got heat covered, extreme weather, and fire in the extreme weather sort of bundle. We've got trends in climate-sensitive infectious diseases, and we've got a group on food security and undernutrition. So let me just talk about a couple of those. This is an indicator that is trying to track what's happening with heat exposure. And I should say that all of the indicators in the countdown tend to be built around this idea that we build up a time series of what's happening so that we can clearly see if there's a trend or a trend evolving, and also with the idea that trend is what we are tracking through time. So this is an example of some members of the team evaluating the frequency of extreme heat events. The heat events are defined in a particular way. In this case, it's above. It's a period of 4 degrees in a row that exceeds some threshold of frequency from the past, relative to some baseline, that is. And what this indicator shows is that the frequency of these heat wave exposure events for a vulnerable group, in this case, this is an over 65 years old population, is increasing through time. And in the most recent year, in 2018, the excess above the baseline period was 220 million additional vulnerable people exposed to extremes of heat. And that eclipsed the previous record that we had in our time series of 2016. A second example of an indicator relates to, broadly relates to nutrition and undernutrition. As we've heard in numerous talks, this is a really key issue in the climate change space, the fact that climate change can exacerbate or can lead to losses in crops or crop yield reduction. This indicator is based on trying to estimate that trend through time. So we have a model that is a proxy of crop yield loss that is run from every year from a baseline period all the way through to the present. And you can kind of see from each of those different crop types there that we're losing this kind of yield metric through time. It works out at about 1 to 2% per decade loss for each of these crops. And then the group of climate-sensitive infectious disease indicators at the moment includes 4 categories. It includes an indicator on malaria, an indicator on dengue, indicators on cholera, and other Vibrio bacteria. This is the result for dengue. This is a model that was referred to also by Chris Ebby yesterday that is based on the work of Liu Helmerson. A member of our team is sort of the caretaker of this particular model. It's a vectorial capacity model, which, broadly speaking, attempts to identify the underlying environmental suitability for the transmission of dengue fever. And in this case, we've got models running for 2 different vectors, and they're globally averaged from what is effectively a gridded spatial analysis. And what this time series shows is that the global average environmental suitability for the transmission of dengue virus from these 2 vectors is going up through time. It's a climate-linked model, so we're fairly confident that this is related to the change in climate conditions around the world through time, and the increase is around about 10% improved environmental suitability. So there are a few examples. I'll skip over that and I'll just sort of play this little GIF sort of showing that for all 41 of these indicators that we have in the 2019 report, we have this ambition of trying to precipitate out the key trends and the key findings to track that action on climate and health through time. Okay, so I'll sort of spend the rest of the time just talking about the composition of the Lancet Countdown group. It's, as I mentioned, a fairly massive effort. The 5 working groups are the sort of core, as I mentioned, doing the work in developing the indicators and the methodologies and everything that's associated with their production. There's 15 team members associated with the core Lancet Countdown Secretariat. They're based at UCL in London, but you can see that there's a very large number of institutional partners, predominantly other research institutions, but also including, for example, the World Health Organization, the WMO, and the World Bank, and a bunch of other relevant players there. There were 70 authors this year. That's sort of growing every year as people propose new things to do. It's possible to get new indicators into the program, which we can perhaps talk about after. 70 authors is a lot to manage. I don't know all of the authors, for example. I don't think we've ever all been in the same room at the same time. It's a very large group of people. On top of that, we now have launched an online data exploration website or tool, so that anybody that is interested to tap into this data, look at the trends, think about perhaps the way their data might contribute to indicators, you can go to this website, we'll put the web address here, and you can start mucking around with it. This is new for this year. It was launched on the same day that the report came out, just a few weeks ago, and it's got heaps of data in it, and it provides a way for anybody to go in and explore this data in a much more tangible kind of way. On top of the report that we launch through the Lancet each year, we also have these partnerships with local health groups that have particular interest in representing climate change and health issues at a more local scale. So the Lancet Countdown, the remit is primarily globally representative indicators. And of course, globally represented indicators, the trade-off is that sometimes that's not very useful for local needs, local stakeholders, local relevance, local decision-making. So we team up with organizations around the world to make sure that there's a strong connection between that global level database and what's happening at the local level. So this year we had 11 sort of partnerships that produced regional policy briefs, and typically these are led and championed by people that are very active within certain countries or within certain agencies within countries, for example, public health agencies or the doctor representations or whatever it is. And these are very effective ways of leveraging that global impact of the report and making it more locally relevant. And then, of course, a big part of the countdown is public communication. At the end of the day, we are really trying to just get the word out about the importance of climate change and health, and the media plays an absolutely ginormous part in that process. So we have a very active communications team that sits with the Secretariat in London, and they're very active in trying to engage the media and get some of this stuff in the news at the right time when people are really talking and thinking about climate change and what to do about it. So this year's been the most successful year. Again, every year we seem to eclipse the coverage that we've had in the previous year. When I received the update from the Secretariat prior to submitting my slides last week, there was something around about, actually it was earlier this week, I was late submitting my slides, I remember now, something like 2,200 media outputs that sort of sprung out of the launch of the Lancet Countdown in 2019. We have a media consultant that is tracking the global kind of presence of that media and who's interacting with it through Twitter and various other social platforms. And they've estimated around about 2.5 million impressions. And their biggest stat is that they think that the network of all of the people that have come into contact with the Lancet Countdown results in 2019 extends into the billions of people. So we're now sort of talking very large fractions of the population of the planet. And just to close, as I mentioned, the Lancet is the convening, it's a journal that's convening the Lancet Countdown, and they're involved in a number of levels of helping us to improve the delivery of the indicators every year. And the Wellcome Trust is the funder. They provide the core funding for the Lancet Countdown effort. And I'm going to leave it there. Thanks very much.
you very much, Chris, for a very inspiring talk. Just one question briefly. Are you then also collaborating with the Global Burden of Disease databases? Is that somehow interlinked or?
Yes, we do use global burden of disease data, and we've had plenty of discussions with the team about the use of that data. At the moment, the global burden, the core team of the global burden has not done a climate change specific attribution study, so we don't have figures that specifically relate to climate change causation, which is part of the area that we're sort of trying to push into ultimately. So a lot of our indicators are at the exposure end rather than the attributable fraction of the GBD data, although that said, some of the indicators are pushing in that direction to make that link. Yeah.
Thank you very much. We had thought that we would also, before really going into the discussion, also really listen to the strategy of the group that has developed a decarb strategy proposal for Swiss TPH under the lead of Martin Rösli and Mirko Winkler. I don't know if these two persons have really already been introduced. Let me just do that. I think it's also important that you know our people. It's the Martin Rösli is an environmental scientist heading the Environmental Epidemiology, Exposure and Health Unit. He's a professor in environmental epidemiology and also the co-chair of the joint South African and Swiss Global Environmental Health Chair of the University of Basel. And Martin Rösli is really investigating, I think, pretty much every exposure that you can think of, and ranging from non-ionizing radiation to noise to climate change. And I think that approach is in fact a very important one, because down the road it's really also the interaction and the exposure to all these risk factors jointly. Mirko Winkler is also an environmental scientist leading the Health Impact Assessment Group, investigating not only also heavily the environmental exposures, but also really the impact of large infrastructure development projects, and really also trying to find the balance between the adverse and the positive effects of these infrastructure projects, which I think is very much also at the heart of climate change discussions. Where is the right balance? So we're really looking forward to your presentation.
New style. Okay, welcome all together.
Yes, welcome also from my end. You see, we're getting started. We have a plan, so don't worry. And over to you again.
Okay, so the plan is that if you have not done yet, that basically you also connect to this website that is written everywhere with the Mirko Winkler side. And just to start also, I think what we present now and all these activities is also quite inspired by the Lancet Countdown. For me at least, this was really one of the Lancet Countdown from last year where the health system has put and the CO2 emissions from the health system has been made as a topic. I thought this was very something that had an impact on my thinking as well.
Yes, and from my end, what I have to say first, thanks for the introductions, Nicole. And also, we are both very excited to be here right now because of three reasons. That's now my personal assessment. One is it's of course the perfect event for talking about how to decarb Swiss TPH. And so the event for this is great, and it's great to have the last presentation. And of course, we hope that you're still up for another one, and we will engage you. And therefore, again, please, if you're bored, then just try to connect. You will see then further how this will work. Second, personally, I think that presentation is also what makes this entire symposium coherent, because we have been talking about climate change opportunities, but mostly about the problems, the challenges that come with it. And I mean, we're part of that problem because I dare to say that we also are quite heavily contributing to CO2 emissions. And that's why we shouldn't only talk about the problems that come, we should also reflect on what is our responsibility and how can we improve. And then the third is, and we mentioned it, we want to engage with you because the strategy, that's a work in progress. It's quite advanced already, but it's not final yet, and there is many details that still have to be sorted out, and that should be together with people from Swiss TPH who are concerned, but also you as an audience. Of course, we are very curious to hear more also from you when we talk about decarb strategies. Now we will do this together, and we have kind of defined who does which slides. Now we want to show you the poll everywhere, because first we wanted to do it with the app from the event, but then we had to activate Plan B. So please connect. Let's see how many are already connected. I'm seeing here it's 30. So you are about 100 people. So it would be great if we could achieve, okay, so I just want to say 50, but now I go up to 80. So please, 80 people need to connect. We're at 66, 68, and yes, we're getting closer. So you see how this works. It's really interactive, and we will have a series of questions for you. As you will see, we have reached 80, so that's really great. And of course, also people who are joining the event through virtual networks, they can also connect. So let's have a first warm-up question, because we talk about decarbing Swiss TPH, but such an institution is, of course, many individuals.
So
and
we have 100 now.
We have 100. Wow, fantastic. So that makes it even more interesting. Now to hear from you, what is your personal life decarbing strategy? What is your main life decarbing strategy at the personal level? Interesting. There seems to be one person more or less, or a few that have none, but 2%. So yes, overall, it's nice to see that the large majority really has a strategy, and there is different strategies. And the main one right now, maybe also because we're in Basel, is coming to work by bicycle. And good, it's still changing. We are at 116, wow. We should stop at 100, because then the percentage would translate into counts. However, no, let's move on. So thanks for this first vote. And that was just a warm-up. It will get more specific in subsequent polls. All right, we talk about the Swiss TPH decarb strategy, and we will talk about where we're coming from. We will also talk about what is the objective of this strategy, and also what are the main pillars. We're not going into every nitty-gritty detail, but then also at the end there is an outlook. So where are we coming from? In March this year, there was in the Horizon, that's kind of a journal from the Swiss National Science Foundation and also the Swiss Academies of Science and Arts. They have this, I think, every month or a couple of months, they have such a newspaper or whatever it's called. And there you see already on the title, it's in German, but it says, science has to reduce CO2 emission. And so that's kind of a first quite strong message from one of our main funders, the Swiss National Science Foundation, that was there. And of course, also the Swiss academies are very important for Swiss TPH at large. 2 months later, there was an event that was very well attended, and there were very lively discussions in Bern, and that event was organized by the Swiss Academies of Science, and the title of the event was Decarb Science, but how? And as I said, it was quite intense, and also there were many examples featured, and you will hear more about the examples later on. So that was now more a bit about the national level, but also local level, University of Basel. You may not be able to read here. It means October 2019, for the first time, the University of Basel, they published a sustainability report, and there there is some quite specific recommendations what should be done. Not going too much into details, but here you see in blue, one option is to reduce flights, and of course there is many other options. But you see, so national level, one could say science, there is a dictate that we should decarb, but also here, local level, there is guidance and advice on this, and that, of course, also affects Swiss TPH as an institute. Now, there is another question for you. If we start to reflect on how to decarb Swiss TPH, there is different action fields. So, now for Swiss TPH, you have these 6 options. We could work on our energy-friendly buildings or cafeteria. Also, that includes then the lunch, commuting, business travels, waste reduction and management, or others. So now we have almost 70, and we see that the majority says that one of the main action fields where we have potential to reduce is business travels. Now we're above 100, and the second most category selected is energy-friendly building and facilities. So I'm now asking Martin to tell us some facts about what has actually most potential from an evidence-based perspective. Please, Martin, can you tell us?
Okay, thank you. So as a scientist, we want to have a look into the data. So this type of exercise has been done by other universities in Switzerland, and this is the example of the EPFL in Lausanne. They had done a study on their environmental footprint. Okay. And as you can see, business travel is quite high on the agenda, about a third, a little bit more. Also commuting is very important, which has not been voted before. And then obviously the building and the process in the buildings, that is an important factor for EPFL. If you look a little bit closer into business travel, you see that most of the travel or most of the CO2 is related to intercontinental flights, about 5,000 tons of carbon dioxide equivalents. It's always a bit difficult with these numbers, but let's put it into perspective and maybe just make a traditional vote now. We have, in this symposium, we had 8 overseas speakers, and they have not come here. If they had come here, how many tons of CO2 had this produced? I just did the calculation before. Any guess? 20? Not too bad. 40? 16? So I came up with 28, but very conservative calculations, all direct flight to Zurich, all economy class. That is what we came up, 28 tons. So quite a lot. If you think, what is 28 tons of CO2 equivalent? If you live in Chad, this would be 560 persons for a whole year, their footprint, just to put it a bit into perspective. Also, the ETH has done such an exercise, and what you can see in terms of travel, basically about 2/3 of the travels which are done are due to conferences, then workshops are important, and some other travels. Also, maybe interesting to look who is traveling, and maybe not a surprise, professors are much more traveling than students. So 11 students in terms of CO2 are equivalent to 1 professor at the ETH. So these are some results from the other university. In Swiss TPH, we haven't done the full exercise. Kaspar Wies has done project work and also done some kind of estimation how much CO2 we produce from different sources. And it's clear, if you look at the portfolio of the Swiss TPH, we're traveling even more than ETH or EPFL. So it's probably quite safe to assume that about 60 to 80% of our CO2 is actually caused by traveling and business trip. So the strategy that we have developed, we started in March, I think. This was March. At the retreat, we had involved many people also here in the room to think about how can we move forward. We had several meetings between, and the overall objective of this strategy is to provide guidance on how to reduce the CO2 emissions of Swiss TPH with a real focus on flight reduction strategy. During the process, a lot of other ideas came also up, but we realized we have to focus, at least for the first step, on the most important target. And we also want to make very clear it should not compromise on excellence. So we don't want that just because we don't travel, we cannot be excellent anymore. And this is now a question to you. What do you think? Will a flight reduction decrease scientific productivity at Swiss TPH? Interesting, huh?
Mm-hmm.
So the majority thinks a little bit, some think very much, some not at all, and some think it will even increase. So, of course, I don't know, and it's a prediction or a projection, as I have learned from the climate modeler, we would call that somehow, but others have tried to do some estimate. The University of British Columbia, they have done an estimation, what is the correlation between air travels and scientific productivity in their unit, and they found no relationship between how much people flew around and how productive they were in terms of scientific output. So at least, I think it's a good start if you want to go in that direction. So let's look a little bit deeper in that strategy, and I just mentioned a few names that have put input. Probably we forgot a few of them, sorry for that, but it's really a lot of people have provided input, and we are very grateful for doing that. And at the moment we have this two-pager, and we don't want to go into details, it's also still in the process of being finalized, but Mirko will now look a little bit deeper into some of these aspects that we want to change in the future.
And we could say that this strategy right now, it comes with like 3 pillars. And the first one is what we consider the most important one, and it's basically to avoid air travel whenever possible by assessing the necessity of air travels. And of course then in the strategy, there is more details on different options that you could consider. And therefore, let's not go now into the details, but let's again ask you a question. Because now you have experienced already kind of a reduction strategy. Not all the presenters were here physically. Now if you reflect on this symposium, your overall appraisal, the fact that they not all were here, but that we had some virtual presentations, did that negatively or positively more or less affect your overall appraisal of this event? And wow. Personally, I very much like what I see. We are close to 100 soon, close, I said. But more than 50% actually perceived this as positive. And I think that's a very interesting finding, because we are often, also when we had discussions, people are afraid of trying alternative ways. But I think that's really a very nice finding that it can work, and for 57% of the people who have really been part of this, they even perceive this as very positive or positively, then minor positively. So clearly, most of the people are more on the positive side than on the negative. Great, so that has a clear message. So we should consider this alternative in the future. At the same time, we also know there is a value added if you are attending a conference physically. Also, for example, in terms of networking. And when we developed the strategy also, we thought, well, should we actually define certain things? Like, for example, how many conferences can or should a senior scientist attend every year. Should we set kind of a limit or not? And that's a tricky question, and of course there is different opinions on that, and we would now like to hear from you. What would be your recommendation for senior scientists? How many conferences per year? Emphasis international conferences, assuming that maybe it involves flight traveling. And here it seems like the favorite is 2 international conferences per year for a senior scientist. And that would clearly be below what they found at ETH Zurich in terms of the current practice when it comes to traveling of senior scientists. Great, so that also very nice to see, and the 2 is still there with over 40%. Okay, so we should reduce the number of travels, flight travels primarily, because they contribute most to CO2 emissions. But still, it's very clear, Swiss TPH, researchers and others, they need to travel from time to time. But of course, there's different means of transportation. Flight travel, of course, the most CO2 intensive. And so, yes, we should consider also alternatives. And I give you an example here. There is a movement on Twitter, Scientists for Future. They have committed to not take an airplane for distances of below 1,000 kilometers. That sounds nice, but if you think of, okay, I go by train 1,000 kilometers, this can easily take 10, 15, 20 or even more hours, depending on where it is. And so, yeah, that's quite a commitment here. And so that's an option, but there is also other options, and we would like to hear from you. If we set, for example, a default for the decarb strategy, what should that default be in terms of how many hours can you expect somebody to travel by train instead of airplane? And that's the next poll. What would there be your suggestion? There is a comment. It involves both. Would you agree?
Yeah, I think both.
And I mean, we have not defined this yet. That's why, we're working on the details, and that's an appraisal.
I think we will move the question to the HR.
Very good point. All right, so interesting. So here it's not a very clear picture. We see it ranges basically, the majority is between 6 hours to 10 hours, also 12. So that's also, for us, it was not clear also in the discussions when we developed the strategy. It seems like there is also, of course, many factors in the game because, do you travel on Sunday or not? But also, for example, whether you have a family at home or not, that can also make a difference. And that's why it's such a hard one. And that's why we appreciate your appraisal, because this could influence such a default value if such is included in a future Swiss TPH decarb strategy. So thanks also for this appraisal. Now, the third strategy is also, of course, to minimize CO2 of Swiss TPH building and local operations, and also you voted for that at the beginning as an action field, and of course that's also an important one. So we should not only talk about flights, we also need to do other things, and then clearly we should, wherever we can, try to become more CO2 sensitive. And as most of you might know, Swiss TPH is moving into a new building in 2021, and it's already part of the planning of that new building that it is a sustainable building to the extent possible. Therefore, not more on this, but let me just emphasize again, it's kind of a stepwise approach. No, not stepwise, but just before considering alternatives, it's not flying. That's always the best option, and if you have to, then choose CO-friendly travel alternatives. So much on the travel, and then there is a third category or third topic around the operations. Now there is a next poll, because there is many ideas and also there is a lot of controversy about the specificities of such a strategy. And yeah, there is the question, how should we now actually promote this? Here you see different options, so please, another vote from your end will be appreciated. Yeah, I'm personally now a bit sad because my favorite, option C, to compensate out of the own pocket, because that really hurts. Yeah, that was my favorite. What do you think about the votes that we get?
Yeah, maybe it's also quite tough to decide for one measure only. So maybe your C was the second vote for everybody, but it was just did not made it quite often to the very
Feeling
top.
better now.
Yeah, but obviously you see there's a lot of difficult questions to solve. There's a lot of diversity at our institute, different people, different situations that you want to take into account, and that makes, of course, such a implementation of such a strategy also complex. You don't want to introduce disadvantages, inequalities within the institute, and that is why I think this is really something needs to be ongoing. We need to learn, we need to mutually learn from each other, and it needs a kind of sustainability officer at our institute which helps to educate the whole staff how to do, to also think about what are feasible monitoring and reporting concepts. All sounds very nice if it's here on the screen, but as soon as you have to start to write down and monitor your own activity, you get a little bit more, maybe less enthusiastic about it. So things like that we have to think about, and then that we really can iteratively improve our strategy and have a kind of committee where also all these people who have already started to provide useful inputs can still do that in the future. So that is where we see the future of Swiss TPH, and the question is now, should we have some kind of strict target or not? What do you think? How should we help to implement that? What should be our main aim? Okay, yeah, it seems 2 targets are in favor. Each year 11%, or being CO2 neutral by 2050. I hope that those who voted for option C did not think, then I'm retired, I don't care about it. Okay, but it seems a clear will that it would be good to have a target and to move in that direction to go there. So that is our outlook and the final statements. We want to now fine-tune this strategy and continuously improve and really hope that we can contribute to a reduction of CO2 emissions of the Swiss TPH in the future.
Martin, put it down for me. So I actually would like to also ask Roland and Chris to come to the podium so that we can really sort of have a joint discussion and not just like this one-to-one. I don't see very well to the back. Do we already have questions from over the internet? A lot or just 4? Okay. Then maybe like to just wake you all up. The idea is that there is going to be 2 questions for each speaker. That means Martin and Mirko is considered one speaker. And I really want to give the word to you now. Ask your questions. I would actually start with the questions to Roland Hohmann at the beginning. How do you want to build the cities? What are the recommendations? Do you not have any questions? Or yeah, back there.
Just one question about heating oil. So I come from a country where heating oil has been banned since the 80s, and I'm always surprised in Switzerland to see so much oil being used. I'm not sure, and it wasn't part of your presentation, but when is there a ban on black carbon and soot from heating?
Well, I must say that heating oil is part of our Carbon Dioxide Act, and we have a levy on heating oil. And thanks to that levy, we were able to decrease the consumption of heating oil quite a bit during the last couple of years. The proposal by the Federal Council to Parliament contains a limit, an emission limit for new buildings which will be built in the future, and this limit basically is equivalent to abolishment of fossil fuel heating, but it's not in place yet. So, yeah, we're working on it. I think the more important question is, what do we do with traffic at this moment? Yeah.
In the back there is another question. Is there somebody with the microphone in the very back?
Yeah,
Jan Kind from Adelphi. Thanks. Hi, Roland. Thanks for the great overview. I was expecting to hear a bit more about opportunities. Could you expand a bit on opportunities you see and how these were assessed in the work you presented? And as a sub-question to this, I saw on the excess mortality graph a strong peak in February 2015. And I don't know what happened in that month in Switzerland, but maybe in the future we'll see less excess mortality in winter due to rising temperatures. Just a thought.
Well, let's first talk about the assessment of opportunities. It goes without saying, or one of the conclusions of the risk assessment was that there are tremendously more risks than opportunities. Nevertheless, there are some opportunities which I didn't show in the talk because I was focusing on the health sector. Of course, you would have a decrease in cold-related health problems, but these are not that important in Switzerland. We don't have tremendously many people dying during a cold wave because our cold waves are not so cold. But let's say there will be less accidents due to ice, on ice or snow. Opportunities will be maybe for the tourist sector. So we expect that the tourism in summer has an advantage compared to other countries because Switzerland is not getting hot that fast as, let's say, Italy or the southern part of France, implying that many more people might stay at home and go to the Alps for a hike. So this is an opportunity. Or also for the agricultural sector, provided that there is enough water for production, that there might be an increase in quality of certain kind of products. With respect to the peak of excess mortality in winter, I would propose that Martin is answering this question because he is the expert, clearly. It's not me. But it has to do with the flu.
Yeah, it's the flu. It's the flu epidemics that makes this peak. So that is the main driver, and I think that's actually also a problem in many of these studies that doing cold-related versus heat-related death or morbidity, basically they usually don't have local data on flu epidemics. And I think to some extent this also leads to a bias that during the cold season, I mean, this is not really the temperature, but it's just the flu that is more prevalent, but has nothing to do with whether it's a few degree warmer or the colder, you still would have flu. And of course, this needs also to be considered.
Is there a question to Roland Hohmann from the over the internet? Yes.
Maybe you want to answer.
Do I read it here? Who? How do? Okay.
Anna will
here.
probably say something about the flu.
Sorry. Yeah. I just wanted to add something about the discussion on the cold-related mortality and the projections, because it's something that we have been discussing a lot within the, let's say, within the MCC, and also studies on, let's say, on projecting this temperature-related mortality in the future. And the main problem is that when we try to project cold-related mortality in the future, we should think that most of the cold-related deaths that we see today is not mainly due to temperature. There are other factors. So basically, if you try to project only based on let's say, projections of temperature, of course, you end up having this kind of null net effect because of this decrease that you expect just because we are exposed to warmer climates. So I must say that we should be careful about thinking about opportunities that in a way cold-related mortality will decrease, because we are completely unsure what is going to happen regarding this part of, let's say, this range of temperatures.
Thank you very much, Anna, for this important point, because, I mean, of course, there are, when we also think about nutritional aspects, we know there are benefits, but I think we have to be incredibly careful in how we look at them and communicate them in the light of all the adverse effects. Okay, can you show, or do you know the question? Did you? Okay, so there is a question to Roland. What measures is Switzerland using to ensure net zero carbon emissions by 2050? Is Switzerland on par with achieving this goal? As a rich, high-tech country, why is Switzerland not setting an earlier target?
Many good questions.
Give another
so I think this question has a short-term and a long-term perspective. On the short term, we just use the existing measures which are written in the law, which were defined by Parliament. This is basically the levy on heating fuels. It's the building program, which means part of the revenues from the levy are being used for energetically refurbishing the existing buildings. It's the emission trading. With that, the emission trading system of Switzerland will be linked to the European one to make the market bigger and have a more realistic, hopefully more realistic carbon price. Then there is the technology fund, which tries to improve innovation in the technology field to lower emissions. Do I get another one? There's technical limits for emission limits for new cars, and there's a compensation obligatorium for importers of carburants. So these are the existing measures. Saying that, Switzerland committed to go to a net zero until 2050, but all the instruments that they need to be defined by the further political process. As you might have heard, the State Council, which is the small chamber in Switzerland, they talked about having a levy on air travel. So this will be in favor of the Swiss TPH carbon strategy. And it's also in discussion to create a climate fund to also have projects on mitigation. But that's just the state as it presents itself right now, and it will be a matter of the coming debates whether or not these instruments will be strengthened. I hope this answers your question.
Great, thank you very much. I think we will move on to 2 questions from the audience to Chris Murray's presentation. Here is your first.
So, thank you very much. I'm a great fan of the Lancet Countdown since many years. I truly appreciate it. It's very helpful for me, but it's a question from a clinician. I am a medical doctor involved in clinical practice. How could you help to translate, this idea, this great idea of the Lancet Countdown to the clinical practice? Could you help on that? One of my questions, if I can, if there is other clinicians in the room, I would truly appreciate to have this kind of discussion, because probably one of the ways is to share. I'm wondering, for example, if there is a working group about this specific question, how to translate in clinical practice. Thanks for your help.
Yeah, sure. That's a fantastic question. I should say that the Lancet Countdown is composed of a bunch of clinicians. So our executive director, Nick Watts, he's a clinician, and the chairs, Hugh Montgomery, he's an emergency medicine surgeon, and so that we have the presence of clinicians on the Countdown team. The strategy at the moment is to try to team up with national organisations, for example, whatever a national organisation of clinicians would be. We have, for example, relationships with societies of nurses and societies of doctors in different countries. And I was talking briefly about the policy brief mechanism. Some of those are in collaboration with these national assemblages of medical professionals, including clinicians. So that's the main way that we've tried to make that connection. As far as a working group goes, I'm not aware that there's any specific working group associated with it. It's a great idea. And for sure, if you suggested that through to the Secretariat, they'd be able to give you a clearer response on that. So look up on the contact details online, and feel free to get in touch and propose such things.
Is there any other clinicians, practitioners in the room who have a thought on this? Is back there? There is a question in the front here.
Hello, Seixas from the Institute of Hygiene and Tropical Medicine in Lisbon. I think one of the main fields where we can be quite assertive is in travel medicine, which we do also at the Institute. Pre-travel consultation is a field where you can stimulate and educate your travelers not to travel. I mean, or travel in a more rational way. I mean, it's quite stupid. I see travelers from time to time that go from Lisbon to Egypt for a weekend, and they get a nice diarrhea, which is a good opportunity for me to say, what were you doing for the weekend in Egypt, But seriously, I think it's a very interesting field where we can try to educate our travelers to travel more efficiently, to travel including the reasons for traveling. I mean, citing this fantastic book by Alain de Botton, Travel, most of the times people do not know why they are traveling, what they are looking for when they travel in a certain way. Thank you very much.
That sounds a little bit like the dentists that were so successful that they don't have bad teeth to treat anymore. No, but I think that's a very great comment, and thank you for that. I actually dare, even as a moderator, to just follow up on this. Would you, Chris, know and think, or is the involvement of scientists, because a lot of it, social scientists, because a lot of it has to do also with stimulating behavioral change, including in traveling?
Yeah, again, we do have social scientists on the team to help try to input on that front. Behavioural change is, as many of you would know, an incredibly difficult area, and affecting behavioural change at the individual level, as far as I can tell, has been a relatively uphill battle for a whole lot of health conditions, and nevertheless, clinicians do have the opportunity to be engaging with the public at a very personal level, and so a lot of the behavioural intervention, opportunity could potentially lie with this relationship between doctors and patients that are coming in for consultations. Social science side of things, I saw before when I was reviewing the app on the questions that came in during the session, there was a question about migration, and so we've had in the past an indicator that has been led by social scientists predominantly to try to work out what the connection between climate change and migration has been. It's a very difficult area, but yeah, there's a huge role, I guess in summary, across all of the different indicators, there's a huge role for social science input and improvement of the way that we gather some of that data for sure.
Any question over the internet app? Yeah, okay. So, gonna. Okay, dann mache ich noch. So there is a desperate question, I think, in the back, which I'll come to after this one. Is there a policy for junior scientists travel? They are the ones who still need to build up their networks. That goes to Chris Murray. To Swiss TPH. Okay, so maybe, okay, so why don't you answer this?
At the moment, we don't have, I mean, there was a long discussion that we should set some strict limits. And we thought it can go both ways. In the vote before, there were 2 travels for a senior scientist. But actually, this may create some incentives in both directions. So somebody may think, I had only one, I need a second one. So that is why at the end we don't think we want to have a strict number, but rather have people being aware and thinking what is most important. And being at the junior scientist and taking into account, which is certainly very important, that junior scientists can go to international meeting and build up their network. Otherwise, it would be very difficult for them to go into the next career step. I mean, that's clear.
So maybe I would like to give the word actually to Mirko, even without you asking me to give you the word, because I know you are exactly, not that you're a totally junior scientist, but I think you're at this level of your career where you have a lot of projects in the south that you have to be present. So what is your perspective and experience on this?
Thanks, Nicole. Because in the strategy also we stress on that we should not compromise also on career development. So really also placing emphasis on the junior scientists. And there is several options. Clearly there should not be any negative impact on career development, particularly for younger people. But so you asked me about my own experience, and there I would say, I think sometimes it's even the seniors that could promote younger scientists by saying, I'm not going, why don't you go? So you can also switch it the other way around, and that's also something we really emphasize. Often we also see that the seniors and the juniors, and it's a big team going, and we feel that also there we should become more selective to just reflect on who actually needs to go. Maybe there could be fewer, and why not having more the juniors in front rather than the seniors, and that's just what I wanted to add to this.
Great. Was there one question also for Chris Murray over the app, or? Okay, so first while you look, there is the question in the back, sorry.
Yes, thank you, Nicole. Manuel Hetzel from Swiss TPH. My question is not very desperate, but it was to Chris, so I'm just bringing it back up now. I haven't read the Lancet Commission report, but a week ago I was at the presentation of another Lancet Commission report of malaria eradication. And what struck me there was that 3/4 of the authors of the report were from countries that were not affected by malaria. It's different with global, with climate change, of course. But what I still find interesting is in all the institutions, I saw ILRI and INDEPS, I think, as the only institutions from the Global South that were represented. And maybe I overlooked one. So how are we going to make sure, how is, for example, the Lancet Commission going to make sure that the voice of those who are currently probably most affected by the effects of climate change are really being heard, that their concerns are being heard, that their priorities are being included in the long-term planning that is being made, and that in the end we're not sitting in the wealthy north telling people in the south what to do to solve the problems that we created.
Yeah, that's a great point. It actually comes up pretty much every meeting, every kind of planning meeting that we have. Every year we have an annual meeting, and this issue comes up about the representation of affected communities around the world, and there's an ongoing effort to strengthen scientific collaborations with other research institutions all over the world to try to better balance out that representation. More broadly, I think, and specifically to the Lancet Countdown effort, the way that the participating membership has built up has been a fairly organic kind of a process. So the general pathway of becoming involved in the Lancet Countdown in terms of developing indicators is that people read a report or whatever and get inspired to think about the way that their own research interests could contribute to that. There's a template that we have that you can download, and you can pitch an idea for an indicator through to the executive or the secretariat. They'll consider that. There's a review process through, with some discussions with the proposers and whatnot. So there's this process of building up the necessary kind of combustion to get an indicator moving and going, and then eventually you're published into the report. And that's primarily a bottom-up kind of approach, as opposed to the other way, which would be we reach out to specific people to fill certain gaps that we feel need filling. That also occurs, but the main pathway is the other way. So at the moment, the majority of the indicators that have finally ended up on the table have come through from presumably, better resourced countries, people that are already in contact with that literature, rudder. And there's a huge bias in the climate change literature itself. If you look at the IPCC report, there's areas of the world that are just tragically underrepresented in terms of the scientific evidence base that's moving through, that we have then access to leverage for the countdown. So it's a little bit of an entrenched problem that's not restricted to the Lancet Countdown, I would say.
So, Chris, let me ask you, is there a strong wish from your side to us at Swiss TPH for parameters that you think are, you mentioned gaps, you mentioned the need to bring people from the low and middle income countries on board, where you think Swiss TPH, that is really an area that we should engage in?
Yeah, I probably don't quite have the authority within the Countdown team to, request, new teams to come on board myself. But I know for my own indicator suite, which is the infectious disease indicator suite, it's one of the indicators that is evolving very rapidly every year. We've added a new disease every year, for example, and that's been mostly a process of me wanting to expand that indicator to become increasingly relevant across a higher number of diseases, and to take in a greater sort of fraction of the burden of diseases that are climate sensitive. And so we were chatting last night at dinner about many of the talks were, in this meeting have been about diarrheal diseases, a lot in sub-Saharan Africa, for example, where we have limited representation on the Lancet Countdown team, but also clear research strengths at TPH for being in those locations and looking at these types of conditions. And currently, basically any proposition of a climate-sensitive infectious disease that is of global relevance, that meets the criteria of the Lancet Countdown, has a possibility of being embedded at some point into the Lancet Countdown. So I'd be very, very curious and very interested to discuss with anybody that has any ideas, and that's not restricted to the infectious disease indicators, but it applies equally to any indicator suite. There is a process to get in touch and have your have your ideas heard and hopefully developed into a point where it can join the indicator suite.
Great, thanks a lot. Is there online questions? Yeah. And maybe you say for whom? For a TPH presenter, so that's timely, on intercontinental travel, how can Swiss TPH continue to do tropical disease research and services without TPH research teams traveling to tropical countries on multiple locations and working hands-on in those locations?
I mean, this question, it's very clear that Swiss TPH will continue to travel. I think, yeah, it's not going without this. So we never said that we should stop this. We should just try to reduce and to just carefully consider how much travel is needed. It's needed, so much is for sure, but we are also very sure that we can reduce it to some extent. And how much, this is something still we have to define, and we discussed this also in the course of the presentation, but yeah, we need to travel for doing our work, and to what extent we reduce and how, that's exactly what we're discussing.
I mean, sometimes it's really the very simple, small things. Just an example, last or 2 weeks ago, somebody from Southeast Asia should have come here for an exam of a PhD student. This is according to the rules of the University of Basel. Just asking whether this is really necessary has changed the process, and this person had not to come and was done with a Zoom meeting. I mean, this type of travels easily, without any excellence lost, can be avoided, even saves money and may help to invest that money somewhere else where it's more needed.
Or another example would be sometimes you could potentially combine two project missions. So instead of flying once to South Africa back home and then to Tanzania, why not trying to do it in one trip and save 1 or 2 intercontinental flights. So there is possibilities. And also often I have seen that it's kind of very normal if there is a master student somewhere in the field, then also the supervisor would go and maybe somebody else. But I believe it's not always necessary, and you can also, with a good preparation, you can also sometimes avoid that there is too many people going to the same location.
Sebastian?
So thank you very much for working on this strategy. I'm following up on one of the comments. We very much are talking about Swiss TPH people traveling outside of Swiss TPH. Now, so what about people traveling to Swiss TPH? For instance, the case you just mentioned, Martin, the person who finally did not have to come for the PhD defense. But as you just said, it's very much still the rule, which I think personally is stupid, to have PhD committee members to have to come to Swiss TPH for defenses, for instance, as opposed to be able to do this by Zoom or Skype or otherwise. I mean, so perhaps we should also include this discussion into the strategy. So how do we deal with people visiting Swiss TPH, be it the PhD defenses or other things? Do we have regulations? People cannot come by plane or only by bicycle or etc.
I mean, one important strategy to also facilitate this is, of course, also linked to facilities that you have. And at Swiss TPH now, we have very good facilities for doing this, but also something that we mentioned in the strategy, we should also consider to upgrade video conferencing facilities and so forth with our main partner institutions, because, there's many things needed to tap this potential that there is. And
one point in the strategy is, for instance, that if you run a project that you really plan ahead, how to combine different events, different things. I think a lot of travels just are due to the fact that we don't plan, and then on a short notice you have to go somewhere. But in principle, you could have combined 3-4 events. You could have combined your project team meetings maybe with other conferences when everybody was already there, and things like that to have this awareness of how you can minimize your travel.
Okay, I just see that the audience starts to thinning out, but I do not want to miss giving some thank you notes. So, is there another urgent question from the audience? Otherwise, as a last one, I would have one to Roland Hohmann then. There is, yeah. I don't see very well because of the lights. Yeah.
Thank you. I just want to ask you, this is more on the government level, who should take responsibility that the flights become so accessible to everyone? For example, yesterday I bought a flight ticket to my homeland, which is cheaper than the train ticket coming from Bern to Basel today. So who should take this responsibility, and why we don't put higher taxes on these things as we put the taxes on all other hazards, or cigarettes, alcohol, etc.?
That's probably a question for policy.
It's a tough one to answer. I mean, do you hear me? Yeah, now you hear me. It's a tough one to answer. I think it's a part of a political process which needs to come from the voters and from the electors. I mean, basically, it will be the governments who have to regulate this somehow, to have a truth in the pricing. But up to now, this is not the case. This is due to the way our parliaments are put together. You know, maybe this will change in the future. But it is, I agree with you on a personal level, it is ridiculous that to get you from Madrid to Zurich, it's cheaper than from Zurich to Basel. It doesn't make sense.
There is one last burning question, I see.
Hi. So I think it's really great that Swiss TPH is making a strong effort to cut down on its CO2 emissions with flight travel, but I mean, it is only one institution. Is Swiss TPH taking some of these strategies that they're implementing for themselves and consulting other universities or institutions with some of the planning that they have for themselves? Good question.
We don't have a kind of dissemination strategy, and at least in Switzerland, as Mirko has shown, there's quite a movement, and I feel all the universities are taking this serious to move forward and achieve. At the end, I think it's also personal responsibility. For instance, just to come back to this thesis example, whenever I'm invited for that, I'm also asking now always, is it really necessary to go there and to say that in our policy this would not be the case, and to raise this awareness also in international university for this type of travel. And I'm convinced, given the global discussion on that, academic institutions all over the world will move in that direction.
And microphone, please. Thanks. To complement also, now in the course of developing this strategy, there was with 3 people from different institutions that I mentioned this, and 2 of them, they asked them whether they could have this strategy as an example, and I know of many others. I think everybody in Switzerland, most institutions, especially when they're linked to science, are currently working on this. But what I wanted to say here is also, of course, what I believe is also very important is that our, for example, funders, like the Swiss National Science Foundation and other programs, often also they have kind of their rules, how often you should travel, also when you collaborate with partners from abroad and so forth. And I think they also need to maybe switch and reconsider also sustainability in their own project funding advices that they're giving. So it's not only those doing the research, but also those funding research and others. And only this, then it can really become something holistic that everybody is working on.
Maybe just an anecdote here. For Swiss National Science Foundation is the gold sponsor of this symposium, which is very nice, and they have this funding scheme for meetings where they explicitly fund travel to the meeting, but they would not fund our quite expensive live streaming and so on. And that is what I will do after that meeting. I will ask them whether they should change their funding scheme and also include such kind of measures to be funded.
Okay.
May I pick this up? Yeah. I think that's an important point. I think we should not just always go for the cheapest way. Mostly air travel is cheaper than taking a train, both time-wise and financial-wise. So this, I think there needs to be a change in paradigm considering this.
So the last question really goes to you, Roland Holtmann. What is your strongest recommendation for us at Swiss TPH where we should take action? Be it the new building, be it our travel, what do you suggest in the line of your action?
Why do always I get the tough ones to question? I think the strategy presented was very nice, and I think that should be the way to move forward. It came to my mind with the remark before. I think it's not just the Swiss TPH that can adjust to and then try to organize more climate friendly, but I think all academia needs to change. As long as it's, I used to do science in the US, and my professor didn't go just to 4 meetings a year. He went more or less to 40 or 60 meetings a year, and that's ridiculous. Then I agree with the result of the poll that it might be more efficient from the scientific point of view of reducing travel.
Great, thank you very much, and thank you all to the speakers for the great discussions, to the audience, and with that, I think I move now to the closing words. I first and foremost really am not going to give a presentation very long, but rather it's really expressed as thanks. They go to Gelaccio, Martin Rösli, Mirko Winkler, Martina Regetli, and other colleagues at Swiss TPH for organizing this conference and for developing concepts for a climate-friendly behavior of our institute, for conducting research on these topics. You are really truly making a difference with your work, not only at this conference, but also with your work, also for the people most in need, and no matter how remotely they live. And I always make this point that this is something that makes me incredibly proud, where we actually work, no matter where and how hard it is to get there. So in the name of Swiss TPH and the Department of Epidemiology and Public Health, I would really express my deep gratitude for this. Gelaccio and Martin have organized this committee. Gelaccio unfortunately had to leave to a very sad event of a colleague that we lost. He will get the flowers next year, but next week. But we have, Martin, I would like to really thank you with flowers. And as you all know, no conference like this would ever be that big and successful without the communications team under the lead of Sabina, which did a great job. I'm always surprised. I think I will have to take a job together with Jörg. We decided to learn Twitter, to learn all these novel tools. It's just great to see what you can do with it. In your team, there is first and foremost responsible for the organizing of this meeting as much as many other meetings at Swiss TPH, Joanne Blackwell and Sarah Thiele. Thank you very much for also having been able to shift it here. Okay. And of course, I would also like to thank all the PhD students who really helped in many ways. That's how motivated our institute is. We held nobody's too good to do, no matter what work. I think that characterizes us. Thank you so much. And of course, the sponsors. And also the audience, which I think and heard was a really great audience in this room and across the globe. Thank you so much. Before I go to my closing words, can I maybe just have the last 2 slides that Joanne just reminded me of? There is an editorial by Martin Rösli and Gelacio Sisse produced from this winter symposium that will be published in the International Journal of Public Health, which is led out of our institute. This is great. There will be an issue on climate change and health. Please follow up on this. And the next slide is just to announce the new upcoming Swiss TPH Symposia. I hope this has set the stage for equally big symposia. One on molecular biology, epidemiology, and diagnostics of malaria. That's really the farewell symposium of two very long-term dear colleagues that are really going to be missed by all of us. And then in May, on the spring symposium from manufacturer to patient, reshaping healthcare supply. So follow up on the Swiss TPH homepage on this. It's not my position after this great scientific policy insight to really give yet another presentation. So I think my words are going to be a little bit more philosophical, actually following up on, I think, some of the points that have been mentioned already in the discussion. I think if you go back to my slide, if please, the one with the dinosaur. Here, there was really what I thought actually a very nice comment on why the debate about why dinosaurs went extinct. One thing very much, actually both of them, very much related to climate change issues. And I think we should always keep in mind when we talk about the important topic of climate change, yes, it is actually possible to extinct species through climate change. It happened with the dinosaurs, be it the volcanoes, be it the meteorites, although the difference were maybe a little bit different. But as science and public health experts, also in the light of this uncertainty we'll still have, we should keep some important facts in mind. The long-term health effects of the matter, and for that matter also the environmental health effects, including climate change, can never be studied in the context of randomized trials. I remembered this important topic to bring this up. After every air pollution talk I give, there is a clinician standing up and saying, would you talk about this rubbish, not really proven, you didn't do a randomized trial. So, but the fact is you can't randomize chronic environmental effects. And so long-term observational cohorts, big cohorts, administrative cohorts are really the gold standard to study these chronic health effects, which is not true for shorter-term effects. The availability of big data in the days of social media, certainly, and also the possibilities of biomarkers and also imaging in the future offers another opportunity to improve causal inference. But let us acknowledge that observational epidemiology will never be 100% causal when it comes to long-term effects. The science to policy dialogue has to acknowledge this. Policy in the light of uncertainty is a fact also for climate change related health effects, and I think also environmental and other effects, as we've learned. And that also sometimes is very difficult for us as scientists to then adequately address in the communication. What does this mean for us as individuals and societies? I think we have to learn to better take probabilities and uncertainties into consideration when setting policies. Strange enough, I'm very much also working in the field of personalized medicine, where we have, as Switzerland, just invested 70 million to set up the infrastructure, an additional 50 million in ETH, EPFL to strengthen research. That has very much to do with uncertainty and probabilities, but yet for some strange reason, this is not as much discussed as when we talk about environmental issues. And I think the more drastic the likelihood of adverse outcomes of an environmental condition, and that's certainly true for climate change, the bigger can the uncertainty be to justify taking action against it and invest adequate funds. And a WHO report that Martin just pointed out to me has actually been published by the WHO, just showing that while a lot of countries that were included in the survey have actually policies addressing the climate change needs, very little finances actually go into this type of research. And of course, we can only prevent against an environmental condition if we know how to act. In the case of climate change, we have to act, and the good thing is that we can act from the individual to the policy level. We can change diets, we can change our transportation habits, and related to this where we live, be it in the city center or very remotely where you have to take the car. We can change our vacation habits. We've just heard about this. We can change our resources and consumption of energy, etc. The good thing is also that action against global warming has also many positive side effects. It contributes to decreasing traffic-related air and noise pollution. It's not just an impact on the heat stress. It contributes actually to a generally healthier diet. It contributes to saving time traveling, and for that matter, gaining time with family and friends that live nearby. And actually, these local networks are really an important source against loneliness and, for that matter, well-being, especially also at older age. There are some caveats, and they have been mentioned when taking action against climate change. And we as Swiss TPH, together with our local global network of colleagues and research sites, are in a position to address them. Traveling less can jeopardize international and especially intercultural exchange and understanding. It could jeopardize that we find solutions against climate change and its consequences for health and migration together from our colleagues from across the globe. And it has been mentioned by Manuel Hetzel how important it is that it's not always us asking the research questions and getting the big grants, but actually supporting our colleagues to raise the questions that they have in mind. In fact, I think it could be dangerous, and I'm not against all the policy that we develop, but we have to be careful that then not all the climate change meetings and congresses start to happen again in Western Europe. That would not be a good thing. And it would be, and I think this interpersonal exchange, knowing each other personally, in days where we see an increase in nationalism is also something that we have to think about. And it would be particularly dangerous given the fact that most of the global warming is produced by our Western lifestyle and behavior, when actually the climate change effects are really truly affecting the poorest in the low and middle income countries. I would like to therefore conclude with saying, let us use our global partner network in various domains to tackle climate change research and find solutions together. Let us listen very carefully to the needs and expectations of low and middle income country scientists, policymakers, and also the people, and support them. Let us find the right balance between personal exchanges linked to traveling and remote exchanges, as done in this conference in a truly forward-looking manner. When you now go home, take the opportunity to each of you and us to think how personally we can contribute against global warming. It takes one drop to make a barrel of water overflow, and for that matter, each drop can thus prevent the barrel of water from overflowing. Thank you very much and have a nice weekend.
So much time wasted together, but playing games with love. So many tears we cried, so much pain inside. Baby, it ain't over till it's over. So many years we've tried to keep our love alive. Baby, it ain't over till it's over. How many times did we give up, but we always work things out. All my doubts and fears keep me wondering, yeah, if I always be in love. So many days we